1. Chronic obstructive pulmonary disease, COPD, is a progressive inflammatory lung disease characterized by obstructed airflow from the lungs due to emphysema and chronic bronchitis, which makes it a significant cause of morbidity and mortality worldwide, with smoking identified as the primary risk factor but also including genetic predispositions such as alpha-1 antitrypsin deficiency. 2. In COPD, the small airways become narrowed and the alveolar walls are destroyed, a phenomenon known as emphysema, which traps air during expiration and leads to hyperinflation of the lungs, making it hard for the patient to exhale completely, causing chronic airflow limitation and dramatically impairing quality of life. Three. COPD diagnosis is confirmed through spirometry, which measures the forced expiratory volume in 1 second, FEV1, and the forced vital capacity, FVC, resulting in a reduced FEV1-FVC ratio that is not significantly reversible with bronchodilators, indicating a persistent obstructive pattern. 4. The hallmark symptoms of COPD include chronic and progressive dyspnea, persistent cough often with sputum production, and wheezing, with exacerbations characterized by an increase in symptom intensity, often triggered by infections or environmental pollutants, thereby significantly impacting patient well-being. 5. Long-term exposure to noxious gases and particulate matter, primarily from cigarette smoke and occupational exposure to dust and chemicals, accounts for the majority of COPD cases, but recent research is exploring the role of indoor air pollution from biomass fuels used in cooking and heating, especially in developing countries. 6. Pulmonary rehabilitation is a cornerstone in the management of COPD, comprising of exercise training, education, and psychological support, which aims to improve the physical and emotional condition of people with respiratory diseases and empower them to better manage their symptoms. 7. Pharmacological treatments for COPD focus on relieving symptoms and preventing exacerbations, with bronchodilators like long-acting beta-agonists, LABAs, and long-acting muscarinic antagonists, LAMAs, being first-line therapies, often used in combination to maximize dilation of airways and improve lung function. 8. In COPD, systemic corticosteroids are used during acute exacerbations to reduce inflammation and improve lung function, although chronic use is limited due to potential side effects, so maintenance therapy often involves inhaled corticosteroids in conjunction with bronchodilators for patients with frequent exacerbations. 9. Emerging treatments for COPD include the use of phosphodiesterase 4 inhibitors such as roflumilast, which works by reducing inflammation in the airways and has been shown to decrease the frequency of exacerbations in patients with severe COPD and chronic bronchitis. 10. In COPD pathophysiology, the process of oxidative stress plays a pivotal role wherein the imbalance between oxidants and antioxidants within the lungs leads to tissue damage, ongoing inflammation, and further degradation of lung function, reinforcing the progression of the disease. 11. The destruction of elastic fibers in the alveolar walls in COPD is largely mediated by enzyme systems such as matrix metalloproteinases (MMPs) and neutrophil elastase, which become overactive due to chronic inflammation and contribute to the loss of lung elasticity and alveolar integrity. 12. Genetic factors in COPD play a crucial role, with the most well-documented being the deficiency of alpha-1 antitrypsin, a protein that protects lung tissue from enzyme-induced damage, and individuals with severe deficiency are at a much higher risk of developing COPD regardless of smoking status. 13. Imaging studies such as chest X-rays and computed tomography (CT) scans are used in COPD to assess for evidence of hyperinflation, increased lung volume, and possible complications like pneumothorax, with CT scans providing greater detail in visualizing emphysematous changes and bully in the lungs. 14. The chronic inflammation in COPD is predominantly neutrophilic, contrasting with the eosinophilic inflammation commonly seen in asthma, which results in different pathophysiological mechanisms and therapeutic responses, highlighting the intricate immune dysregulation present in COPD. Comorbidities frequently associated with COPD include cardiovascular diseases, osteoporosis, metabolic syndrome, anxiety, and depression, all of which severely affect the health status and quality of life of patients, warranting a comprehensive and multidisciplinary approach to management. 16. The Global Initiative for Chronic Obstructive Lung Disease (GOLD) guidelines provide a framework for the diagnosis, management, and prevention of COPD by categorizing the disease based on the severity of airflow limitation, symptom burden, and frequency of exacerbations, offering a personalized approach to treatment. 17. Oxygen therapy is a life-saving intervention for COPD patients with chronic respiratory failure, particularly those with resting hypoxemia, as it improves survival by preventing the harmful effects of chronic hypoxia and relieving some of the physiological stress on the cardiovascular system. 18. Smoking cessation remains the most effective strategy in slowing the progression of COPD, and nicotine replacement therapy, varenicline, and bupropion have been shown in clinical trials to increase the rates of sustained abstinence from smoking, thereby preserving lung function and improving long-term outcomes. 19. Lung volume reduction surgery, LVRS, can be considered for selected patients with severe emphysema-dominant COPD, as it reduces hyperinflation and improves lung mechanics, leading to better respiratory function and quality of life, although careful patient selection is crucial due to the associated surgical risks. 20. The impact of air pollution on COPD exacerbations is significant, with exposure to pollutants such as nitrogen dioxide, sulfur dioxide, and particulate matter leading to increased hospital admissions and mortality rates among COPD patients, emphasizing the importance of improving air quality through public health initiatives. 21. The use of non-invasive ventilation, NIV, during acute COPD exacerbations with hypercapnic respiratory failure can significantly reduce the need for intubation, improve gas exchange, and decrease mortality, making it an essential tool in the acute management of severe exacerbations. 22. Patients with COPD often experience muscle wasting and weakness, particularly in the lower limbs, which is attributed to a combination of systemic inflammation, inactivity, altered muscle metabolism, and nutritional deficits, necessitating targeted interventions such as strength training and nutritional support. 23. Advanced COPD often leads to pulmonary hypertension due to chronic hypoxic vasoconstriction, which results in remodeling of the pulmonary vasculature and increased pressure in the pulmonary arteries, eventually leading to right-sided heart failure or cor pulmonale. 24. In the progression of COPD, the concept of the phenotypic approach is gaining traction, recognizing that patients might have differing prevalent symptoms and pathophysiological characteristics, such as asthma-COPD overlap, ACO, which requires specific diagnostic and therapeutic strategies. 25. Exacerbation prevention in COPD relies heavily on vaccination, with annual influenza vaccination and pneumococcal vaccines being recommended as they significantly reduce hospitalization rates and improve survival by protecting against respiratory infections that can precipitate exacerbations. 26. In COPD, the mucus hypersecretion seen in chronic bronchitis results from an overproduction of mucus by enlarged goblet cells and submucosal glands in response to chronic irritation and inflammation, which contributes to airway obstruction and chronic cough in affected individuals. 27. Regular physical activity is associated with improved exercise tolerance and quality of life in people with COPD, as well as reduced risk of hospital readmissions after exacerbations, underscoring the importance of incorporating physical activity into the routine management plan for these patients. '28. Bronchoscopic lung volume reduction is a minimally invasive alternative to surgical interventions in COPD, using devices such as endobronchial valves to occlude airways in targeted areas of emphysematous lungs, achieving volume reduction and improved ventilatory efficiency. '29. Hospital-at-home programs for managing COPD exacerbations have shown to be as effective as hospital care in appropriately selected patients, providing benefits such as reduced healthcare costs, improved patient satisfaction, and a lower risk of acquiring hospital-associated infections. '30. Digital health technologies, including telemedicine, remote monitoring, and wearable devices, are increasingly being integrated into the management of COPD, offering opportunities for continuous monitoring of physiological parameters, patient education, and timely intervention, potentially reducing exacerbation rates. '31. The role of long-term antibiotics in preventing COPD exacerbations is being explored through the use of agents such as macrolides, which have anti-inflammatory properties and have been shown to reduce exacerbation frequency in certain patients with frequent and severe exacerbations. '32. Dysregulated repair mechanisms in COPD lead to structural changes in the airways and alveoli, including airway wall thickening and fibrosis, which contribute to the disease's chronic and progressive nature, highlighting the need for therapies targeting these underlying pathological processes. '33. Recognition of the single nucleotide polymorphisms, SNPs, associated with COPD susceptibility has opened the door to personalized medicine approaches and could lead to tailored preventive and therapeutic strategies specific to individual genetic profiles in the future. '34. COPD profoundly affects the systemic circulation, leading to extrapulmonary manifestations such as atherosclerosis and an increased risk of cardiovascular events, mediated by systemic inflammation, oxidative stress, and alterations in lipid metabolism, requiring cardiovascular risk assessment in COPD management. '35. Bacterial colonization of the lower airways is common in COPD due to compromised host defenses, contributing to chronic inflammation and exacerbations, with common colonizers including Haemophilus influenzae, Streptococcus pneumoniae, and Moraxella catarrhalis. '36. Cognitive impairment, including deficits in attention, memory, and executive function, has been observed in patients with COPD, possibly due to chronic hypoxia, systemic inflammation, and the presence of comorbid depression, impacting daily functioning and quality of life. '37. The economic burden of COPD is substantial, with direct costs related to medical visits, hospitalizations, and medications, while indirect costs arise from lost productivity and premature mortality, making it imperative to implement cost-effective preventive and management strategies. '38. Mitochondrial dysfunction is implicated in COPD pathogenesis, where oxidative stress and inflammation lead to impaired energy metabolism and cell death in pulmonary tissues, suggesting potential therapeutic targets focusing on mitochondrial health to slow disease progression. '39. In COPD, breathlessness is exacerbated by dynamic hyperinflation, where the increased end expiratory lung volume due to expiratory flow limitation and gas trapping during physical activity leads to increased respiratory workload and early onset of dyspnea. 40. The use of biomarkers in COPD, such as blood eosinophil counts and exhaled nitric oxide levels, is being researched to better stratify patients and personalize therapy, as they may help predict response to inhaled corticosteroids and other targeted treatments. 41. The development of fibrosis in the small airways in COPD contributes to fixed airflow obstruction, complicating the disease and limiting reversibility with bronchodilators, as the fibrotic tissue causes airway narrowing and impaired ventilation. 42. COPD complications include pneumothorax, particularly in patients with emphysema, where ruptured lung bully can lead to air escaping into the pleural space, causing the lung to collapse and necessitating emergency medical intervention. 43. End-stage COPD may require considerations for lung transplantation in eligible patients when medical therapies fail to provide sufficient symptomatic relief, with indicators for transplantation including severe airflow obstruction, hypercapnia, and frequent exacerbations despite maximal treatment. 44. Anxiety and panic attacks are prevalent in COPD patients, often exacerbated by breathlessness, leading to a vicious cycle of avoidance, deconditioning, and worsening symptoms that necessitate psychological interventions alongside pulmonary rehabilitation. 45. The heterogeneity of COPD is reflected in various phenotypes characterized by differing emphysema and bronchitis components, smoking history, and genetic factors, necessitating individualized treatment plans that cater to the specificities of each patient's disease presentation. 46. The use of statins in COPD patients is being investigated for their potential to reduce inflammation and improve outcomes beyond their lipid-lowering effects, as observational studies have suggested a possible reduction in all-cause mortality and exacerbations. 47. Sleep disturbances are common in COPD, with studies indicating increased occurrence of insomnia, nocturnal hypoxia, restless leg syndrome, and sleep apnea, further contributing to impaired daytime functioning and required specialized management to improve sleep quality. 48. The relationship between COPD and malnutrition is complex, as the increased work of breathing, systemic inflammation, and metabolic changes can lead to weight loss and muscle wasting, highlighting the need for nutritional assessment and intervention as part of comprehensive COPD care. 49. The role of endothelin in COPD is being explored, with increased levels associated with vascular remodeling and pulmonary hypertension in COPD patients, representing a potential therapeutic target to address cardiovascular complications associated with the disease. 50. Bronchiectasis can coexist with COPD, particularly in those with recurrent infections and mucus hypersecretion, characterized by permanent dilation and thickening of the bronchi, necessitating specific management strategies to address the overlapping disease presentations and optimize patient outcomes. One. Hepatitis C, a viral infection primarily affecting the liver, is caused by the hepatitis C virus, HCV, and can progress silently over decades, leading to chronic liver disease in approximately 50 to 80% of infected individuals due to the virus's ability to evade immune detection and establish a persistent infection. 2. The hepatitis C virus is predominantly transmitted through blood-to-blood contact, with intravenous drug use being the most common route, and despite substantial reductions in transmission rates thanks to blood screening, unsafe medical practices in some parts of the world remain a significant risk factor for new infections. 3. Diagnosis of hepatitis C involves both serological and molecular tests, where an initial enzyme immunoassay detects antibodies to the virus, followed by a confirmatory PCR test to measure the viral load and assess if the infection is active and requires treatment intervention. 4. Chronic hepatitis C infection can lead to complications such as cirrhosis and hepatocellular carcinoma due to ongoing liver inflammation and fibrosis, making regular screening and monitoring essential for those at risk or diagnosed to ensure timely intervention and reduce the risk of severe liver damage. Five. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering over 90% cure rates with oral medications that target different stages of the viral life cycle, providing shorter, more effective treatment courses with fewer side effects compared to older interferon-based therapies. 6. Hepatitis C exhibits 6 different genotypes, with genotype 1 being the most prevalent worldwide, and identifying the genotype is crucial in the tailoring of antiviral treatment plans that consider genotype-specific efficacy, optimizing therapeutic outcomes for the patient. 7. The liver injury from hepatitis C is characterized by immune-mediated mechanisms where the virus persists within hepatocytes, evading immunity and creating an inflammatory state that drives progressive liver damage and potential fibrosis, ultimately affecting liver function and health. 8. Liver fibrosis staging is essential in managing hepatitis C, where non-invasive tests like elastography can assess liver stiffness, reducing the need for liver biopsies and helping to guide treatment decisions and predict progression to more severe liver disease, such as cirrhosis. 9. Hepatitis C is not only a liver disease but also has systemic implications, with extrahepatic manifestations including type 2 diabetes, glomerulonephritis, and lymphoma, affecting multiple organ systems and significantly impacting the quality of life and prognosis of affected patients. The natural history of chronic hepatitis C infection varies greatly among individuals, with factors such as host genetics, viral genotype, and environmental influences like alcohol consumption playing critical roles in disease progression and liver damage severity over time. 11. Horizontal transmission of hepatitis C can occur through sexual contact, though it is less efficient than other routes, making it essential for patients and partners to take preventative measures, especially those with high-risk behaviors that increase exposure likelihood. 12. Effective public health strategies for hepatitis C control focus on harm reduction methods like needle exchange programs, safe blood supply practices, and awareness campaigns that aim to reduce transmission and promote early detection and treatment in high-risk populations. 13. Hepatitis C infection can lead to an alteration in liver enzyme levels, commonly presenting as elevated aminotransferases on routine laboratory tests, which can trigger further investigation into the viral status when considered in conjunction with appropriate clinical risk factors. 14. The introduction of universal hepatitis C screening guidelines for adults born between 1945 and 1965 significantly enhanced early detection of chronic infections within this cohort, who are believed to be at higher risk due to past healthcare practices that may have exposed them to the virus. 15. While there is currently no vaccine for hepatitis C, ongoing research is focused on developing strategies to induce robust immune responses capable of protective immunity, with the hope of one day preventing HCV infections and reducing the global burden of this liver disease. 16. In patients with chronic hepatitis C, co-infections with other blood-borne viruses, such as HIV or hepatitis B, can exacerbate liver injury, complicating management, and necessitating careful coordination of treatment regimens to address the interplay between these infections. 17. Reinfection with hepatitis C is a concern, particularly in high-risk populations, as past infection or clearance does not confer immunity, underlining the importance of continuous preventive efforts even after successful treatment, to avoid relapse or new infections. 18. Steatosis, or fatty liver, is a common histological feature in chronic hepatitis C, particularly with genotype 3 infections, and contributes to liver injury and progression of fibrosis by increasing hepatic inflammation and oxidative stress within the liver tissue. 19. Autoimmune phenomena are associated with hepatitis C, as the virus can trigger immune dysregulation, leading to conditions such as mixed cryoglobulinemia, which presents with a triad of purpura, arthralgia, and weakness, requiring integrated management strategies. 20. Despite universal precautions, occupational exposure to hepatitis C remains a calculated risk for healthcare workers, especially in situations involving needle stick injuries or direct contact with blood, highlighting the importance of post-exposure protocols and early intervention. 21. FibroScan is a valuable non-invasive diagnostic tool in hepatitis C management, using transient elastography to provide an accurate measure of liver stiffness, facilitating the assessment of fibrosis without the need for invasive biopsies, which can be costly and painful. 22. In hepatitis C patients, alcohol consumption accelerates liver damage, promoting fibrosis and increasing the risk of cirrhosis, making abstinence from alcohol a critical recommendation for lifestyle modification to prevent complications and improve treatment outcomes. 23. Hepatitis C and pregnancy require special attention, as vertical transmission rates during childbirth are approximately 5%, with risk enhanced by high viral loads, necessitating strategies to minimize this transmission risk and ensure prompt evaluation of newborns. 24. Chronic hepatitis C has been linked to neurocognitive dysfunction, affecting memory, concentration, and mood, a condition known as hepatic encephalopathy, which can occur even in the absence of cirrhosis, impacting daily function and quality of life for patients. '25. Combination therapies for hepatitis C that utilize multiple direct-acting antiviral agents are designed to prevent viral resistance by targeting different viral proteins, ensuring a higher barrier to resistance and increasing the likelihood of treatment success. '26. The presence of hepatitis C antibodies in laboratory tests indicates exposure to the virus, but confirmatory RNA testing is required to distinguish between past, resolved infections and active infections that necessitate treatment to prevent liver damage. '27. The discovery of the hepatitis C virus in the late 1980s, a triumph of molecular biology, closed a historical gap in understanding non-A, non-B hepatitis, catalyzing research and development of diagnostics, treatment options, and a clearer understanding of transmission. '28. Chronic hepatitis C impacts glucose metabolism, increasing the risk of insulin resistance and development of type 2 diabetes, which contributes to liver fibrosis and further complicates the management of liver disease in affected individuals. '29. The Common Fibrosis 4, FIB4, score, calculated from routine lab data such as age, liver enzymes, and platelet count, serves as a useful and widely accessible tool for assessing liver fibrosis in hepatitis C infected individuals, guiding clinical decision-making. '30. Hepatitis C co-infection with HIV poses unique challenges, as both viruses share transmission pathways and exacerbate one another's effects on liver disease progression, requiring a cohesive treatment approach to address both infections effectively. '31. Successful eradication of hepatitis C with antiviral therapy has been shown to reduce the incidence of liver-related complications and improve survival rates, underscoring the importance of achieving a sustained virologic response as the primary goal of treatment. '32. Hepatitis C-associated mixed cryoglobulinemia can manifest as vasculitis, impacting the skin, kidneys, and peripheral nerves, driven by immune complexes and necessitating treatment that addresses both the viral cause and symptomatic relief of vasculitic symptoms. Identifying liver histopathology, such as lymphoid aggregates or bile duct injury alongside steatosis and inflammation, helps refine the diagnosis of hepatitis C and its staging, offering critical insights into the degree of liver damage and guiding therapeutic strategies. Hepatitis C genotype 3 confers an increased risk of hepatic steatosis and faster progression to cirrhosis compared to other genotypes, leading to tailored treatment regimens and vigilant monitoring for this subgroup to prevent rapid liver deterioration. The global distribution of hepatitis C genotypes reflects historical and geographical patterns of human migration and behavior, influencing research strategies that focus on region-specific genotypic prevalence to optimize treatment efficacy and accessibility. The advent of DAAs has changed the landscape of hepatitis C epidemiology, allowing for treatment plans that accommodate diverse populations with varying healthcare access, aiming to eliminate diagnostic and therapeutic disparities and reduce the overall disease burden. In hepatitis C, advanced liver fibrosis correlates with increased risk of hepatocellular carcinoma, warranting surveillance strategies that include regular imaging and laboratory assessments post-therapy to catch any malignancy early and manage it effectively. Host genetic factors, such as polymorphisms in the IL-2AB gene, influence treatment response and spontaneous clearance rates of hepatitis C, providing personalized risk assessment and therapy customization that predict patient-specific therapeutic outcomes. Chronic hepatitis C has complex effects on lipid metabolism, often resulting in dyslipidemia, which may contribute to cardiovascular risk profiles and necessitate a comprehensive approach to managing not only liver health but also associated systemic comorbidities. Hepatitis C-related hepatic inflammation and fibrosis may be modulated by certain cytokines, such as TGF-beta, which promotes fibroblast activation and scar formation in the liver, offering potential targets for antifibrotic therapies under exploration. Socioeconomic factors significantly impact hepatitis C outcomes, as populations with limited healthcare access or education may experience delayed diagnoses and inconsistent treatment adherence, challenging public health efforts to control and eliminate the virus. The hepatitis C virus's ability to mutate rapidly aids its evasion of host immune responses, contributing to chronic infection and highlighting the need for multifaceted therapeutic approaches that target multiple viral elements to achieve sustained clearance. While liver transplantation may be necessary for end-stage liver disease resulting from hepatitis C, recurrence of the virus in the new liver is common without successful viral clearance pre- or post-transplantation, informing the timing and strategies of antiviral regimens. Understanding the natural reservoirs and evolutionary origins of hepatitis C involves studying related hepiciviruses in non-human primates, which may offer insights into viral transmission dynamics and inform future approaches to vaccine development and public health strategies. The role of cellular apoptosis in hepatitis C-related liver injury involves both hepatocyte and immune cell pathways, emphasizing a complex interplay where therapeutic strategies aim to limit cell death and preserve liver health by mitigating ongoing immune-driven damage. Hepatitis C can mediate changes in the gut-liver axis, impacting microbiome balance and cytokine release that contribute to systemic inflammation, necessitating strategies that consider gut health in the holistic management of chronic liver diseases. Advances in biomarkers for hepatitis C have facilitated the classification of liver disease severity and response to treatment, enhancing patient management by allowing more personalized approaches to therapy based on dynamic, accessible, and non-invasive measurements. With hepatitis C eradication being achievable in many patients, follow-up care remains pivotal to ensuring long-term health, as previously infected individuals may still face residual risks of liver disease complications or comorbid conditions that require ongoing monitoring. The psychosocial aspects of living with hepatitis C include stigma and mental health challenges, underscoring the necessity of comprehensive care models that incorporate psychological support alongside medical treatment to support patient resilience and enhance quality of life. The development of pangenotypic antivirals for hepatitis C has brought forth a new era of simplified treatment regimens that transcend genotypic boundaries, offering therapy options with wide-ranging efficacy across all genotypes and reducing the barriers to successful viral eradication. Breast cancer is not a singular disease but rather a heterogeneous group with various subtypes such as luminal A, luminal B, HER2 positive, and triple negative, each exhibiting distinct molecular profiles and clinical behaviors, which necessitate personalized treatment strategies including targeted therapy, chemotherapy, radiation, or hormone therapy, thereby highlighting the importance of precision medicine in improving patient outcomes. While most breast cancers originate in the lobules, starting as ductal carcinoma in situ, DCIS, the cancer can also arise from the connective tissue, leading to rarer forms like phyllodes tumors, which require a surgical approach due to their tendency to recur locally despite being typically benign or borderline. The triple-negative breast cancer subtype, characterized by the absence of estrogen receptor, progesterone receptor, PR, and HER2 amplification, remains one of the most aggressive forms, with limited targeted therapies, making ongoing research into immune checkpoint inhibitors and PARP inhibitors crucial to expanding therapeutic options for improving survival rates in affected women. Novel imaging techniques such as contrast-enhanced mammography and automated breast ultrasound systems are increasingly used to improve sensitivity and specificity in detecting breast cancer, especially in women with dense breast tissue, potentially catching malignancies that could be missed using traditional mammography alone. Dr. William Stewart Halsted pioneered the radical mastectomy in the late 19th century as a definitive treatment for breast cancer. However, advances in surgical techniques and a better understanding of tumor biology have shifted preference towards breast-conserving surgery and sentinel lymph node biopsy, significantly reducing surgical morbidity while maintaining oncologic efficacy. The process of epithelial mesenchymal transition, EMT, plays a crucial role in the metastatic spread of breast cancer, as tumor cells lose their epithelial characteristics and gain mesenchymal traits, enhancing their mobility and invasiveness, which can lead to metastatic lesions in distant organs such as the bone, liver, lungs, and brain. Oncotype DX and MammaPrint are two genomic assays that analyze the expression of multiple cancer-related genes in early-stage breast cancer, providing critical insights into recurrence risk and helping guide treatment decisions regarding the necessity of adjuvant chemotherapy, thus contributing to more personalized approaches for patient management. Breast conservation therapy, BCT, which combines lumpectomy with radiation therapy, is as effective as mastectomy in early-stage breast cancer for survival outcomes and is associated with better cosmetic results in quality of life for many women, making it a preferred choice for eligible patients. The risk of breast cancer increases with age, and around 80% of breast cancers occur in women over the age of 50, underscoring the importance of regular screening through mammography for early detection, as early-stage cancers are more amenable to treatment and have a higher likelihood of cure. Inflammatory breast cancer is a rare but highly aggressive form of breast cancer characterized by skin changes resembling an infection, such as redness and warmth, and often presents without a distinct lump, requiring immediate treatment with chemotherapy followed by surgery and radiation to improve the historically poor prognosis associated with its rapid progression. Breast cancer survivors face the long-term health challenges of treatment-induced side effects, including cardiotoxicity from anthracyclines and trastuzumab, lymphedema post-axillary surgery, and osteoporosis from aromatase inhibitors, necessitating a multidisciplinary follow-up to monitor and manage these chronic conditions to enhance survivors' quality of life. Prophylactic mastectomy, the surgical removal of one or both breasts to reduce cancer risk, is considered in women with a high genetic predisposition to breast cancer, particularly those carrying BRCA1 or BRCA2 mutations, reducing the risk of developing breast cancer by about 90%, although the decision remains deeply personal and complex. Neoadjuvant chemotherapy, administered before surgical intervention, is increasingly utilized in locally advanced breast cancer to shrink tumors, potentially allowing for less extensive surgery and providing early indication of how responsive the cancer is to the treatment regimen, which can inform further therapeutic strategy. The role of the tumor microenvironment in breast cancer progression and treatment resistance is gaining attention, with the surrounding stromal cells, immune cells, and extracellular matrix components interacting dynamically with cancer cells, suggesting potential therapeutic targets that could prevent or alter metastatic spread. Recent advances in biomarker discovery, such as the identification of circulating tumor cells, CTCs, and cell-free DNA, cfDNA, in the bloodstream, hold promise for creating less invasive diagnostic and prognostic tools for monitoring breast cancer progression and treatment response, providing real-time insights into disease dynamics. Some breast cancer treatments target the angiogenesis process, crucial for tumor blood supply, with drugs like bevacizumab inhibiting the vascular endothelial growth factor, VEGF, though its use remains controversial due to varying responses and concerns about side effects outweighing survival benefits, prompting ongoing evaluations of optimal clinical settings for its application. Male breast cancer, comprising about 1% of all breast cancer cases, often presents at a more advanced stage partly due to limited awareness and lack of routine screening, highlighting the need for increased recognition and tailored screening strategies that address the distinct risk factors and genetic predispositions unique to men. Breast cancer incidence shows significant geographical variability worldwide, influenced by factors such as lifestyle, diet, reproductive history, and access to screening, enabling epidemiologists to construct risk prediction models that contribute to targeted prevention strategies within diverse populations. Emerging breast cancer vaccine research aims to harness the immune system to recognize and target tumor-specific antigens, with experimental vaccines showing promise in eliciting immune responses in preclinical trials, potentially offering adjuvant tools for preventing recurrence in high-risk individuals and improving long-term survival. 20. Bisphosphonates and denosumab are agents used in breast cancer with bone metastasis to reduce skeletal-related events, such as pathologic fractures and spinal cord compression, by inhibiting cancer-induced bone resorption, thereby improving quality of life for patients with advanced stage disease. 21. Breast density, categorized through mammographic assessment, is a strong independent risk factor for breast cancer, with women having dense breast tissue at a higher risk due to the difficulty in detecting tumors and the increased probability of harboring aggressive features, sparking conversations on supplemental screening modalities like MRI and ultrasound. 22. Breast cancer metastasis to the brain occurs in approximately 10 to 15% of metastatic cases and is more common in patients with HER2-positive or triple-negative subtypes, necessitating systemic treatment with HER2-targeted therapies and the consideration of stereotactic radiosurgery or whole-brain radiotherapy to manage neurological symptoms and maintain life quality. 23. Breast cancer prognosis is evaluated using the TNM staging system, which considers the size and extent of the primary tumor, T, lymph node involvement, N, and metastatic spread, M, providing valuable information on the severity of the disease and guiding treatment decisions, with higher stages typically indicating more aggressive therapy is needed. 24. Hormone receptor-positive breast cancers, characterized by the expression of estrogen and/or progesterone receptors, often respond well to hormonal therapies such as tamoxifen or anastrozole, which block the oncogenic signaling pathways activated by these hormones, and are key components in both adjuvant and metastatic treatment settings. 25. The concept of oncogene addiction in breast cancer highlights how tumors may become reliant on particular genetic drivers, like the amplification of HER2, making targeted therapies addressing these vulnerabilities an effective strategy, as evidenced by the success of HER2 inhibitors like trastuzumab and pertuzumab in transforming the treatment landscape for these cancers. 26. The Gale model is a widely used tool for assessing breast cancer risk, employing a combination of factors such as age, family history, hormonal factors, and reproductive history to calculate an individual's risk of developing breast cancer, aiding in decision-making regarding preventive interventions like increased surveillance or chemoprevention. 27. The presence of tumor-infiltrating lymphocytes, TILs, in breast cancer, particularly in triple-negative and HER2-positive subtypes, is associated with better prognosis and response to chemotherapy, indicating that the host immune response plays a crucial role in modulating cancer progression and therapeutic outcomes. 28. The introduction of digital mammography has revolutionized breast cancer screening by offering superior image quality, better detection rates, and lower radiation doses compared to traditional film mammography, making it a cornerstone in the early detection of malignancies and contributing significantly to decreased mortality rates through early intervention. 29. Microenvironmental hypoxia, often present in rapidly growing breast tumors, is a critical factor that drives cancer cell adaptation and therapy resistance by activating hypoxia-inducible factors, HIFs, which promotes angiogenesis, metabolic reprogramming, and an aggressive phenotype, presenting opportunities for therapeutic intervention with HIF inhibitors. 30. The American Joint Committee on Cancer, AJCC, introduced the 8th edition breast cancer staging system incorporating genomic panels and biomarkers like the 21 gene recurrence score, emphasizing the adoption of molecular data in refining prognostication and guiding the use of adjuvant systemic therapies more precisely. 31. The risk of developing breast cancer is influenced by lifestyle factors, with increased alcohol consumption, obesity, and sedentary behaviors contributing to higher risks, encouraging interventions focused on lifestyle modifications, such as diet, exercise, and reducing alcohol intake, to potentially lower the incidence of breast cancer in the general population. 32. Sentinel lymph node biopsy has become the standard practice for axillary staging in early breast cancer, significantly reducing the morbidity of axillary lymph node dissection by targeting the first draining nodes, allowing you to determine if cancer cells have spread without the need for extensive node removal in the absence of metastatic disease. 3. Breast cancer during pregnancy presents unique challenges, as diagnostic and treatment options must be carefully balanced to protect fetal health while ensuring effective cancer management, with strategies often involving modified chemotherapy regimens compatible with pregnancy and coordinated multidisciplinary care to guide optimal outcomes. 34. The role of the BRCA1 and BRCA2 genes in breast cancer risk extends beyond simple genetic predisposition. These genes are crucial components of the homologous recombination DNA repair pathway, and their mutation results in genomic instability, making cells more susceptible to malignant transformation but also creating opportunities for treatment with PARP inhibitors. Triple-negative breast cancer, TNBC, is being explored for novel therapeutic targets like the androgen receptor, AR, and other non-estrogen receptor pathways, as some TNBCs may express AR, offering potential for anti-androgen therapies to complement existing treatment paradigms and enhance outcomes in this challenging breast cancer subtype. 36. Breast cancer patients may exhibit cancer-related cognitive impairment, often referred to as chemo brain, which includes symptoms such as memory lapses, difficulty concentrating, and mental fog, likely resulting from chemotherapy agents, stress, and inflammatory cytokines, warranting support strategies and cognitive rehabilitation to improve daily functioning. 37. HER2 amplification in breast cancer, traditionally considered as an adverse prognostic indicator, has evolved as a therapeutic target with the development of monoclonal antibodies like trastuzumab, which specifically targets the HER2 receptor, demonstrating improved survival rates and being paramount in the management of HER2-positive breast cancer. 38. Recent studies suggest a possible link between night shift work and elevated breast cancer risk, potentially due to altered levels of melatonin, which is hypothesized to have cancer protective properties, emphasizing the need for additional research and interventions that could mitigate occupational risk factors in shift workers. 39. The integration of artificial intelligence, AI, in breast cancer diagnostics is advancing, with AI algorithms being developed to enhance mammogram interpretations, identify patterns indicative of malignancies with high accuracy, and assist radiologists in reducing false positives and unnecessary biopsies, further streamlining the diagnostic process. 40. Breast cancer recurrence can occur years after initial treatment completion, often influenced by factors such as tumor biology, treatment adherence, and lifestyle, reinforcing the necessity for long-term follow-up and vigilance in survivorship care to detect and manage recurrences early, ensuring timely intervention and improved survival chances. 41. The phenomenon of liquid biopsy is emerging as a game-changer in breast cancer management. It entails the non-invasive collection of blood samples to detect circulating tumor cells or tumor-derived fragments, enabling real-time monitoring of tumor burden, treatment efficacy, and the detection of minimal residual disease, potentially guiding timely therapeutic adjustments. 42. Breast cancer care disparities exist across socioeconomic and racial lines, with access to screening programs, treatment availability, and quality of care often affecting outcomes, calling for public health initiatives to bridge these gaps, ensuring equitable access to preventive measures and treatments for all demographics. 43. While traditionally limited to invasive approaches, focal therapy for breast cancer, including techniques like cryoablation and high-intensity focused ultrasound, offers minimally invasive alternatives to surgical excision, potentially allowing for effective tumor control while preserving breast tissue integrity and patient quality of life. 44. Axillary locoregional recurrence is a concern after initial breast cancer surgery, with the risk factors including incomplete resection and aggressive histology, highlighting the need for careful surgical planning and the potential benefit of adjuvant radiation in cases with unfavorable pathological features to reduce recurrence likelihood. Breast cancer molecular subtyping has transformed therapeutic approaches, as differences in genetic expression profiles guide treatment selection between hormone therapy, HER2 targeted agents, and chemotherapy, tailoring regimens to the unique biology of each case and maximizing treatment efficacy. 46. Phyllodes tumors, a rare form of breast tumors, exhibit a spectrum of behavior from benign to malignant, distinguished by the stromal overgrowth component, and are predominantly treated with wide local excision to ensure clear margins, as the risk of local recurrence is significant, often mandating vigilant follow-up. 47. Radiation therapy advancements, such as intensity-modulated radiation therapy, IMRT, allow for better targeting of breast tumors while sparing healthy tissue, reducing side effects, and improving cosmetic outcomes, representing a substantial progression in adjuvant breast cancer therapy for individuals undergoing conservative surgery. 48. Breast cancer prevention strategies go beyond lifestyle modifications and familial risk assessments. They also include chemoprevention with agents like tamoxifen and raloxifene in high-risk women, which have shown efficacy in reducing breast cancer incidence by modulating estrogen receptor pathways and acting as selective estrogen receptor modulators. 49. Breast cancer metastasis remains a major therapeutic challenge, as disseminated disease becomes less curable and focuses on prolonging survival and maintaining quality of life, highlighting the importance of understanding the molecular mechanisms driving metastasis and exploring targeted therapies to prevent or retard the spread of tumors. 50. The role of autophagy in breast cancer is a double-edged sword, where it can be both tumor suppressive by removing damaged organelles and protein aggregates, and tumor promotive by providing nutrients through cellular recycling during metabolic stress, making it a complex target for therapeutic manipulation and enhancing treatment outcomes. 1. Gastric cancer, commonly known as stomach cancer, predominantly occurs in the stomach's lining and is most frequently found in the farthest section of the stomach, posing a significant health problem worldwide due to its relatively late presentation and poor prognosis. 2. The pathophysiology of gastric cancer is intricate, involving multifactorial processes such as the transformation of normal gastric epithelial cells into cancer cells driven by genetic mutations, epigenetic alterations, and environmental influences, including diet and infection with Helicobacter pylori. 3. One of the most significant risk factors for developing gastric cancer is chronic infection with Helicobacter pylori, a bacterium that leads to chronic inflammation and, in some cases, can contribute to the development of precancerous lesions and eventually gastric malignancy. 4. Gastric cancer often presents asymptomatically in its early stages, making early detection challenging, with common symptoms including unexplained weight loss, abdominal pain, early satiety, dysphagia, and symptoms of upper gastrointestinal bleeding like hematemesis or melena only appearing in more advanced stages. 5. The diagnosis of gastric cancer requires a combination of upper gastrointestinal endoscopy, which allows direct visualization and biopsy of suspicious lesions, combined with histopathological examination for confirmation and staging purposes, often enhanced by imaging studies like CT scans for assessment of local and distant spread. 6. treatment of gastric cancer is multidisciplinary and may involve surgical resection, which provides the best chance for cure in early-stage disease, alongside chemotherapy, radiotherapy, or targeted therapy, chosen based on the cancer's stage, location, and molecular characteristics, as well as patient factors. Seven, molecular profiling of gastric tumors can reveal distinct subtypes, such as the Epstein-Barr virus-associated type or the microsatellite instability high group, each having unique prognostic and therapeutic implications that guide personalized treatment strategies in modern oncology practice. 8. Early gastric cancer, confined to the mucosa or submucosa regardless of lymph node involvement, offers the potential for curative treatment through endoscopic resection techniques in select cases, emphasizing the importance of early diagnosis and intervention in improving patient outcomes. 9. Advanced gastric cancer, which has penetrated beyond the gastric wall into surrounding structures or metastasized to distant organs, often necessitates palliative approaches focusing on symptom management and quality of life improvement, given limited curative options. Risk reduction strategies for gastric cancer include dietary modifications such as increasing fruit and vegetable intake, reducing consumption of smoked or pickled foods, and eliminating tobacco and alcohol use, alongside eradicating Helicobacter pylori infection when detected. The Laurin classification divides gastric cancer into intestinal and diffuse types. The intestinal type is often associated with environmental factors and better prognosis, whereas the diffuse type is more likely linked to hereditary syndromes and poses a worse prognosis. Hereditary diffuse gastric cancer, HDGC syndrome, caused by mutations in the CDH1 gene, is a genetic condition that dramatically increases the risk of developing gastric cancer at an early age, often necessitating prophylactic gastrectomy in affected individuals. Gastric cancer survival rates vary significantly depending on the stage at diagnosis, with localized cancer having the highest 5-year survival rate, while metastatic disease is associated with a much poorer prognosis, underscoring the importance of early detection. Peritoneal carcinomatosis is a common metastatic pattern of gastric cancer, whereby cancer cells disseminate within the peritoneal cavity, often leading to complications such as ascites and intestinal obstruction, and posing significant challenges in management. Signet ring cell carcinoma is a histological variant of gastric cancer characterized by cells containing mucin-filled vacuoles that displace the nucleus, often associated with diffuse-type cancer, and is linked with a more aggressive clinical course and poorer prognosis. The role of Helicobacter pylori in gastric carcinogenesis is well documented, with the infection leading to chronic gastritis, which can progress to atrophic gastritis, intestinal metaplasia, dysplasia, and eventually carcinoma, especially in genetically predisposed individuals. A positive family history is a recognized risk factor for gastric cancer, suggesting a hereditary component in certain individuals, thus warranting consideration for genetic counseling and surveillance in at-risk families to facilitate early detection and management. Helicobacter pylori eradication has been shown to reduce the incidence of gastric cancer in high-risk populations when implemented effectively, highlighting the importance of public health interventions focused on screening and treatment of this bacterial infection. Nutritional factors play a significant role in gastric cancer risk, with high salt intake and consumption of smoked foods increasing the risk, while diets rich in fresh fruits, vegetables, and antioxidants are believed to confer a protective effect against the development of gastric malignancies. 20. Helicobacter pylori infection's role in gastric cancer has led to the development of serological and urea breath tests for its detection, forming the basis of case-finding strategies in endemic areas to help reduce gastric cancer incidence through early intervention. 21. Gastric cancer can also metastasize to distant organs like the liver, lungs, and bones, with such hematogenous spread indicating an advanced stage of the disease that typically requires systemic chemotherapy and palliative care approaches. 22. Various genetic mutations, such as those found in the APC, TP53, and KRAS genes, are associated with the development of gastric cancer, emphasizing the growing importance of genetic testing and personalized medicine approaches in the management of this disease. 23. Prognostic factors for gastric cancer include tumor stage, lymph node involvement, histological grade, and subtype, with these factors playing a crucial role in guiding treatment decisions and predicting patient outcomes. 24. Advanced imaging techniques, such as endoscopic ultrasound, EUS, are invaluable in the staging of gastric cancer by assessing the depth of tumor invasion and evaluating regional lymph nodes, aiding in planning appropriate treatment strategies. 25. Palliative care in gastric cancer focuses on symptom management, including control of pain, nausea, and nutritional support, ensuring patient comfort and quality of life in those with advanced disease where curative treatment is not feasible. 26. Trastuzumab, a monoclonal antibody targeting the HER2 receptor, is used in the treatment of HER2-positive advanced gastric cancer, offering a targeted therapeutic option that has improved outcomes for patients with this specific molecular subtype of the disease. 27. Minimally invasive surgical techniques, such as laparoscopic gastrectomy, are increasingly employed in the treatment of early-stage gastric cancer, offering benefits in terms of reduced postoperative pain, faster recovery, and improved cosmetic outcomes. 28. Gastric cancer screening programs have been implemented in some high-incidence countries, utilizing tools such as endoscopy and serological biomarkers to detect early-stage disease, which is crucial for improving survival rates through timely intervention. 29. The role of chronic atrophic gastritis as a precursor to gastric cancer is well established, with long-standing inflammation leading to mucosal atrophy, intestinal metaplasia, and dysplasia, representing critical steps in gastric carcinogenesis. 30. For patients with localized advanced gastric cancer, neoadjuvant chemotherapy can be administered before surgery to reduce tumor size and improve resectability, often enhancing survival outcomes compared to surgery alone. 31. The use of single-agent or combination chemotherapy remains a cornerstone in managing metastatic gastric cancer, with regimens including drugs like fluorouracil, cisplatin, and irinotecan aimed at controlling disease progression and extending survival. 32. Gastric cancer exhibits marked geographic variation in incidence, being more prevalent in East Asian countries compared to Western nations, reflecting differences in environmental risk factors, dietary habits, and genetic predispositions. 3. Gastric cancer can lead to paraneoplastic syndromes, such as acanthosis nigricans, where darkened, velvety skin patches appear, often serving as an early indicator of an underlying malignancy that warrants further diagnostic evaluation. 34. Nutritional management is pivotal in the care of patients with gastric cancer, particularly those undergoing treatment, as maintaining adequate nutritional status helps mitigate treatment-related side effects and supports recovery and overall well-being. 35. Emerging immunotherapies, such as checkpoint inhibitors, are being explored in gastric cancer treatment, offering promising avenues to harness the immune system's power to recognize and destroy cancer cells, potentially improving outcomes in select patient populations. (36) The diffuse-type gastric cancer, characterized by poorly cohesive, invasive growth, often presents at a more advanced stage and is associated with a poorer prognosis, posing challenges in management due to its aggressive nature and resistance to conventional therapies. (37) Understanding the molecular mechanisms of gastric cancer has paved the way for novel targeted therapies, focusing on specific pathways altered in cancer cells, such as angiogenesis, cell proliferation, and survival pathways, providing new hope for personalized treatment. (38) The presence of lymphovascular invasion in gastric cancer specimens is a critical prognostic indicator, associated with an increased risk of metastasis, and underscores the importance of thorough pathological examination in guiding clinical decision-making. (39) The development and validation of molecular biomarkers for gastric cancer are crucial in enhancing diagnostic accuracy, treatment selection, and prognosis stratification, ultimately leading to more tailored patient care and improved outcomes. (40) Gastric cancer can disrupt normal gastric function, leading to complications like gastric outlet obstruction and bleeding, which require prompt intervention, ranging from endoscopic procedures to surgical bypass, depending on the situation's severity. (41) Polyps, such as hyperplastic or adenomatous polyps, can be precursors to gastric cancer, particularly when they undergo dysplastic changes, necessitating regular surveillance and removal when found during endoscopic evaluations. (42) Anemia, often due to chronic blood loss from the tumor or nutritional deficiencies, is a common finding in gastric cancer patients, requiring comprehensive evaluation and management to ensure optimal patient care and quality of life. (43) The staging system for gastric cancer, such as the TNM classification, is vital in determining the extent of disease spread, guiding treatment approaches, and providing prognostic information to patients and healthcare providers. (44) The pathogenesis of intestinal-type gastric cancer often involves a sequence of histological changes starting with chronic gastritis, progressing to atrophic gastritis, then intestinal metaplasia, followed by dysplasia, and ultimately culminating in carcinoma. (45) Genetic testing for hereditary cancer syndromes, such as Lynch syndrome, is recommended for individuals with a strong family history of gastric cancer, enabling risk assessment and informing surveillance and management strategies. (46) Host immune response to Helicobacter pylori infection plays a role in gastric cancer development, with genetic and environmental factors influencing the level of inflammation and subsequent progression to malignancy in susceptible individuals. (47) The survival advantage of gastric cancer patients treated with adjuvant chemoradiotherapy post-gastrectomy has been demonstrated in several clinical trials, highlighting the importance of a multimodal approach in managing resectable disease. (48) Proximal gastric cancer, affecting the upper part of the stomach near the esophagus, is increasingly recognized, requiring distinct surgical approaches like total or proximal gastrectomy, often combined with esophageal resection, to achieve oncological clearance. (49) Psychological support is essential for gastric cancer patients, given the emotional and physical challenges of the disease and its treatment, ensuring holistic care that addresses both medical and mental health needs for optimal patient outcomes. 50. The role of circulating tumor DNA, ctDNA, as a non-invasive biomarker in gastric cancer is being investigated, offering potential for early detection, monitoring treatment response, and detecting minimal residual disease, paving the way for more personalized treatment approaches. One. Cardiac arrhythmias, often resulting from disruptions in the heart's electrical conduction system, can lead to symptoms such as palpitations, dizziness, and syncope, while potentially increasing the risk for more serious conditions like stroke and heart failure. Hence, understanding the complexities of atrial and ventricular arrhythmias is crucial for effective clinical management. 2. Diagnosing cardiac arrhythmias often involves the use of electrocardiograms, ECGs, as a primary tool, where healthcare providers analyze the electrical activity of the heart through P, QRS, and T waves, which can reveal patterns indicative of atrial fibrillation, tachycardia, or other arrhythmic conditions. 3. Although antiarrhythmic drugs like amiodarone, beta blockers, and calcium channel blockers are integral to the medical management of various cardiac arrhythmias, they come with their own set of pharmacokinetic challenges and side effects, necessitating careful patient monitoring and individualized treatment plans. Four. Atrial fibrillation, one of the most common types of arrhythmias, is characterized by rapid and irregular beating of the atria and is often associated with an increased risk of thromboembolic events, which calls for anticoagulation strategies in addition to rhythm or rate control therapies. Five. The pathophysiology of ventricular arrhythmias can involve abnormalities in ion channel functioning within myocardial cells, leading to conditions such as ventricular tachycardia or fibrillation, which are particularly serious due to their potential to precipitate sudden cardiac arrest. Six. Holter monitoring, which involves continuous ECG recording typically over 24 to 48 hours, is a valuable diagnostic method for identifying transient arrhythmic episodes that may not be captured during a standard ECG test in a clinical setting. 7. In certain cases of refractory arrhythmias or when medical management is insufficient, catheter ablation procedures might be considered. These involve the targeted destruction of arrhythmic foci within the heart tissue via radiofrequency or cryoablation techniques, aiming to restore normal cardiac rhythm. 8. Breach of cellular homeostasis and calcium ion handling in cardiomyocytes can contribute to arrhythmic phenomena, highlighting the importance of calcium channel function in maintaining proper myocardial contraction and electrical stability, often factored into pharmacotherapeutic interventions. 9. Genetic predispositions, sometimes linked to inherited channelopathies such as long QT syndrome or Brugada syndrome, can underpin the development of arrhythmias, indicating the need for genetic counseling and screening in at-risk populations to guide preventive and therapeutic strategies. Cardiac arrhythmias in the context of ischemic heart disease can arise from scarring and fibrosis post-myocardial infarction, which disrupts electrical conduction pathways, thereby necessitating not only direct arrhythmia management but also comprehensive cardiovascular care to mitigate underlying ischemic burden. 11. Lifestyle factors such as excessive caffeine or alcohol consumption, smoking, and stress can exacerbate or trigger arrhythmic episodes, suggesting that a holistic approach to arrhythmia management must include patient education and lifestyle modifications alongside medical interventions. 12. The occurrence of arrhythmias during pregnancy presents unique clinical challenges due to physiologic changes and the need to consider fetal health, often requiring collaborative multidisciplinary care to address rhythm disturbances while minimizing risks to mother and child. For individuals experiencing symptomatic bradyarrhythmias, potentially due to sinus node dysfunction or atrioventricular block, implantation of a pacemaker can provide effective rhythm management, thereby alleviating symptoms and reducing the risk of complications associated with low heart rates. Unlike mere heart rate increase or decrease, arrhythmias involve the intricate disturbance of the heart's electrical impulses, necessitating attentive risk factor stratification in patient-specific treatment protocols, considering the vast array of underlying etiological mechanisms in each case. A comprehensive history and physical examination remain pivotal in the initial assessment of patients presenting with suspected arrhythmias, for symptoms such as palpitations, fatigue, or dyspnea can stem from a vast differential diagnosis, thereby helping clinicians to triage and guide further investigations efficiently. The role of the autonomic nervous system in modulating cardiac rhythms is significant, where imbalances in sympathetic and parasympathetic tone can precipitate arrhythmic events. Clinical interventions sometimes involve modulation of autonomic inputs to stabilize cardiac function. Antiarrhythmic drug therapy carries potential proarrhythmic risk, necessitating diligent monitoring for QT interval prolongation or other adverse effects, especially in drugs that alter ion channels, underscoring the complexity of striking a balance between therapeutic benefits and possible toxicities. Emerging non-invasive technologies like wearable ECG monitors provide continuous cardiac rhythm surveillance, empowering patients with real-time insights and facilitating early detection of arrhythmic phenomena outside of traditional clinical environments, fostering proactive management. Pathological hypertrophy and dilation of cardiac chambers, often seen in conditions such as left ventricular hypertrophy or cardiomyopathies, can induce arrhythmic electrical conduction, highlighting the intersection between structural myocardial changes and electrophysiological disturbance. Psychoemotional factors, including anxiety and depression, have been noted to influence the presentation and perceived burden of arrhythmias, thereby requiring a biopsychosocial model of care that integrates mental health support in managing patients with cardiac arrhythmias. The electrophysiological study, EPS, serves as a cornerstone diagnostic tool for elucidating the mechanisms of arrhythmias, whereby intracardiac electrode catheters help in mapping the heart's electrical activity and understanding specific arrhythmic circuits for targeted therapeutic decisions. The electrophysiology of the cardiac conduction system involves synchronized depolarization and repolarization events, with the sinoatrial and atrioventricular nodes playing critical roles. Disruptions here can result in inefficient cardiac cycles and highlight areas of potential electrophysiological intervention. Structural heart conditions such as valvular diseases may predispose patients to arrhythmias due to resultant atrial enlargement and pressure overload, demonstrating the interconnected nature of mechanical and electrical heart dynamics in arrhythmogenesis. Synchronization of ventricular contraction and improved hemodynamics are the goals of cardiac resynchronization therapy, CRT, used in select cases of heart failure with arrhythmias where biventricular pacing can dissolve dysynchrony and ameliorate symptoms. Pediatric arrhythmias demand careful consideration, as they may manifest differently than in adults, with common etiologies including congenital heart defects or genetic syndromes, necessitating age-appropriate diagnostic and therapeutic approaches tailored to the developmental context. The intricate anatomy of the cardiac conduction system, involving specialized pathways through the atrioventricular node and Purkinje fibers, underpins its vulnerability to disturbances, where even minor alterations in anatomy or physiology can have significant arrhythmic consequences. The multifactorial etiology of arrhythmias often includes electrolyte imbalances such as hypokalemia or hypercalcemia, underscoring the importance of maintaining adequate electrolyte homeostasis in both prevention and treatment regimens for cardiac rhythm disturbances. Lifestyle interventions, such as the incorporation of regular graded exercise, have shown beneficial effects in reducing the incidence of certain arrhythmias, promoting autonomic balance and cardiac fitness, when duly tailored to individual patient capabilities and risk profiles. The risk stratification for sudden cardiac death in individuals with potentially malignant arrhythmias involves assessing factors such as ejection fraction, presence of syncope, and familial history, guiding decisions on the appropriateness of implantable cardioverter defibrillators as prophylactic measures. Cardiac imaging techniques, including echocardiography and cardiac MRI, illuminate structural and functional status, providing essential information to correlate anatomical findings with arrhythmic potential, vital for comprehensive arrhythmia care planning. The pathogenesis of arrhythmias can sometimes be attributed to inflammatory processes, as observed in conditions like myocarditis or cardiac sarcoidosis, where inflammation-induced scarring can alter conductive pathways, necessitating both anti-inflammatory and rhythm management strategies. Clinical innovations, such as the development of bioengineered cardiac tissue grafts, hold promise for repairing arrhythmic substrates by restoring normal myocardial architecture and electrical continuity, offering a glimpse into future regenerative therapies for arrhythmia management. Polymorphic ventricular tachycardia, often associated with electrolyte disturbances or ischemic insult, typifies the diversity within arrhythmias, necessitating nuanced understanding and management approaches, including correction of precipitating conditions and pharmacological stabilization. The potential for asymptomatic arrhythmias to progress undetected adds an element of unpredictability to their management, emphasizing the value of regular cardiac evaluations, especially in high-risk populations, to mitigate possible adverse outcomes through proactive surveillance. The utilization of implantable loop recorders extends diagnostic capabilities over extended periods, capturing sporadic arrhythmic events that might otherwise go undiagnosed, enhancing the diagnostic yield in patients presenting with unexplained syncope or palpitations. Paroxysmal supraventricular tachycardia, PSVT, arises from reentrant circuits within the atria or atrioventricular node, often requiring acute interventions such as vagal maneuvers or adenosine administration, alongside long-term consideration of pharmacological or ablative strategies for persistent cases. The advent of telemedicine and virtual arrhythmia clinics has augmented patient access to specialized cardiac care, allowing remote consultations and monitoring that adapt to patient needs, optimizing management and follow-up in the evolving landscape of digital healthcare. Wolff-Parkinson-White syndrome, a pre-excitation disorder characterized by the presence of an accessory pathway, manifests in tachyarrhythmias due to abnormal electrical conduction, underscoring the importance of accurate ECG interpretation and patient-specific intervention planning. Not all arrhythmias convey the same clinical significance, with distinctions existing between benign ectopic beats and life-threatening tachyarrhythmias, thus imposing the need for differential diagnosis in the context of patient symptoms and overall cardiovascular risk. 40. Environmental factors, such as exposure to certain toxins or medications that prolong the QT interval, can precipitate arrhythmic events, necessitating awareness and mitigation strategies in both clinical and occupational contexts to prevent potential cardiac complications. 41. Cardiac arrhythmias present gender-specific prevalence and risk factors, as hormonal influences and genetic predispositions may differ, warranting consideration of gender in both the research and clinical management paradigms of arrhythmic disorders. 42. Technology-driven advancements in algorithms for arrhythmia detection leverage artificial intelligence to enhance the precision of diagnostic tools, transforming the landscape of non-invasive arrhythmia screening with the potential to improve early detection and intervention outcomes. 43. The therapeutic landscape for arrhythmias continues to evolve with approaches such as gene therapy, targeting underlying molecular defects in inherited arrhythmogenic disorders, offering a frontier in personalized medicine that reaches beyond symptom control to address disease at its genetic root. 44. Emotionally induced arrhythmias exemplify the direct link between mind and heart, where stress can precipitate acute arrhythmic events, highlighting the importance of integrating stress management techniques into comprehensive care plans for patients with cardiac susceptibility. 45. Despite their potential diversity, arrhythmias share a common thread in their potential to affect cardiac output, emphasizing the interconnectedness of electrical dysrhythmia and hemodynamic compromise, necessitating a holistic grasp of cardiovascular physiology in clinical practice. 46. The management of arrhythmias in patients with comorbid conditions, such as diabetes or chronic kidney disease, often involves additional layers of complexity due to interaction with existing therapies and potential alteration of drug metabolism, underscoring the importance of multidisciplinary care teams. 47. Recent studies suggest that the gut microbiome may influence cardiac rhythm through mechanisms involving metabolic byproducts, opening intriguing possibilities for novel approaches to managing arrhythmic disorders via dietary modulation and microbiome-targeted therapies. 48. In some instances, a pacemaker or implantable cardioverter defibrillator interaction with electromagnetic fields necessitates vigilance regarding potential interference, leading to patient education on avoiding certain environments to ensure device functionality remains uncompromised. 49. Considering arrhythmias from a global health perspective unveils disparities in access to arrhythmia care, prompting efforts towards enhancing healthcare infrastructure and education in resource-limited settings to bridge gaps and improve patient outcomes. 50. The use of risk prediction models in arrhythmia care, incorporating variables such as age, comorbidities, and lifestyle factors, facilitates a more tailored risk assessment approach, enhancing predictive accuracy and informing preventive strategies in clinical decision-making processes. 1. Hepatitis B is a viral infection caused by the hepatitis B virus that primarily affects the liver, leading to both acute and chronic disease states, with symptoms such as jaundice, fatigue, and abdominal pain often seen in acute cases, while chronic infection can progress to cirrhosis or liver cancer over several years if left untreated, highlighting the importance of early diagnosis and intervention. 2. The hepatitis B virus is a small, enveloped DNA virus belonging to the Hepidnaviridae family, and it replicates through an RNA intermediate using reverse transcription, which is a unique feature among DNA viruses and contributes to its ability to establish a persistent infection in the host liver cells. 3. Diagnosis of hepatitis B infection involves serological testing for surface antigens, HBsAg, surface antibodies, anti-HBs, and core antibodies, anti-HBc, which together help to determine the infection status, such as acute, chronic, or resolved infection, and vaccination response. Hepatitis B surface antigen, HBsAg, is often the first marker to appear in the blood following infection and serves as an indicator of active viral replication, while the persistence of HBsAg beyond 6 months usually indicates progression to chronic hepatitis B infection. 5. The presence of hepatitis B antigen, HBsAg, in the blood is associated with higher levels of viral replication and infectivity, and its conversion to anti-HBe antibodies, HBe seroconversion, often signifies a reduction in viral activity and an improved prognosis in chronic hepatitis B patients. In chronic hepatitis B, liver histopathology may reveal varying degrees of inflammation, fibrosis, or cirrhosis, and liver biopsy remains a useful diagnostic tool to assess the extent of liver damage and guide therapeutic decisions, although non-invasive tests are increasingly used to evaluate liver fibrosis. 7. The primary treatment goals in managing chronic hepatitis B are to prevent disease progression such as cirrhosis or hepatocellular carcinoma, reduce viral load to undetectable levels, and enhance the patient's quality of life. These are achieved through antiviral therapy with drugs like tenofovir or entecavir. 8. Antiviral medications like tenofovir disoproxil fumarate or entecavir are recommended as first-line therapy for chronic hepatitis B due to their high barrier to developing viral resistance, potent suppression of viral replication, and satisfactory safety profile, though patient monitoring for potential renal or bone side effects is necessary. 9. Pegylated interferon alpha therapy can be an alternative treatment option for some patients with chronic hepatitis B, particularly in those with genotype A infection or younger patients, as it may lead to higher rates of HBsAg clearance, representing functional cure, though the treatment is limited by its considerable side effects. 10. The prevention of hepatitis B transmission relies heavily on vaccination, with the hepatitis B vaccine, consisting of purified HBsAg, being highly effective at inducing protective immunity and recommended for all infants at birth, healthcare workers, and other high-risk groups to curb the spread of the virus. 11. Mother-to-child transmission of hepatitis B can be significantly reduced by administering the hepatitis B vaccine and hepatitis B immune globulin, HBIG, to newborns within 12 hours of birth, especially if the mother is HBsAg positive, thereby preventing the development of chronic hepatitis B in the infant. 12. Chronic hepatitis B infection is a major global health issue, with over 296 million people estimated to be infected worldwide, leading to significant morbidity and mortality as it causes liver-related complications such as cirrhosis and hepatocellular carcinoma, highlighting the importance of public health measures for prevention and control. 13. Hepatitis B virus can be transmitted in several ways, including through unprotected sexual contact, exposure to infected blood, perinatal transmission from an infected mother to her child, and through unsafe injections or blood transfusions, necessitating comprehensive prevention strategies to reduce transmission rates. 14. The incubation period for hepatitis B ranges from 30 to 180 days, during which time the virus proliferates in liver cells, leading to symptoms of acute hepatitis as the immune system mounts a response. Symptoms include malaise, anorexia, nausea, and jaundice, which often indicate liver inflammation. 15. In early acute hepatitis B infection, liver enzymes such as alanine aminotransferase (ALT) and aspartate aminotransferase (AST) are elevated, reflecting liver cell injury. while the return of these enzymes to normal levels often indicates recovery, although chronic infection may develop in a minority of cases. The interplay between the hepatitis B virus and the host immune system plays a crucial role in determining the outcome of infection. The virus employs various mechanisms to evade immune detection, and the strength of the host's immune response influences whether the infection resolves spontaneously or becomes chronic. Regular monitoring of individuals with chronic hepatitis B involves periodic assessments of liver enzymes, hepatitis B viral DNA levels through PCR testing, and imaging studies to screen for liver cancer, which helps guide treatment decisions and detect complications such as cirrhosis or hepatocellular carcinoma at an early stage. Hepatitis B infection management has evolved with guidelines recommending risk stratification based on factors like age, family history of liver disease or cancer, and the presence of cirrhosis, which help tailor treatment approaches to individual patients for optimizing outcomes and preventing liver complications. Hepatitis B immunity can be conferred by past infection or vaccination, with the presence of anti-HBs antibodies indicating protective immunity, while individuals lacking these antibodies after successful vaccination may benefit from booster doses if they remain at high risk of exposure to the virus. Hepatitis B-related liver cancer is one of the leading causes of cancer-related deaths worldwide, and the development of hepatocellular carcinoma, HCC, is more common in patients with ongoing viral replication, co-infections with hepatitis C or D, or lifestyle factors like heavy alcohol consumption, emphasizing the need for routine HCC screening in high-risk populations. Hepatitis B DNA polymerase enzyme is a key target for antiviral drugs as it is essential for viral replication. Nucleose T-ide analogs inhibit this enzyme effectively, leading to suppression of viral replication and reduction of liver inflammation and fibrosis in treated individuals, although therapy may be lifelong in some cases. Chronic hepatitis B can progress through different phases, including immune tolerance, immune clearance, inactive carrier state, and reactivation, with each phase characterized by distinct viral replication levels and liver inflammation profiles, which inform monitoring and treatment strategies for managing the infection. Co-infection with hepatitis D virus, HDV, can occur in patients with hepatitis B, leading to more severe liver disease, as HDV requires hepatitis B surface antigen for replication. This combination requires specialized management as it poses a higher risk for rapid progression to cirrhosis and liver cancer. Pregnancy in women with chronic hepatitis B requires careful management, with antiviral therapy recommended in the third trimester for mothers with high viral loads to decrease the risk of mother-to-child transmission, alongside routine neonatal vaccination and administration of HBIG to at-risk newborns. Many individuals with occult hepatitis B infection have undetectable HB-ZAG despite being carriers of the virus, posing a diagnostic challenge. These individuals often demonstrate the presence of HBV DNA in liver or serum samples and are at increased risk for the development of liver disease, particularly if co-infected with HCV or HIV. Hepatitis B can cause a wide range of extrahepatic manifestations such as polyarthritis nodosa, glomerulonephritis, and vasculitis, which result from immune complex deposition and hypersensitivity reactions, necessitating vigilant identification and multisystem management in affected individuals. 27. The hepatitis B vaccine is an inactivated vaccine composed of non-infectious HBsAg particles produced through recombinant DNA technology, and its administration induces an immune response that protects over 95% of vaccinated individuals for at least 20 years, although routine booster doses are not generally recommended for immunocompetent persons. 28. Vaccination against hepatitis B has resulted in a dramatic decrease in the incidence of new infections, particularly among children and young adults due to robust immunization programs initiated globally, which has contributed significantly to the decrease in hepatitis B-related morbidity and mortality over the past few decades. 29. Liver function tests, LFTs, are crucial in the assessment of hepatitis B infection, as they provide information on the extent of liver damage, with elevated levels of ALT and AST indicating hepatocellular injury, while monitoring changes in these enzymes is critical in evaluating treatment efficacy and liver disease progression. 30. Antiviral therapy for hepatitis B has evolved significantly, with the introduction of potent nucleose (T)ide analogs that offer patients prolonged viral suppression, thereby reducing the risk of liver disease progression and complications. And while viral eradication remains challenging, functional cure defined by the loss of HBsAg is an achievable treatment endpoint for some patients. 31. In individuals with resolved hepatitis B infection, characterized by the presence of anti-HBC and anti-HBs antibodies without detectable HBsAg, reactivation of hepatitis B can occur under certain circumstances, such as immunosuppressive therapy, necessitating prophylactic antiviral treatment to prevent flare-ups of hepatitis. 32. The innate immune response plays a critical role in the initial defense against hepatitis B infection by recognizing viral components through pattern recognition receptors, including toll-like receptors, leading to the activation of interferon-stimulated genes which modulate the replication of the virus. 3.3. Lamivudine was one of the first antiviral drugs approved for hepatitis B, and although it was effective in reducing viral load and improving liver function initially, its long-term use is limited by the rapid emergence of drug-resistant HBV strains, emphasizing the need for newer agents with a higher genetic barrier to resistance. 34. Sequencing of the hepatitis B virus genome has led to the identification of several genotypes, labeled A to J, which have variable geographical distribution and slightly differing replication efficiency, clinical outcomes, and response to therapy, thereby influencing regional treatment guidelines and vaccination programs. 35. In cases of acute hepatitis B, the virus is often cleared spontaneously in immunocompetent adults, with less than 5% of these cases progressing to chronic infection, in contrast to neonates and young children who have a higher risk of developing chronic hepatitis B due to their immature immune system. '36. Hepatitis B is considered an occupational hazard for healthcare workers due to potential exposure to infectious blood and body fluids, and strict adherence to standard precautions, along with vaccination, is essential in preventing transmission among healthcare professionals. 37. The detection of hepatitis B DNA levels through quantitative PCR testing is a key component in monitoring chronic hepatitis B management, as it provides information on viral replication activity, helps assess treatment response, and guides adjustments in therapeutic strategies to achieve optimal virologic suppression. 38. In patients with compensated cirrhosis secondary to hepatitis B, antiviral therapy can improve liver function and reduce the risk of decompensation, although close monitoring is necessary given the potential for serious complications, including hepatic decompensation and liver cancer, even during successful treatment. 39. The hepatitis B precore and basal core promoter mutations affect viral replication and expression of the hepatitis B E antigen, commonly seen in patients with HB-Ag-negative chronic hepatitis B. These mutations often result in more severe liver disease and require vigilant management to prevent adverse outcomes. The introduction of direct-acting antivirals for hepatitis C treatment has led to many co-infected with hepatitis B experiencing viral reactivation upon HCV clearance, necessitating careful monitoring and consideration of prophylactic antiviral therapy against hepatitis B in these patients. Hepatitis B can have profound psychosocial effects on affected individuals, as the stigma associated with chronic infection and potential transmission to others can lead to anxiety, depression, and social isolation, warranting comprehensive support and counseling to address these challenges alongside medical treatment. Chronic hepatitis B infection can significantly impact pregnancy outcomes, including increased risks of gestational diabetes, preterm birth, and low birth weight, and therefore requires collaboration between hepatologists and obstetricians to optimize maternal and neonatal health through careful monitoring and interventions. Hepatitis B-related acute liver failure, though rare, is a life-threatening condition that requires immediate medical attention and potentially liver transplantation, with rapid deterioration seen in patients who develop severe coagulopathy, encephalopathy, and multi-organ failure. Monitoring hepatitis B surface antigen quantification can provide prognostic information in chronic hepatitis B management, as a decline in HB's Ag levels is often associated with favorable clinical outcomes, including spontaneous disease resolution or successful response to antiviral therapy. Adolescents and adults with hepatitis B often require vaccinations against hepatitis A if they are not already immune, as co-infection with both viruses can lead to more severe liver disease. Thus, hepatitis A vaccination is routinely recommended to reduce the risk of concomitant liver insults. Patients with chronic kidney disease often have a higher prevalence of hepatitis B infection due to increased exposure from dialysis procedures, necessitating routine screening, vaccination of susceptible individuals, and careful evaluation of antiviral treatment regimens to minimize nephrotoxicity. The adoption of universal blood screening for hepatitis B in blood donation centers has greatly reduced the risk of transfusion-related transmission, as blood donors are routinely tested for HB's Ag, ensuring that blood supplies are safer and protecting recipients from acquiring the virus through transfusions. Chronic hepatitis B infection potentially elevates the risk of metabolic syndrome and cardiovascular disease secondary to chronic inflammation and liver disease, requiring integrated management strategies that address metabolic risk factors alongside liver-specific treatments. Individuals co-infected with hepatitis B virus and HIV may require specialized antiretroviral therapy regimens that effectively target both viruses, as some medications used in HIV management, such as tenofovir, are also active against HBV, necessitating coordination between hepatologists and infectious disease specialists. Understanding the transmission dynamics of hepatitis B in communities with a high prevalence of infection is critical for effective public health strategies, as tailoring prevention efforts, such as vaccination campaigns and education on safe practices, can substantially impact the overall burden of disease. Hepatitis C is a liver infection caused by the hepatitis C virus, HCV, which primarily spreads through exposure to blood contaminated with the virus, often through sharing needles or medical equipment, making early detection crucial in preventing liver damage and complications. The pathophysiology of hepatitis C involves the HCV triggering chronic inflammation in the liver, causing liver cells to die and be replaced with fibrous scar tissue, which can eventually lead to cirrhosis, impairing liver function and increasing the risk for liver cancer. Three, direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering cure rates above 90% with typically few side effects, although the choice of a specific DAA regimen depends on the viral genotype and presence of liver disease complications. Four, hepatitis C can remain asymptomatic for years, making routine screening for people at risk vital because early diagnosis allows for timely initiation of antiviral therapy to prevent progression to severe liver disease. 5. There are 6 genotypes of hepatitis C virus, each affecting treatment choices and duration, with genotype 1 being the most common in the United States and often requiring a different therapeutic approach compared to other genotypes. The diagnosis of hepatitis C involves initial screening with an HCV antibody test, followed by a confirmatory HCV RNA test if antibodies are detected, to determine whether there is an active infection needing treatment. Chronic hepatitis C infection is a leading cause of liver transplants globally due to its potential to cause cirrhosis or liver cancer, emphasizing the importance of antiviral treatment in preventing these severe outcomes. 8. Despite there being no vaccine for hepatitis C, preventive measures such as avoiding needle sharing and ensuring safe blood transfusion practices are crucial to reduce the transmission of this virus. 9. The liver damage from hepatitis C can cause complications like portal hypertension, characterized by increased blood pressure in the portal vein, leading to varices or ascites, highlighting the importance of regular monitoring in chronic cases. 10. Advanced hepatitis C with cirrhosis is a known risk factor for hepatocellular carcinoma, making regular liver ultrasounds and alpha-fetoprotein tests essential in the surveillance for liver cancer in these patients. Some patients with hepatitis C might experience extrahepatic manifestations such as mixed cryoglobulinemia, a condition causing systemic vasculitis, often requiring additional treatments like immunosuppressive therapy. Certain lifestyle modifications, like avoiding alcohol which can exacerbate liver damage, are crucial in managing hepatitis C, as alcohol consumption accelerates the progression to cirrhosis. A liver biopsy, though less commonly used now, can be helpful in assessing the extent of liver damage in hepatitis C, including the degree of inflammation and fibrosis, which can guide treatment decisions. While hepatitis C attacks liver cells preferentially, it can also affect organs outside the liver, potentially leading to complications such as renal disease or lymphomas, underscoring the need for comprehensive care. The sustained virologic response, SVR, is the goal of hepatitis C treatment, indicating that the virus remains undetectable in the blood 12 weeks after completing therapy, which is equated to a cure. In the era of DAAs, treatment regimens for hepatitis C have become shorter, typically ranging from 8 to 12 weeks, marking a significant advancement over prior treatments that could last up to a year with inferior outcomes. Hepatitis C virus can undergo genetic mutations, aiding its evasion from the immune system and the development of resistance to antiviral treatments, which necessitates the use of combination drug therapies. 18. Blood donor screening and the introduction of direct-acting antivirals have significantly reduced new hepatitis C infections, yet public health efforts continue to bridge gaps in diagnosis and treatment accessibility. 19. Hepatitis C is more infectious than HIV but less than hepatitis B in terms of blood-borne pathogens, stressing the importance of public health interventions to remain vigilant in controlling its spread. 20. During acute hepatitis C infection, only a minority of people will exhibit symptoms such as jaundice, fatigue, or abdominal pain, which often resolve spontaneously but still require medical evaluation due to the risk of progression to a chronic state. 21. Reinfection with hepatitis C is possible even after successful treatment, particularly in individuals who continue engaging in behaviors that expose them to the virus, emphasizing the importance of preventive education. 22. During pregnancy, there is a low risk of mother-to-child transmission of hepatitis C, but women with chronic infection should be monitored and counseled accordingly to minimize risk and plan for management. 23. In patients co-infected with HIV and hepatitis C, treating both conditions is crucial as they can exacerbate each other's progression, with newer direct-acting antivirals greatly improving cure rates for HCV in such cases. 24. Certain rare genetic conditions might affect the progression and treatment outcomes in hepatitis C infection, with ongoing research aiming to better understand these genetic factors and their role in personalized medicine. 25. The introduction of second-generation direct-acting antivirals marked a milestone in the management of hepatitis C, as these drugs target multiple stages of the viral life cycle, offering improved efficacy and tolerability compared to older treatments. 26. The hepatitis C virus can survive outside the body for several weeks, which highlights the importance of environmental cleaning and sterilization procedures, particularly in settings like healthcare facilities. 27. Besides liver damage, patients with chronic hepatitis C may develop insulin resistance and type 2 diabetes, necessitating diligent monitoring and management of these metabolic disorders as part of comprehensive care. 28. The global burden of hepatitis C is substantial, with millions affected across diverse geographies, necessitating international collaboration and tailored strategies to effectively manage and eliminate the disease. 29. Recent advancements in blood testing technology allow for early detection of hepatitis C, including the use of rapid diagnostic tests, which enhance screening efforts particularly in resource-limited settings. 30. Injection drug use remains the most significant risk factor for hepatitis C transmission in high-income countries, driving initiatives aimed at harm reduction, such as needle exchange programs to mitigate disease spread. 31. Chronic hepatitis C infection can affect mental health, contributing to cognitive impairment or depression, which calls for an integrative treatment approach that includes psychosocial support services. 32. Healthcare workers are at occupational risk for hepatitis C due to potential needle stick injuries, making adherence to standard precautions and the use of safety-engineered devices vital to prevent transmission. 3. Antiviral resistance in hepatitis C treatment is rare but can occur in poorly adherent patients or those with prior treatment experience, making rigorous follow-up and education on adherence crucial for achieving optimal outcomes. 34. Given that hepatitis C can lead to hepatic encephalopathy, a condition characterized by confusion and altered consciousness due to liver dysfunction, monitoring and preventive strategies, including supplemental treatment to manage ammonia levels, are critical. Exposure to hepatitis C does not confer protective immunity as seen in some other viral infections, thus individuals remain susceptible to future reinfections and should continue adopting preventive measures post-treatment. Hepatitis C virus belongs to the Flaviviridae family, possessing a single-stranded RNA genome, with its genotype and viral load influencing clinical manifestation, natural progression, and response to treatment. In patients with hepatitis C cirrhosis, careful management and regular monitoring of liver function are essential, as portal hypertension can lead to life-threatening variceal hemorrhage if not controlled properly. Direct-acting antivirals targeting protease, nucleotide polymerase, and NS5A proteins are the cornerstone of modern hepatitis C treatment regimens, disrupting viral replication at different stages to achieve sustained virologic response. Co-infection with hepatitis B and hepatitis C complicates clinical management as both viruses have the potential to cause liver damage, necessitating individualized treatment strategies and careful monitoring for reactivation. Hepatitis C testing is recommended for all individuals born between 1945 and 1965 in the United States, as this cohort, often termed baby boomers, demonstrates a significantly higher prevalence of the infection. Although previously thought incurable, advancements in hepatitis C research have highlighted the critical role of the host immune system, leading to innovative therapies exploiting both direct-acting antivirals and immunomodulatory effects. Individuals with advanced liver fibrosis from chronic hepatitis C are at an increased risk for cardiovascular diseases such as myocardial infarction, pointing to the need for comprehensive health monitoring beyond just liver function. Adequate nutritional support is paramount in managing hepatitis C, with an emphasis on maintaining healthy body weight, optimizing liver function, and potentially reducing inflammation through a well-balanced diet. In pediatric hepatitis C infections, though rare, early diagnosis and treatment are key to preventing disease progression and ensuring long-term liver health, as children generally respond well to direct-acting antiviral regimens. Researchers continue to explore potential therapeutic vaccines for hepatitis C, focusing on stimulating the body's immune response to prevent infection or aiding in viral clearance in those already infected. Hepatitis C treatment adherence remains crucial in achieving viral eradication, as missing doses or incomplete therapy can lead to suboptimal outcomes and increased risk of developing drug-resistant virus strains. While telemedicine has expanded access to hepatitis C care, contributing to improved treatment uptake in remote or underserved areas, ongoing challenges include ensuring adequate patient follow-up and managing compliance. The social stigma associated with hepatitis C can be a barrier to diagnosis and treatment. Therefore, public health initiatives must address misconceptions and educate communities to foster an environment conducive to seeking care. Recent efforts in mapping the hepatitis C genome have provided insights into viral diversity and mechanisms of persistence, paving the way for more effective and targeted therapies that could potentially lead to the virus's eradication. 50. Understanding the role of liver stiffness measurement via transient elastography offers a non-invasive method to assess liver fibrosis in hepatitis C patients, aiding in diagnosis and monitoring disease progression without the need for liver biopsy. One. Prostate cancer is the most commonly diagnosed cancer among men worldwide, affecting significant numbers annually and emphasizing the importance of routine screening and early detection methods like PSA blood tests and digital rectal examinations to identify the disease at stages where it is most treatable and potentially curable. Two. Age is a primary risk factor for prostate cancer, with the majority of cases occurring in men over the age of 65. And it is rarely seen in men under 40, indicating the necessity for heightened awareness and regular monitoring as men age. Three. Family history plays a significant role in prostate cancer risk, with men having a first-degree relative with the disease being more than twice as likely to develop it themselves, highlighting the genetic components that must be considered in risk assessments and screenings. 4. The symptoms of prostate cancer can be subtle and may include difficulty urinating, loss of bladder control, and bone pain, which often appear once the cancer has spread beyond the prostate, thus underlining the importance of early diagnostic procedures. Five. The Gleason score is a grading system used to evaluate the prognosis of prostate cancer by examining the patterns of cancer cells in the prostate, with scores ranging from 2 to 10, where higher scores indicate more aggressive and poorly differentiated tumors. Six. Prostate cancer can exist in various forms, from indolent types that grow very slowly and may not require immediate treatment to aggressive cancers that quickly spread to bones and other organs, necessitating prompt and comprehensive therapeutic approaches. 7. Aside from family history, ethnicity is a known risk factor for prostate cancer, with African American men having a higher likelihood of developing the disease compared to Caucasian and Asian men, necessitating tailored strategies for prevention and early intervention. 8. The development of prostate cancer is associated with hormonal factors, particularly the role of androgens like testosterone, which can fuel the growth of cancer cells, making hormonal therapy a pivotal treatment for advanced stages of the disease. 9. A biopsy is the definitive method for diagnosing prostate cancer, involving the extraction and microscopic examination of prostate tissue samples, which determines the presence, extent, and grade of cancer, guiding subsequent management decisions and treatment planning. 10. Radical prostatectomy, the surgical removal of the entire prostate gland along with some surrounding tissue, is a standard treatment option for localized prostate cancer and can lead to a high probability of curing the disease when performed at an early stage. 11. Radiation therapy, using high-energy beams to target and kill cancer cells, serves as a primary or adjunctive treatment option for prostate cancer, showing particular efficacy in localized cancer in situations where surgery might not be feasible. 12. Active surveillance is a management strategy for low-risk prostate cancer cases where the disease is closely monitored through regular testing and biopsies, deferring immediate treatment unless there are signs of progression or significant changes. 13. Androgen deprivation therapy, ADT, is a cornerstone treatment for advanced prostate cancer, involving medications or surgical procedures that lower testosterone levels, slowing cancer growth and reducing symptoms, albeit with potential side effects like hot flashes and reduced libido. 14. PSA, or prostate-specific antigen, is a protein produced by prostate cells and measured through blood tests, serving as a marker for prostate health with elevated levels potentially indicating cancer or other prostate disorders, thus aiding in screening and monitoring. 15. The role of chemotherapy in prostate cancer is typically reserved for advanced stages where the cancer no longer responds to hormone therapy alone, utilizing drugs that kill rapidly dividing cells, thereby managing symptoms and potentially extending survival. 16. Immunotherapy for prostate cancer, which harnesses the body's immune system to attack cancer cells, is an evolving field with treatments like Sipuleucel T providing a novel approach for certain patients with metastatic castration-resistant prostate cancer. 17. Bone metastases are common in advanced prostate cancer, leading to complications like fractures and pain, and require targeted therapies such as bisphosphonates or radiation to reduce skeletal-related events and improve quality of life. 18. Obesity is a modifiable risk factor that may influence the development and progression of prostate cancer, with evidence suggesting that excess weight is linked to an increased risk of aggressive disease and poorer outcomes, highlighting the importance of maintaining a healthy lifestyle. 19. The association between diet and prostate cancer risk is still under investigation, with studies exploring the potential protective effects of diets rich in fruits, vegetables, and fish, and the possibly increased risks posed by high consumption of red and processed meats. 20. Genetic testing for BRCA1, BRCA2, and other similar mutations is advised for men with a strong family history of prostate cancer, as some mutations can elevate risk and influence personalized screening and treatment strategies for individuals at genetic risk. 21. Prostate cancer's microenvironment is complex, with stromal cells, immune infiltrates, and signaling molecules interplaying with cancer cells, influencing tumor initiation, growth, and resistance to therapies, underscoring the need for comprehensive treatment strategies. 22. MRI-guided biopsy is an advanced diagnostic technique that improves the accuracy of prostate cancer detection by using magnetic resonance imaging to target suspicious areas within the prostate, potentially leading to more precise and earlier identification of significant cancers. 23. Chronic inflammation and prostatitis have been investigated as potential factors in prostate cancer development, with some studies suggesting that inflammatory processes could contribute to carcinogenesis, though more research is needed to establish definitive causal links. 24. Advances in precision medicine are shaping the future of prostate cancer treatment, where specific genetic and molecular profiles of a patient's tumor can guide individualized therapy choices, improving effectiveness and minimizing unnecessary side effects. 25. Prostate cancer staging is crucial for determining the appropriate treatment approach, with stages ranging from I to IV, indicating the tumor's extent and spread from localized to distant metastasis, which directly influence prognosis and therapeutic decisions. 26. Cryotherapy is an alternative treatment option for localized prostate cancer where extreme cold is used to freeze and kill cancerous tissue, offering a less invasive method compared to surgery, though primarily utilized for patients with recurrent disease after radiation. 27. The role of vitamin D in prostate cancer prevention and treatment is a topic of ongoing research, as its potential anti-cancer properties and influence on prostate cell growth suggest that adequate levels may offer some protective benefits, though evidence remains inconclusive. 28. Robotic-assisted laparoscopic prostatectomy is a minimally invasive surgical technique used to remove the prostate with precision and typically results in quicker recovery times, less blood loss, and reduced likelihood of long-term complications compared to open surgery. 29. External beam radiation therapy, EBRT, for prostate cancer involves directing beams of radiation from outside the body to the prostate, effectively treating localized cancers with sophisticated techniques like intensity-modulated radiation therapy, IMRT, that maximize tumor targeting while sparing healthy tissue. 30. Brachytherapy is a form of internal radiation treatment for prostate cancer where radioactive seeds are implanted directly into the prostate tissue, providing targeted therapy with minimal exposure to surrounding organs, making it a suitable option for some localized cancers. 31. The concept of the prostate cancer gray zone describes cases with intermediate risk features where treatment decisions are particularly challenging, as they require careful consideration of potential benefits versus adverse effects, emphasizing the importance of individualized patient counseling. 32. Hormone-refractory prostate cancer occurs when the disease progresses despite androgen deprivation therapy, necessitating alternative treatment modalities such as second-line hormonal therapies, chemotherapy, or participation in clinical trials evaluating novel agents. 3.3. Neuroendocrine differentiation in prostate cancer is an aggressive variant that demonstrates unique histological features and may arise de novo or following hormonal therapy, necessitating distinct management approaches as it often shows resistance to conventional treatments. 34. The ongoing debate about the benefits and harms of PSA screening highlights the importance of shared decision-making between patients and healthcare providers, considering individual risk factors and preferences when deciding the appropriate age and frequency for testing. 35. Focal therapy for prostate cancer is an innovative approach that treats only the cancerous part of the prostate, utilizing techniques like HIFU, high-intensity focused ultrasound, to minimize side effects while effectively controlling the disease, although long-term outcomes are still under evaluation. 36. Combination therapies, involving the concurrent use of multiple treatments such as ADT and radiation, have been shown to improve survival outcomes in patients with high-risk prostate cancer, emphasizing the importance of a multidisciplinary approach in managing complex cases. 37. Sarcomatoid differentiation in prostate cancer is a rare but aggressive form characterized by a mixture of epithelial and mesenchymal features, associated with poor prognosis and challenging treatment courses, often necessitating a combination of surgery, chemotherapy, and radiation. 38. Sentinel lymph node biopsy is an emerging technique in prostate cancer that identifies the first lymph nodes to which cancer cells are likely to spread, providing valuable staging information that can guide the extent of surgical intervention and additional therapies. 39. The impact of prostate cancer on sexual health and function is significant, with treatments like surgery and radiation potentially affecting erectile function. Hence the importance of discussing potential side effects and considering options like nerve-sparing techniques or penile rehabilitation. 40. Timely management of urinary symptoms associated with prostate cancer can improve quality of life, whether through surgical intervention, medications, or lifestyle modifications aimed at addressing obstructive urinary issues or irritative symptoms linked to treatment. 41. A multidisciplinary prostate cancer clinic involves specialists from urology, oncology, radiology, and other fields collaborating to create a comprehensive care plan tailored to each patient's unique clinical situation, optimizing outcomes through a coordinated approach. 42. Investigations into the microbiome and its relationship with prostate cancer suggest that bacterial colonization and the body's microbiota may play a role in disease development and progression, although concrete mechanisms and therapeutic implications are yet to be determined. 43. Advanced imaging technologies such as PSMA, prostate-specific membrane antigen, PET scans provide superior specificity and sensitivity in detecting prostate cancer metastasis, particularly in cases of biochemical recurrence where conventional imaging falls short. 44. Cognitive decline and mood changes are potential side effects associated with hormone therapy for prostate cancer, reflecting the far-reaching impacts of treatment on a patient's overall well-being and the need for comprehensive supportive care measures. Metastatic castration-resistant prostate cancer, mCRPC, represents a treatment-resistant stage where the cancer progresses despite androgen deprivation therapy, requiring innovative therapeutic options such as targeted therapies and novel androgen pathway inhibitors. The risk factor of dietary fat intake in prostate cancer remains contentious. However, some studies suggest that high consumption of saturated fats may correlate with an increased risk of aggressive forms, signifying the potential benefits of dietary modifications in prevention strategies. 47. Sarcopenia, or the loss of skeletal muscle mass and strength, can be a concern in prostate cancer patients, particularly those undergoing ADT, highlighting the importance of exercise regimens and nutritional support to maintain muscle health and minimize treatment-associated morbidities. 48. The psychological impact of a prostate cancer diagnosis can be profound, contributing to anxiety and depression, underscoring the necessity for mental health support and counseling as integral components of comprehensive cancer care. 49. Liquid biopsies, which analyze circulating tumor DNA in the blood, represent a promising non-invasive method for detecting and monitoring prostate cancer, offering insights into tumor genetics and treatment resistance patterns that can inform personalized therapeutic decisions. 50. Radioligand therapy, an experimental approach in prostate cancer treatment, utilizes molecules that deliver radiation directly to cancer cells while sparing normal tissues, showing promise in early trials for patients with advanced disease that has not responded to conventional treatments. 1. Non-alcoholic fatty liver disease, NAFLD. The hepatic manifestation of metabolic syndrome is characterized by excessive fat accumulation in liver cells, often due to insulin resistance, and is the most common cause of chronic liver disease worldwide, affecting nearly 1 billion individuals and potentially leading to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, fibrosis, cirrhosis, or hepatocellular carcinoma if left unchecked over the years. 2. The pathophysiology of fatty liver disease involves a two-hit hypothesis where the first hit is the accumulation of triglycerides in the hepatocytes, creating a state vulnerable to lipotoxicity, and the second hit involves oxidative stress, cytokines, and mitochondrial dysfunction that progress hepatic inflammation and fibrosis, emphasizing the complexity and multifactorial nature of this condition. 3. Magnetic resonance imaging, MRI, proton density fat fraction, PDFF, is emerging as a non-invasive gold standard for quantifying hepatic steatosis in NAFLD, providing a comprehensive assessment of liver fat content that is more precise than ultrasound and CT and lacking the invasiveness and risks associated with liver biopsy, thus contributing to better disease management and monitoring of therapeutic responses. 4. The primary treatment approach for non-alcoholic fatty liver disease focuses on lifestyle interventions, primarily weight loss through dietary modifications and increased physical activity, with evidence showing that a modest reduction of 5 to 10% in body weight can significantly reduce liver fat, ameliorate inflammation and fibrosis, and improve overall liver function, often reversing fatty liver changes. 5. The use of vitamin E as a therapeutic agent in non-alcoholic steatohepatitis has gained traction due to its antioxidant properties, with studies demonstrating that high-dose vitamin E supplementation can improve liver histology, reduce hepatic inflammation, and increase indices of liver function in non-diabetic NASH patients, although caution is advised regarding long-term use and potential cardiovascular risks. 6. In NAFLD, the liver enzyme alanine aminotransferase (ALT) is often elevated. However, normal ALT levels do not exclude the presence of significant liver damage, emphasizing the importance of considering a full panel of liver function tests alongside imaging techniques and histological assessment when diagnosing and monitoring this stealthy and often silent hepatic condition. 7. Advances in our understanding of gut-liver axis dysregulation in NAFLD have highlighted the role of dysbiosis and intestinal permeability in promoting hepatic fat accumulation and inflammation, pointing to the therapeutic potential of probiotics, prebiotics, and fecal microbiota transplantation in modulating gut microbiota composition and function as a novel avenue for treatment. 8. Insulin resistance is a crucial player in the pathogenesis of non-alcoholic fatty liver disease, where excessive lipolysis and increased free fatty acid influx into the liver, driven by hyperinsulinemia, play a pivotal role in hepatic fat deposition, reinforcing the interconnectivity between metabolic disturbances and liver health, and supporting the utilization of insulin-sensitizing agents like metformin in some patient populations. 9. Hepatocyte apoptosis, mediated by pathways involving endoplasmic reticulum stress and death receptor activation, is a significant contributor to liver injury and progression in NAFLD, suggesting that agents targeting these apoptotic pathways could offer novel therapeutic benefits by interrupting this self-perpetuating cycle of liver cell death and fibrogenesis. 10. Detection of genetic polymorphisms such as in the PNPLA3 gene highlights a genetic predisposition that significantly influences individual susceptibility to fatty liver disease in its progression, thus directing research towards personalized medicine approaches where genetic screening could inform risk assessment, prognosis, and tailored therapeutic strategies. 11. Bariatric surgery, particularly Roux-en-Y gastric bypass, has emerged as a highly effective treatment for morbidly obese patients with NAFLD, resulting in substantial and sustained weight loss, resolution of hepatic steatosis, and regression of fibrosis, positioning it as a viable option in severe cases where conservative management has failed and the risk of progression is high. 12. The mitochondrial dysfunction observed in NAFLD stems from impaired oxidative phosphorylation and an increase in reactive oxygen species, which contribute to steatosis, cellular damage, and fibrosis, indicating a potential therapeutic role for agents aimed at enhancing mitochondrial function and protecting against oxidative stress in the treatment landscape. 13. Obstructive sleep apnea, OSA, has been identified as a contributing factor to the progression of NAFLD through mechanisms involving intermittent hypoxia and sympathetic activation, making the treatment of OSA with continuous positive airway pressure, CPAP, a potentially beneficial adjunct in slowing disease progression and improving liver health. 14. Although traditionally associated with alcohol, steatohepatitis can develop in non-drinkers who consume excessive fructose, which is metabolized in the liver, resulting in de novo lipogenesis and increased triglyceride synthesis, underlining the impact of dietary choices on liver health and the importance of reducing fructose intake for NAFLD patients. 15. The concept of metabolic-associated fatty liver disease, MAFLD, has been proposed to more accurately reflect the metabolic underpinnings and multisystem involvement of fatty liver disease, emphasizing the transition towards a diagnostic approach that integrates metabolic risk factors, allowing for better stratification and management in clinical practice. 16. Emerging evidence suggests that certain medications, such as statins and SGLT2 inhibitors, not only manage associated metabolic conditions but also provide ancillary benefits for liver health, including reductions in liver fat and fibrosis, showcasing the potential of repurposing existing cardiometabolic medications to tackle the hepatic sequelae of metabolic syndrome. Choline, an essential nutrient found in eggs, meat, and fish, plays an important role in preventing liver steatosis by assisting in lipoprotein assembly and VLDL secretion, reinforcing the nutritional importance of adequate choline intake and the potential consequences of deficiency in exacerbating fatty liver conditions. Hepatic macrophages, or Kupffer cells, are key drivers of inflammation in fatty liver disease through the production of pro-inflammatory cytokines, which contribute to the exacerbation of liver injury and fibrosis. Thus, modulating the activity of these immune cells represents a promising therapeutic avenue to mitigate liver inflammation and progression. Ethnic variations in the prevalence and severity of NAFLD suggest that genetic, lifestyle, and environmental factors intersect to influence disease distribution, with studies demonstrating higher susceptibility among Hispanic individuals, highlighting the need for culturally tailored interventions and awareness campaigns that address specific risks and misconceptions. Omega-3 fatty acids, abundant in fish oils, have been shown to reduce liver fat, inflammation, and triglyceride levels, indicating their potential as a supportive therapy in NAFLD management, especially for individuals who may not respond adequately to lifestyle changes alone, and underscoring the importance of dietary management in liver health. The endocannabinoid system is increasingly recognized as a crucial modulator of hepatic energy storage, inflammation, and fibrosis in NAFLD, thus emerging as a potential target for treatment. Cannabinoid receptor antagonists, despite controversy, offer exciting possibilities for intervening in this pathway and controlling disease progression. The presence of liver fibrosis in NAFLD significantly increases the risk of adverse outcomes, making fibrosis staging vital in risk stratification and management decisions, with non-invasive biomarkers and elastography techniques offering reliable alternatives to liver biopsy, providing accessible and safer methods for assessing fibrosis risk. Identifying and managing comorbid conditions such as type 2 diabetes, hypertension, and dyslipidemia is crucial in NAFLD management, as these conditions share underlying pathophysiological links with liver disease and can exacerbate NAFLD progression, necessitating a comprehensive and multidisciplinary approach for optimal outcomes. Alcoholic fatty liver disease and non-alcoholic fatty liver disease share similar histological features, making clinical distinction based on history and risk factors essential for diagnosis, with alcohol abstinence serving as a critical and effective intervention for those with alcohol-related liver disease, whereas lifestyle changes remain foundational for NAFLD. Given the silent nature of early-stage NAFLD, routine screening for fatty liver in patients with obesity, metabolic syndrome, or type 2 diabetes is recommended to facilitate early diagnosis and intervention, underscoring the importance of awareness and vigilance in primary care and the potential benefit of periodic liver assessments in at-risk populations. Leptin resistance, often noted in individuals with obesity, contributes to steatosis by impairing the regulation of appetite and energy expenditure and promoting pro-inflammatory cytokines that exacerbate liver inflammation and fibrosis, presenting a target for novel therapies aimed at restoring leptin sensitivity and breaking the cycle of metabolic dysregulation. The prevalence of pediatric NAFLD is rising alarmingly, mirroring the increase in childhood obesity, with studies indicating that early onset of fatty liver can predispose youth to severe liver complications in adulthood, highlighting the urgency for public health interventions focusing on diet, physical activity, and lifestyle in childhood and adolescence. 28. The gut-derived hormone fibroblast growth factor 19, FGF19, is implicated in the regulation of bile acid synthesis and glucose metabolism. Its therapeutic modulation offers intriguing prospects for correcting metabolic dysfunction and reducing liver fat content in patients with NAFLD, representing a promising area for novel therapeutic development. '29. Studies on liver fat quantification techniques have illuminated the efficacy of controlled attenuation parameter, CAP, via transient elastography, which provides a reliable, non-invasive, and widely accessible method for assessing hepatic steatosis, facilitating early diagnosis and monitoring while circumventing the risks and discomfort of liver biopsy. '30. Gender differences in NAFLD reveal that men tend to develop the disease earlier, while women, particularly postmenopausal women, face a higher risk of disease progression, suggesting the influence of hormonal factors in disease dynamics and underlining the importance of gender-specific research and treatment approaches. '31. Pharmacological interventions targeting the insulin pathway, such as thiazolidinediones, are undergoing investigation to address insulin resistance in NAFLD patients, offering potential benefits in reducing liver fat, inflammation, and fibrosis, although balanced against potential side effects such as weight gain and cardiovascular risk. '32. Ectopic fat deposition, not only in the liver but also in muscles and the pancreas, constitutes an important aspect of the metabolic disturbances associated with NAFLD, highlighting the interconnected nature of metabolic health and the necessity for interventions that address overall body composition and systemic insulin sensitivity. '33. Oxidative stress biomarkers such as melandialdehyde and 8-isoprostane provide valuable insights into the oxidative damage occurring in NAFLD, serving as potential diagnostic and prognostic tools for assessing the severity and progression of the disease and guiding antioxidant-based therapeutic strategies. '34. Emerging research into the role of bile acids and the farnesoid X receptor, FXR, in NAFLD pathogenesis underscores their influence on lipid metabolism, hepatic inflammation, and fibrosis, identifying FXR agonists as promising candidates in the development of targeted therapeutics aimed at mitigating disease progression. '35. The utilization of artificial intelligence and machine learning in analyzing electronic health records and imaging data holds great promise for enhancing the accuracy of NAFLD diagnosis and risk stratification, expediting the identification of high-risk individuals, and optimizing personalized treatment plans in a rapidly evolving healthcare landscape. '36. The increase in lipotoxic intermediates such as diacylglycerol and ceramides in the liver has been linked to insulin resistance and hepatic inflammation, pointing to these lipid species as potential therapeutic targets in efforts to reduce liver fat accumulation and improve insulin sensitivity in patients with NAFLD. '37. Advanced glycation end products, AGEs, accumulate in NAFLD due to high blood sugar levels and oxidative stress, contributing to liver inflammation and fibrosis, and emphasizing the importance of managing glycemic control and reducing dietary AGE intake as part of a comprehensive liver health strategy. '38. Studies indicate a pivotal shift in lipid droplet biology and homeostasis within hepatocytes during NAFLD, with proteins involved in droplet formation and breakdown offering insights into novel therapeutic targets focused on normalizing lipid storage and mobilization processes within the liver. '39. Visceral adiposity is closely linked to NAFLD, with evidence suggesting that reduction of visceral fat through targeted interventions such as aerobic and resistance exercise significantly diminishes liver fat and inflammation, reinforcing the importance of managing central obesity as a cornerstone of NAFLD prevention and treatment. '40. Various cellular types within the liver, including hepatic stellate cells and ductular reaction cells, contribute to fibrogenesis in NAFLD through the secretion of extracellular matrix proteins, highlighting the diverse cellular contributions to liver fibrosis and the need for therapies targeting multiple cellular and molecular pathways. Plasma biomarkers like cytokeratin 18 fragments offer non-invasive means of diagnosing steatohepatitis in NAFLD patients by reflecting hepatocyte apoptosis, providing an important diagnostic alternative that may guide treatment decisions and evaluate responses without resorting to invasive liver biopsy techniques. 42. Disruption of circadian rhythms, often due to modern lifestyle patterns like shift work and poor sleep hygiene, can exacerbate metabolic disorders such as NAFLD by altering hepatic glucose and lipid metabolism, underlining the potential benefits of chronotherapeutic approaches that align treatment and lifestyle modifications with natural circadian rhythms. 43. Using dietary supplements like berberine, an alkaloid derived from plants, has shown promise in improving insulin sensitivity, reducing hepatic steatosis, and exerting overall beneficial metabolic effects, suggesting an additional, complementary role in managing NAFLD when combined with lifestyle interventions. 44. Iron overload, often detected through elevated serum ferritin levels in NAFLD patients, has been associated with increased hepatic inflammation and fibrosis, advocating for the assessment of iron status in NAFLD management and considering therapeutic phlebotomy or iron chelation as potential interventions in cases of significant iron burden. 45. The inconspicuous clinical course of NAFLD contrasts with its potential for serious complications, necessitating vigilant, regular follow-ups, including metabolic health assessments and liver function tests, to promptly identify transitions to more advanced liver disease and initiate timely interventions. 46. Genetic studies of NAFLD have also identified contributions from variants like TM6SF2 and GCKR, further elucidating the complex heritability and genetic risk factors involved in susceptibility and progression, reinforcing the potential for future genetic screening approaches to personalize and optimize patient management. 47. Pharmacological advances in the form of dual peroxisome proliferator activated receptor (PPAR) agonists are currently under investigation as potential NAFLD treatments due to their capacity to modulate lipid metabolism, reduce inflammation, and improve insulin sensitivity, offering a promising multifaceted approach to care. 48. Inflammation in NAFLD is driven not just by classic cytokines like TNF-alpha but also by novel mediators like TGF-beta and IL-1-beta, highlighting the importance of targeted anti-inflammatory strategies that can halt the progressive nature of this disease and address underlying molecular inflammations. 49. The measurement of liver stiffness via elastography provides an indirect yet valuable assessment of liver fibrosis in NAFLD patients, offering a non-invasive diagnostic tool that stratifies fibrosis risk and guides clinical decision-making in managing the disease without the need for invasive procedures. 50. Emerging therapeutic strategies for NAFLD include targeting microRNAs, which regulate gene expression involved in lipid metabolism, fibrogenesis, and inflammation, representing a new frontier in the molecular treatment of NAFLD and offering exciting possibilities for future pharmacologic development. 1. Hepatocellular carcinoma, HCC, is a primary liver cancer typically arising in the context of chronic liver disease, often precipitated by hepatitis B or C infections, obesity-related fatty liver disease, or chronic alcohol consumption, exhibiting a multifocal growth pattern within the liver and, in advanced stages, commonly producing elevations of the tumor marker alpha-fetoprotein, AFP. 2. The complex interplay between hepatic stellate cell activation and the surrounding inflammatory milieu can promote fibrosis and cirrhosis, which are significant risk factors for the development of hepatocellular carcinoma, with these cells contributing to the deposition of extracellular matrix and fibrous tissue, setting a fertile ground for oncogenesis. 3. Advances in imaging technology, including contrast-enhanced multiphase CT or MRI scans, have dramatically improved the ability to pinpoint and stage hepatocellular carcinoma, allowing for detailed visualization of tumor vasculature, perfusion characteristics, and differentiation of HCC from benign hepatic lesions. 4. Liver biopsy, though historically considered the gold standard for diagnosing hepatocellular carcinoma, is increasingly being supplanted by non-invasive imaging studies that leverage characteristic radiologic criteria, such as arterial phase hyperenhancement and washout in the venous phase, supplemented by clinical and serologic data. 5. The Barcelona Clinic Liver Cancer (BCLC) staging system is frequently used to classify hepatocellular carcinoma patients and guide treatment decisions, efficiently stratifying patients based on prognostic factors such as tumor size and number, liver function, and performance status to optimize therapeutic outcomes. Six. Surgical resection remains a potentially curative option for hepatocellular carcinoma, particularly in patients with solitary tumors confined to one liver lobe and well-preserved liver function, though postoperative recurrence remains a significant challenge requiring close surveillance and adjunctive treatments. 7. Liver transplant offers the highest chance for cure in patients with hepatocellular carcinoma who fit the Milan criteria, typically defined as a single tumor is less than or equal to 5 cm or up to 3 tumors is less than or equal to 3 cm each, providing not only a complete oncological resection but also correction of underlying cirrhosis. 8. Transarterial chemoembolization (TACE), a localized form of treatment for hepatocellular carcinoma, involves the delivery of chemotherapeutic agents directly into the hepatic artery supplying the tumor, followed by embolization to restrict the blood flow, inducing ischemia in neoplastic cells. 9. Sorafenib, a multikinase inhibitor, has become a cornerstone of systemic therapy in advanced hepatocellular carcinoma by inhibiting tumor cell proliferation and angiogenesis through blocking the RAF-MEK-ERK pathway and vascular endothelial growth factor receptors, extending patient survival. 10. The pathogenesis of hepatocellular carcinoma involves genetic alterations such as mutations in the TP53 and CTNNB1 genes, which disrupt normal cell cycle control and WNT signaling pathways, leading to unchecked cell proliferation and, ultimately, transformation into malignant hepatic cells. 11. Immunotherapy, particularly immune checkpoint inhibitors like nivolumab and pembrolizumab, has shown promise in the treatment of hepatocellular carcinoma by enhancing the immune system's ability to recognize and attack cancerous cells, offering new hope for patients with previously limited options. 12. The role of the tumor microenvironment in hepatocellular carcinoma is crucial, with the interplay between cancer-associated fibroblasts, immune cells, and extracellular matrix components fostering a pro-tumorigenic environment that supports tumor growth, invasion, and resistance to therapy. 13. Radiofrequency ablation (RFA) is a minimally invasive procedure utilized for treating small hepatocellular carcinoma lesions by inserting a needle electrode into the tumor and delivering high-frequency electrical currents, which generate heat and induce coagulative necrosis of malignant cells. 14. The use of liver imaging reporting and data system, LIRADS, in the evaluation of hepatocellular carcinoma helps standardize reporting, ensuring consistent interpretation of imaging findings, and increases diagnostic accuracy by providing a structured approach for classifying liver lesions based on imaging features. 15. The phenomenon of tumor heterogeneity in hepatocellular carcinoma can lead to differential response to treatments and contributes to the difficulty in achieving sustained remission, as subpopulations of cells may harbor distinct genetic profiles and adaptive mechanisms that enable survival under therapeutic pressure. 16. Hepatocyte nuclear factors and microRNAs play key roles in the transcriptional regulation and post-transcriptional modulation of genes involved in hepatocarcinogenesis, where dysregulation of these molecules can affect pathways integral to cell growth, apoptosis, and differentiation in hepatocellular carcinoma. 17. Exercise has shown potential as an ancillary therapeutic measure in hepatocellular carcinoma, improving patient quality of life and potentially influencing disease progression by modulating inflammatory cytokine levels and insulin sensitivity, although more research is needed to establish definitive benefits. 18. Aflatoxin exposure, particularly in regions where it contaminates staple crops, remains a significant risk factor for hepatocellular carcinoma, as the mycotoxin induces mutations in the DNA of hepatocytes, prominently the TP53 gene, leading to malignant transformation and promoting liver cancer development. 19. The phenomenon of non-cirrhotic HCC is increasingly being recognized, where hepatocellular carcinoma develops in the absence of cirrhosis, often linked to metabolic risk factors such as obesity, diabetes, and non-alcoholic steatohepatitis, challenging traditional paradigms of liver cancer pathogenesis. 20. The surgical technique and extent of resection in hepatocellular carcinoma are critical, with margins of at least 1 cm being preferred to reduce recurrence rates, while preserving enough liver function through careful consideration of the patient's future liver remnant to prevent postoperative liver failure. 21. In the genetic landscape of hepatocellular carcinoma, chromosomal instability, copy number variations, and epigenetic changes, such as DNA methylation and histone modifications, contribute to oncogen activation and tumor suppressor gene silencing, playing pivotal roles in tumor initiation and progression. 22. The hepatitis B virus X protein, HBX, is implicated in the development of hepatocellular carcinoma, exerting multiple effects including disruption of cellular signaling pathways, inhibition of tumor suppressor proteins, promotion of cell cycle progression, and induction of immune tolerance, facilitating liver carcinogenesis. 23. Digital pathology and artificial intelligence are emerging as powerful tools in hepatocellular carcinoma research, offering potential for improved diagnostic accuracy, identification of novel biomarkers, and personalized medicine approaches by processing large volumes of histopathological data efficiently. 24. Hepatocellular carcinoma can exhibit diverse histological subtypes, such as fibrolamellar carcinoma, which typically affects younger patients and has distinct prognostic implications, with the fibrolamellar variant often associated with better survival outcomes compared to conventional HCC subtypes. 25. Advances in liquid biopsy technologies allow for minimally invasive detection and monitoring of hepatocellular carcinoma using circulating tumor DNA or tumor-derived exosomes, offering insights into tumor genetics, treatment response, and potential recurrence without the need for traditional tissue biopsies. 26. The concept of field cancerization in hepatocellular carcinoma highlights the prevalence of precancerous changes or preneoplastic lesions within a chronically injured liver, where regions affected by ongoing inflammation and fibrosis provide a conducive environment for tumor development. '27. The advent of drug-eluting beads used in transarterial chemoembolization introduces a method for sustained local drug delivery in hepatocellular carcinoma treatment, designed to improve the therapeutic index by targeting chemotherapeutic agent release directly at the tumor site with prolonged activity. '28. Understanding the role of gut-liver axis dysbiosis in hepatocellular carcinoma is gaining attention, where microbial composition and translocation of microbial products can influence hepatic inflammation, fibrosis, and carcinogenesis, prompting interest in microbiome-targeted therapies as a potential intervention. '29. Epigenomic research in hepatocellular carcinoma reveals the influence of environmental and lifestyle factors on gene expression, where diet, pollutants, and viral exposures can lead to systemic alterations in DNA methylation patterns or histone modifications that may forecast cancer susceptibility and progression. '30. Alcohol-induced hepatocellular carcinoma involves complex mechanisms where chronic ethanol intake leads to oxidative stress, acetaldehyde production, alterations in lipid metabolism, and DNA damage, all of which converge on promoting hepatocyte injury, aberrant regeneration, and subsequent neoplasia. '31. In clinical trials, combination therapy approaches that utilize checkpoint inhibitors alongside kinase inhibitors or targeted agents against specific molecular pathways present a promising frontier in the therapeutic landscape for hepatocellular carcinoma, potentially enhancing efficacy and therapeutic durability. '32. The assessment of hepatic function using scoring systems like Child-Pugh or the Model for End-Stage Liver Disease, MELD, is critical in the management of hepatocellular carcinoma, as they provide metrics for balancing oncologic intervention with preservation of quality of life and liver function. '33. Targeting angiogenesis in hepatocellular carcinoma through agents like bevacizumab, an anti-VEGF monoclonal antibody, disrupts tumor blood supply, counteracting the angiogenic stimulatory effects seen in HCC's hypoxic microenvironment and reducing tumor growth and metastasis. '34. The metabolic reprogramming observed in hepatocellular carcinoma underscores the Warburg effect, where cancer cells preferentially utilize anaerobic glycolysis over oxidative phosphorylation for energy production, contributing to rapid cell proliferation and offering potential metabolic targets for therapy. '35. Image-guided precise interventions, including microwave ablation or irreversible electroporation, are expanding the repertoire of techniques for local control of hepatocellular carcinoma, offering options for patients unsuitable for surgery with real-time imaging to optimize treatment delivery and results. '36. The investigation of circulating biomarkers, like D-gamma carboxyprothrombin and soluble programmed death ligand 1, for hepatocellular carcinoma diagnosis and prognosis is a growing field that holds promise in improving early detection and stratification of patient risk profiles. '37. Current research is exploring the role of cancer stem cells in hepatocellular carcinoma, elucidating how these cells sustain tumorigenesis, resist conventional therapies, and serve as a seed for recurrence and metastasis, paving the way for the development of CSC-targeted therapeutics. '38. The interplay of signaling pathways such as PI3K, AKT, mTOR and TGF-beta in hepatocellular carcinoma development and progression is well documented, with dysregulation leading to enhanced cell proliferation, survival, differentiation, and epithelial mesenchymal transition, making them focal points for therapeutic intervention. 39. Intra-arterial radiotherapy with yttrium-90 microspheres represents an innovative approach for treating hepatocellular carcinoma, targeting liver tumors with selective delivery of radioactive isotopes, producing localized cytotoxic effects with minimal damage to surrounding healthy tissue. 40. The psychosocial implications of hepatocellular carcinoma are substantial, as patients often grapple with the dual burden of managing oncologic and chronic liver disease, necessitating comprehensive support systems focused on mental health, social integration, and access to multidisciplinary care. 41. The examination of hepatocellular carcinoma in the context of liver transplantation involves considerations of tumor biology, organ availability, and the potential for tumor recurrence, with studies highlighting the influence of factors like pre-transplant treatment response on long-term outcomes. 42. Perioperative management in hepatocellular carcinoma surgery is crucial, requiring optimization of liver function, management of coagulopathy, and precise hemostatic control to minimize the risk of postoperative complications and ensure patient recovery and surgical success. 43. Oncolytic virotherapy is emerging as a novel treatment modality for hepatocellular carcinoma, utilizing genetically engineered viruses that selectively infect and lyse cancer cells, activating systemic anti-tumor immune responses and offering potential in combination with other immunotherapeutic strategies. 44. The utilization of computational modeling in hepatocellular carcinoma research enables simulation of tumor growth and treatment response, offering insights into the dynamic interactions between therapeutic agents and cancerous cells, which can inform the design and optimization of clinical trials. 45. The integration of radiomics, which extracts quantitative features from medical imaging, into hepatocellular carcinoma management provides a non-invasive avenue to characterize tumor phenotype, predict treatment response, and refine prognosis, with potential to advance personalized radiotherapy approaches. 46. Dietary interventions in hepatocellular carcinoma, including modulation of nutrient intake and fasting regimens, draw interest for their ability to influence metabolic pathways and immune responses, presenting opportunities to complement traditional therapies and potentially ameliorate treatment-related side effects. 47. The exploration of epigenetic targeting drugs, such as histone deacetylase inhibitors and DNA methyltransferase inhibitors in hepatocellular carcinoma, seeks to reverse aberrant epigenetic marks and restore normal gene expression patterns, presenting innovative therapeutic avenues in cancer management. 48. Hepatocellular carcinoma research increasingly recognizes the role of extracellular vesicles in mediating cell-to-cell communication within the tumor microenvironment, facilitating the transfer of oncogenic proteins and RNA species that promote metastasis and therapy resistance. 49. Intraoperative navigation using real-time image fusion techniques enhances the precision of surgical resections for hepatocellular carcinoma, potentially improving oncological outcomes by allowing surgeons to delineate tumor margins more accurately and preserve critical liver structures. 50. The potential of chimeric antigen receptor T-cell therapy in hepatocellular carcinoma is being explored, with researchers engineering T-cells to recognize liver cancer-specific antigens, offering a frontier in adoptive cell therapies that leverage targeted immune responses to eradicate malignant cells. 1. Alzheimer's disease is characterized by the progressive degeneration of cholinergic neurons within the cerebral cortex, leading to cognitive decline and a plethora of neuropsychiatric symptoms including memory loss, language deterioration, and diminished executive functioning, fundamentally impacting daily life activities. 2. 2. The key pathological hallmark of Alzheimer's disease is the accumulation of amyloid beta plaques and neurofibrillary tangles made of hyperphosphorylated tau protein within the brain, which disrupts cell communication, ultimately leading to neuron death and brain atrophy observed through imaging. 3. Although the exact cause of Alzheimer's disease remains elusive, genetic factors such as mutations in the amyloid precursor protein, presenilin 1 and 2 genes, as well as environmental influences like head injuries and cardiovascular risk factors, significantly contribute to its development. Four. Clinically, Alzheimer's disease is initially marked by mild cognitive impairment, primarily affecting recent memory, but as the disease progresses, a broad spectrum of cognitive and behavioral dysfunctions emerges, including impaired judgment, disorientation, and personality changes. 5. The diagnosis of Alzheimer's disease largely relies on a detailed clinical history, cognitive assessments such as the Mini-Mental State Examination, and neuroimaging techniques like MRI or PET scans to observe characteristic brain changes, though definitive diagnosis is post-mortem. 6. The management of Alzheimer's disease includes pharmacological treatments such as cholinesterase inhibitors like donepezil and N-methyl-D aspartate receptor antagonists like memantine aimed at temporarily improving cognitive symptoms, though they do not halt disease progression. 7. Advancements in blood biomarkers, including plasma tau and amyloid beta levels, are showing promise in early diagnosis and prognosis of Alzheimer's disease, providing a less invasive and potentially cost-effective alternative to traditional cerebrospinal fluid analysis and imaging. 8. Personalized medicine in Alzheimer's disease involves tailoring interventions including pharmacotherapy, lifestyle changes, and cognitive training based on an individual's genetic, biomarker, and phenotypic profiles to optimize therapeutic efficacy and improve quality of life. 9. Alzheimer's disease disproportionately affects women, with approximately 2/3 of diagnosed cases being female, a discrepancy that may be attributed to hormonal differences, longevity, and specific genetic factors including the presence of the APOE4 allele. 10. The vascular hypothesis of Alzheimer's posits that cerebrovascular abnormalities contribute to neuronal injury by impairing blood flow and nutrient delivery in the brain, promoting amyloid deposition and neuroinflammation, which collectively exacerbate neurodegenerative processes. 11. Immune system dysregulation plays a critical role in Alzheimer's pathophysiology, as microglial cells, the brain's resident immune cells, contribute to chronic inflammation and neuronal damage through the aberrant clearance of amyloid plaques and synaptic pruning. 12. Evidence suggests a bidirectional relationship between Alzheimer's disease and diabetes, where insulin resistance and hyperglycemia exacerbate amyloidogenesis and tau pathology, possibly through pathways involving oxidative stress and inflammatory mediators. 13. Neuroimaging advancements, such as tau PET and amyloid PET scans, are revolutionizing the field by enabling in vivo visualization and quantification of pathological aggregates, providing insights into disease progression and therapeutic response in Alzheimer's. 14. Lifestyle interventions, such as regular aerobic exercise, a Mediterranean diet rich in antioxidants and omega-3 fatty acids, and cognitive engagement, have been associated with improved cognitive function and reduced risk of Alzheimer's disease, suggesting modifiable lifestyle impacts. 15. Recent studies indicate a potential link between sleep disturbances and Alzheimer's, where poor sleep quality and sleep apnea may accelerate amyloid accumulation and tau phosphorylation, making sleep optimization a potential preventive target and therapeutic approach. 16. The gut-brain axis has emerged as a novel area of interest in Alzheimer's research, with studies investigating how dysbiosis, or imbalances in gut microbiota, may influence neuroinflammation, amyloid pathology, and cognitive function through metabolic and immune pathways. 17. The olfactory system is notably affected early in Alzheimer's disease, with loss of smell often preceding cognitive symptoms. Therefore, olfactory testing may serve as a valuable early biomarker for the detection and monitoring of disease progression. 18. A controversial but fascinating avenue of research in Alzheimer's disease involves investigating the potential infectious etiology, where certain pathogens such as herpes simplex virus type 1 might drive amyloid accumulation and neurodegeneration through chronic brain infections. 19. Cognitive remediation therapy, aimed at improving memory, attention, and problem-solving skills through repetitive systematic practice and strategies, is emerging as a non-pharmacological intervention to enhance cognitive reserve in individuals with early-stage Alzheimer's. 20. Alzheimer's disease's socioeconomic impact is profound, as it significantly increases healthcare expenditure due to the need for long-term care and leads to heavy emotional and financial burdens on caregivers, highlighting the urgent need for effective public health strategies. 21. The blood-brain barrier (BBB) dysfunction observed in Alzheimer's disease disrupts homeostasis by allowing neurotoxic molecules to enter and accumulate in the brain, exacerbating amyloid pathology and tau hyperphosphorylation, thereby contributing to neurodegeneration. 22. In Alzheimer's, altered synaptic plasticity and neurotransmitter imbalances, particularly affecting glutamate and acetylcholine levels, disrupt neural networks and cognitive processes, complicating communication between neurons and leading to memory deficits. 23. The concept of cognitive reserve explains why some individuals with significant Alzheimer's pathology can maintain cognitive function, as education, occupation, and intellectually stimulating activities are believed to enhance the brain's resilience to damage. 24. A promising area in Alzheimer's therapeutics involves monoclonal antibodies designed to target and clear amyloid beta or tau aggregates from the brain, with some demonstrating efficacy in slowing cognitive decline, though challenges remain in balancing immunotherapy risks. 25. Genomic studies have identified several risk loci and genes, such as CLU, PICALM, and CR1, associated with Alzheimer's disease pathogenesis, providing insights into novel biological pathways and potential targets for future therapeutic interventions. Recent findings indicate that oxidative stress, characterized by an imbalance between free radicals and antioxidant defenses, contributes to the neuronal injury observed in Alzheimer's disease by damaging cellular components, accelerating neuronal death and synapse loss. 27. Hypertension, through mechanisms involving vascular injury and reduced cerebral perfusion, is strongly linked to an increased risk of Alzheimer's progression, emphasizing the importance of blood pressure control in preventive strategies for cognitive impairment. 28. The role of metals in Alzheimer's disease is under investigation, as dysregulated levels of zinc, copper, and iron may promote amyloid aggregation and oxidative stress, with chelation therapy being explored as a potential approach to mitigate these effects. 29. Neurotrophic factors like brain-derived neurotrophic factor, BDNF, responsible for neuron growth and survival, are diminished in Alzheimer's patients, paving the way for treatments aimed at enhancing neurotrophic signaling to support synaptic function and plasticity. 30. Lipid metabolism dysregulation is implicated in Alzheimer's disease pathology, with disturbances in cholesterol transport and distribution in the CNS being linked to amyloid processing abnormalities, offering new avenues for lipid-modulating therapeutic strategies. (31) Recent studies suggest that astrocytes, traditionally considered supportive glial cells, play active roles in Alzheimer's disease by modulating glutamate toxicity, releasing pro-inflammatory cytokines, and influencing amyloid plaque formation and clearance. (32) The exploration of non-invasive brain stimulation techniques, like transcranial magnetic stimulation, TMS, offers promise in modulating neural circuits implicated in cognition, potentially serving as adjunctive treatments to enhance cognitive function in Alzheimer patients. (33) Research into the role of mitochondrial dysfunction has highlighted its contribution to Alzheimer's disease, where impaired energy metabolism, ROS production, and calcium homeostasis are implicated in facilitating neuronal death and cognitive decline. (34) Nutraceuticals, including curcumin, resveratrol, and omega-3 fatty acids, are being investigated for their potential neuroprotective properties in Alzheimer's disease, based on their anti-inflammatory and antioxidant effects, providing additional strategies for disease management. (35) In Alzheimer's disease, cerebrospinal fluid (CSF) analysis revealing decreased amyloid beta and elevated tau protein levels serves as a diagnostic marker, reflecting the dynamics of neurodegenerative changes and providing critical information for disease staging. (36) Epigenetic modifications, such as DNA methylation and histone acetylation, are implicated in Alzheimer's disease, affecting gene expression underlying neuronal integrity and disease susceptibility, opening doors to epigenetic therapies targeting these regulatory mechanisms. (37) Neuroprotection research in Alzheimer's disease focuses on safeguarding neurons from degenerative processes through mechanisms like antioxidant defenses, anti-inflammatory pathways, and the stabilization of cellular organelles, promising avenues for therapeutic advances. (38) The study of proteinopathies in Alzheimer's highlights how protein misfolding and aggregation into oligomers and fibrils interfere with cellular functions, leading to a toxic environment contributing to synaptic dysfunction and neurodegeneration. (39) A novel dimension in Alzheimer's research is exploring the role of circadian rhythm disruptions, where abnormalities in sleep-wake cycles may exacerbate amyloid pathology, suggesting that circadian regulation could be a therapeutic target to retard disease progression. (40) Therapeutic strategies in Alzheimer's are being designed to enhance autophagy and lysosomal degradation, promoting the clearance of misfolded proteins in damaged organelles, thus improving cellular homeostasis and attenuating neurodegenerative processes. (41) The psychosocial aspects of Alzheimer's disease emphasize the need for comprehensive care strategies encompassing cognitive behavioral therapy, socialization activities, and caregiver support to address the complex emotional, behavioral, and cognitive challenges faced by patients and families. (42) Innovative research in Alzheimer's involves the use of neuroimaging to study connectome reorganization, where aberrant neural network connectivity patterns can reflect disease state and progression, informing personalized therapeutic strategies and interventions. (43) Gender-specific differences in Alzheimer's disease progression and pathology are being studied to better understand hormonal influences, especially the protective role of estrogen in cognitive resilience, offering insights into tailored interventions for females. (44) Therapeutic vaccination approaches targeting amyloid beta or tau proteins aim to induce an adaptive immune response to facilitate the clearance of these pathological aggregates, presenting potential strategies to delay the onset and progression of Alzheimer's disease. The concept of neuroprotection in Alzheimer's disease involves using agents that prevent neuronal cell death by targeting oxidative stress, excitotoxicity, and neuroinflammation, highlighting the importance of early intervention to preserve cognitive functioning. In Alzheimer's disease, the impaired lymphatic clearance system, responsible for waste removal in the brain, contributes to the accumulation of toxic proteins, with current research exploring methods to enhance this system as a therapeutic approach. The study of functional genomics in Alzheimer's disease provides insights into gene activity and expression changes in different brain regions, offering critical data for understanding disease mechanisms and identifying novel therapeutic targets. Alzheimer's disease research is exploring the impact of early life exposures and experiences on cognitive aging, where education level, social engagement, and environmental factors may influence susceptibility, resilience, and age of onset of pathology. The involvement of metal-ion homeostasis in Alzheimer's is gaining attention, with copper, zinc, and iron transport abnormalities being linked to amyloid aggregation and oxidative damage, suggesting metal-based therapeutic targets to restore homeostasis. Various therapeutic approaches focusing on synaptic repair and regeneration are being explored in Alzheimer's, emphasizing restoring synaptic density and function through molecules enhancing synaptic proteins, potentially offering new hope in cognitive preservation and recovery. Colon cancer, also known as colorectal cancer, is characterized by malignant growths that arise in the lining of the large intestine, initiated by genetic mutations and environmental factors, progressing in a multi-step sequence from benign polyps to invasive cancer, and is heavily influenced by lifestyle factors such as diet and physical activity. The clinical presentation of colon cancer commonly includes symptoms like rectal bleeding, changes in bowel habits such as diarrhea or constipation, unintended weight loss, and persistent abdominal discomfort, though early-stage colon cancer is often asymptomatic, highlighting the importance of regular screening for early detection. One vital innovation in colon cancer screening is the fecal immunochemical test, FIT, a non-invasive test that detects hidden blood in stool using antibodies specific to human hemoglobin, offering a highly sensitive option for annual screening that enhances early detection and reduces mortality significantly. The pathophysiology of colon cancer is deeply rooted in the adenoma-carcinoma sequence, where benign adenomatous polyps undergo genetic alterations, such as APC, KRAS, and P53 mutations, leading to dysplastic changes and progression to carcinoma, underscoring the importance of polypectomy in interrupting this sequence. Surgical resection remains the cornerstone of curative treatment for localized colon cancer, with the extent of surgery tailored to the cancer's location and stage. Minimally invasive techniques like laparoscopic or robotic surgery are increasingly used for their benefits in reducing postoperative recovery time and complications. Adjuvant chemotherapy, particularly with fluoropyrimidines such as 5-fluorouracil in combination with oxaliplatin, is indicated for stage 3 colon cancer following surgery to eliminate microscopic remnants of cancer cells, decreasing recurrence risk and improving survival outcomes, although it is generally not recommended in stage 1 cases. 7. Recent breakthroughs in genetic testing have unveiled the role of mismatch repair, MMR, gene mutations and microsatellite instability, MSI, in colon cancer, leading to the implementation of universal MSI testing in patients with newly diagnosed colon cancer to guide immunotherapy decisions. Eight. Targeted therapies have revolutionized the management of metastatic colon cancer, particularly monoclonal antibodies like bevacizumab, which inhibits vascular endothelial growth factor, VEGF, and thus tumor angiogenesis, and cetuximab, which targets the epidermal growth factor receptor, EGFR, depending on the tumor's ROS mutation status. 9. Immunotherapy has emerged as a pivotal treatment strategy for mismatch repair deficient colon cancer, particularly using immune checkpoint inhibitors such as pembrolizumab, which enhance the host immune response against tumor cells and are primarily useful in patients with metastatic and unresectable disease. Colonoscopy is the gold standard in colon cancer screening, allowing for direct visualization and removal of precancerous polyps, and while sedation is typically employed to enhance patient comfort, advances such as virtual colonoscopy using CT imaging are being explored for those who cannot undergo conventional techniques. 11. A groundbreaking approach in the prevention of colon cancer involves the use of aspirin, which has been shown through studies such as the CAP, Colorectal Adenoma Carcinoma Prevention Program, trials, to reduce adenoma formation and consequently, cancer incidence in individuals with hereditary cancer syndromes. Surveillance colonoscopy protocols post-polypectomy or cancer resection are critical and are tailored based on the initial findings, such as polyp number, size, and histological characteristics, to monitor for new polyp formation or recurrence of cancer, showing the dynamic nature of the surveillance landscape. 13. A lesser-known presentation of colon cancer is the occurrence of paraneoplastic syndromes, where the cancer produces substances leading to remote effects such as Trousseau's syndrome, characterized by unexplained venous thrombosis, emphasizing the need to consider malignancy in atypical clinical presentations. Genetic syndromes such as Lynch syndrome, hereditary non-polyposis colorectal cancer, characterized by germline mutations in MMR genes, predispose individuals to early-onset colon cancer, stressing the importance of genetic counseling and testing for at-risk families to implement appropriate surveillance strategies. Emerging data suggests the pivotal role of the gut microbiome in colon cancer development, where dysbiosis and the presence of certain bacterial species such as Fusobacterium nucleatum can enhance tumorigenesis by creating a pro-inflammatory environment, offering potential new avenues for prevention and treatment. A unique manifestation of advanced colon cancer is the formation of malignant bowel obstruction, where the tumor obstructs intestinal flow, requiring urgent intervention that may involve surgical resection, endoscopic stenting, or decompression via nasogastric tubes to alleviate symptoms and improve patient quality of life. Tumor markers such as carcinoembryonic antigen, C, play a critical role in monitoring colon cancer treatment response and recurrence, especially in metastatic cases, although their nonspecific nature makes them less valuable for initial diagnosis, highlighting the nuance in biomarker utilization. A significant innovation in personalized medicine for colon cancer involves the use of circulating tumor DNA, ctDNA, as a non-invasive biomarker that has shown promise in identifying minimal residual disease, guiding adjuvant therapy decisions, and providing real-time insights into tumor dynamics and resistance mechanisms. 19. Occupational risk factors for colon cancer, such as sedentary work environments and prolonged sitting, have been identified as contributing to increased risk, emphasizing the need for public health interventions that encourage regular physical activity as a preventive measure alongside dietary modifications. In a novel approach to colon cancer treatment, radiofrequency ablation and cryoablation are being used selectively to target and destroy hepatic metastasis, demonstrating the expansion of local ablative technologies in providing additional options for patients with limited metastatic disease. Advances in imaging, such as diffusion-weighted MRI, have improved the preoperative assessment of colon cancer by offering superior soft tissue contrast, enabling more accurate staging and involvement of surrounding structures, which directly influences surgical planning and prognostication. Recognizing the impact of diet and nutrition on colon cancer, studies indicate that high fiber intake, along with diets rich in fruits, vegetables, and whole grains, contributes to a lower risk of cancer development through mechanisms involving fecal bulk increase and reduction of intestinal transit time. Quality of life assessments are integral to the management of colon cancer, where tools like the EORTC-QLQC30 questionnaire are employed to evaluate the patient's well-being and functional status, ensuring holistic care that extends beyond mere survival to encompass physical, emotional, and social health. Colon cancer incidence has demonstrated a concerning rise in younger adults, under the age of 50, attributed to a combination of lifestyle factors and genetic predispositions, prompting a re-evaluation of screening guidelines to potentially lower the age at which screening initiates for average-risk individuals. The role of inflammation in colon cancer is highlighted by conditions such as ulcerative colitis and Crohn's disease, where chronic inflammation induces dysplastic changes, necessitating a rigorous surveillance program and prophylactic colectomy considerations to mitigate cancer risk in these high-risk populations. Epigenetic alterations, such as DNA methylation and histone modification, contribute significantly to colon cancer pathogenesis by silencing tumor suppressor genes, representing potential targets for novel therapeutic interventions aimed at reversing these changes to restore normal cellular function. Herbal medicines and dietary supplements are being explored for their potential chemopreventive properties in colon cancer, with compounds like curcumin and resveratrol showing promising results in preclinical models, although clinical validation is required to confirm their efficacy and safety. Disparities in colon cancer outcomes have been observed among different racial and socioeconomic groups, likely due to variations in access to healthcare, screening, and treatment options, highlighting the urgent need for equitable health policies and targeted interventions to bridge these gaps. Integrated care models involving multidisciplinary teams have become a cornerstone in colon cancer treatment, ensuring that patients receive coordinated and comprehensive care that spans surgical, medical, and supportive services, optimizing treatment outcomes and patient satisfaction. The ability of colon cancer to metastasize to distant organs such as the liver and lungs chiefly stems from its adaptation to evade immune surveillance and spread through the lymphatic and vascular systems, presenting a major challenge that necessitates systemic therapy alongside local control measures. Increasing evidence suggests that vitamin D, owing to its role in cell growth regulation and immune function, may play a protective role in preventing colon cancer, with ongoing research assessing its supplementation as a potential intervention to reduce cancer risk in deficiency states. Patients with colon cancer have shown improved prognostic outcomes with regular follow-up and implementation of survivorship care plans, which include adherence to surveillance protocols, healthy lifestyle adoption, and management of long-term treatment effects, according to guidelines from oncology societies. Advanced genomic profiling techniques, such as next-generation sequencing, have unveiled the complex mutational landscape of colon cancer, identifying actionable mutations and resistance mechanisms, paving the way for precision oncology strategies tailored to each patient's unique tumor profile. The implementation of enhanced recovery after surgery, ERAS, protocols in colon cancer surgery has been instrumental in reducing hospital stay lengths and postoperative complications by emphasizing early mobilization, optimal nutrition, and multimodal analgesia, reflecting a shift towards patient-centered surgical pathways. Lynch syndrome-associated colon cancers typically manifest a distinct pathological phenotype, characterized by poor differentiation, lymphocytic infiltration, and mucin production, contributing to differential prognosis and therapy response compared to sporadic colon cancers, underscoring the importance of molecular classification. Circulating microRNAs, small non-coding RNA molecules, are emerging as promising biomarkers for early detection, prognosis, and monitoring therapeutic response in colon cancer, with their stability in bodily fluids enabling non-invasive testing advancements that could significantly transform current diagnostic practices. An intriguing area of research is the role of ferroptosis, a type of programmed cell death characterized by iron-dependent lipid peroxidation, in colon cancer, offering a potential target for novel treatments aimed at inducing cancer cell death through this unique pathway. The risk of metachronous colon cancer necessitates vigilant surveillance in patients with a history of colon cancer resection, as the development of new primary cancers in the remaining intestine remains a possibility, and adherence to tailored follow-up schedules is essential for early detection and intervention. Nutrigenomics, the study of gene-diet interactions, is gaining traction in colon cancer research, where genetic variants may affect individual responses to dietary components, potentially informing personalized dietary recommendations that could mitigate cancer risk or progression. Radiotherapy, although not a primary treatment for colon cancer due to the radiosensitivity of surrounding tissues, can be utilized in specific scenarios such as in cases of local recurrence or for palliation of symptoms, particularly when surgery and chemotherapy are not feasible options. Bowel function and quality of life after colon cancer surgery are significant concerns, with some patients experiencing altered bowel habits and fecal incontinence, necessitating preoperative counseling, pelvic floor rehabilitation, and dietary interventions to address these complications effectively. The discovery of cell-free DNA, released from apoptotic or necrotic tumor cells into the bloodstream, has garnered attention as an invaluable tool for non-invasive surveillance and early detection of recurrence in colon cancer patients undergoing surveillance post-treatment. Advances in three-dimensional, 3D, printing technologies have found applications in colon cancer surgical planning, allowing for the creation of patient-specific anatomical models that aid in complex resection strategies, enhancing preoperative assessment and intraoperative guidance. A novel therapeutic avenue being investigated involves monoclonal antibodies targeting claudins, a family of proteins overexpressed in colon cancer that contribute to tumor invasiveness and heterogeneity, showing potential in preclinical studies for slowing disease progression and enhancing standard treatment. Colon cancer prevention initiatives have increasingly targeted modifiable risk factors such as obesity, which is associated with chronic inflammation and insulin resistance, with interventions promoting healthy weight management showing promise in reducing incidence rates and improving overall population health outcomes. '46. Emotional and psychological support for colon cancer patients, often overshadowed by the focus on physical treatment, plays a vital role in comprehensive care, as demonstrated in studies highlighting improved treatment adherence and quality of life when mental health resources are integrated into oncology care pathways. '47. Explorations into the role of long non-coding RNAs, LNCRNAs, in colon cancer have revealed their influence on gene expression regulation and tumor progression, offering a rich target landscape for potential therapeutic interventions aimed at modulating these non-coding regions to impede cancer development. '48. Prehabilitation programs, focused on optimizing physical and nutritional status before colon cancer surgery, have emerged as an innovative approach to improve postoperative outcomes, reducing complications, and enhancing recovery times, in line with trends towards enhancing patient resilience. '49. Colon cancer's survival outcomes have been positively impacted by the adoption of sentinel lymph node mapping, a surgical technique initially used in other malignancies, which aids in precise staging and the determination of lymph node involvement, aiding in treatment decision-making and prognostication. '50. Recent advances in organoid technology, allowing cultivation of patient-derived tumor cells in 3D cultures, have provided a powerful platform for personalized medicine in colon cancer, enabling drug testing, genetic studies, and understanding resistance mechanisms on patient-specific tumor models. '1. Gastric ulcers, a common form of peptic ulcers, occur when the protective mucosal lining of the stomach is damaged, most often due to Helicobacter pylori infection or chronic use of nonsteroidal anti-inflammatory drugs, NSAIDs, resulting in symptoms like burning stomach pain, bloating, and nausea, and are diagnosed through endoscopy and treated with proton pump inhibitors, antibiotics, and lifestyle modifications to reduce stress and dietary irritants. '2. Inflammatory bowel disease, IBD, encompassing Crohn's disease and ulcerative colitis, is characterized by chronic inflammation of the gastrointestinal tract, with Crohn's affecting any part from mouth to anus and ulcerative colitis limited to the colon and rectum, presenting with symptoms such as abdominal pain, diarrhea, weight loss, and fatigue, and requiring a combination of diagnostic imaging, endoscopic evaluation, and serological markers for diagnosis and management with anti-inflammatory drugs, immunosuppressants, and occasionally surgery. '3. Irritable bowel syndrome, IBS, a functional gastrointestinal disorder, manifests with symptoms of abdominal pain, bloating, diarrhea, and constipation, often triggered by stress, hormonal changes, or certain foods, but lacks structural abnormalities, making diagnosis reliant on exclusion of other conditions and Rome-IV criteria, with treatment focused on dietary modifications, stress management, and pharmacological agents such as fiber supplements, antispasmodics, and laxatives to alleviate symptoms and improve patient quality of life. '4. Celiac disease is an autoimmune disorder triggered by ingestion of gluten, a protein found in wheat, barley, and rye, leading to small intestinal villus atrophy and malabsorption, manifesting with symptoms like diarrhea, bloating, weight loss, and fatigue, and diagnosed through serologic testing for antibodies such as tissue transglutaminase IgA, with confirmation via duodenal biopsy. Strict lifelong adherence to a gluten-free diet is the cornerstone of treatment to alleviate symptoms and prevent complications such as osteoporosis and malignancy. '5. Gastroesophageal reflux disease, GERD, occurs when stomach acid frequently flows back into the esophagus, irritating its lining and leading to symptoms such as heartburn, regurgitation, and difficulty swallowing, often due to lower esophageal sphincter relaxation or hiatal hernia, and can cause complications like esophagitis or Barrett's esophagus if untreated. Diagnosis is based on clinical presentation, pH monitoring, and endoscopy, with lifestyle modifications, antacids, and proton pump inhibitors forming the backbone of treatment. 6. Acute pancreatitis, an inflammatory condition of the pancreas, is commonly caused by gallstones or alcohol intake, presenting with sudden onset severe epigastric pain radiating to the back, nausea, vomiting, and elevated serum amylase and lipase levels. It is diagnosed through clinical evaluation and imaging studies such as CT scan, and management involves supportive care with fluid resuscitation, pain control, and avoidance of oral intake to rest the pancreas, while addressing the underlying etiology to prevent future attacks. 7. Barrett's esophagus is a condition in which the normal squamous epithelium of the distal esophagus is replaced by columnar-lined epithelium due to chronic gastroesophageal reflux disease, GERD, increasing the risk for esophageal adenocarcinoma, and is often asymptomatic, diagnosed through endoscopic biopsy revealing intestinal metaplasia. Surveillance with periodic endoscopy and management of reflux through lifestyle modification and proton pump inhibitors are critical for reducing carcinoma risk. 8. Diverticulitis occurs when small bulging pouches, or diverticula, in the digestive tract lining become inflamed or infected, typically presenting with abdominal pain, fever, and altered bowel habits, often in the lower left quadrant, and a diet low in fiber and high in refined foods is a major risk factor. It is diagnosed with imaging such as CT scan, and treatment involves bowel rest, antibiotics, and dietary adjustments, with surgery reserved for recurrent or complicated cases. 9. Hepatitis, an inflammation of the liver, can be caused by viral infections, notably hepatitis A, B, C, D, and E, alcohol, drugs, or autoimmune disease, presenting with symptoms such as jaundice, abdominal pain, fatigue, and elevated liver enzymes, and diagnosis involves serological testing and liver function tests, with treatment tailored to the etiology, such as antiviral drugs for chronic viral hepatitis, abstinence from alcohol, immunosuppressants for autoimmune hepatitis, and lifestyle modifications to preserve liver function. 10. Gallstones, or cholelithiasis, are solid particles that form in the gallbladder from bile components, often due to supersaturation of cholesterol, biliary stasis, or increased bilirubin, and are largely asymptomatic but can cause biliary colic, cholecystitis, pancreatitis, or cholangitis if obstructive. Diagnosis is confirmed by ultrasound, and management ranges from observation to laparoscopic cholecystectomy, especially in symptomatic cases or complications. 11. Ulcerative colitis is a form of inflammatory bowel disease that specifically affects the colon and rectum, causing continuous colonic mucosal inflammation beginning in the rectum and extending proximally, with symptoms including bloody diarrhea, abdominal cramping, and urgency, diagnosed through colonoscopy and histopathological examination, and treated with aminosalicylates, corticosteroids, immunomodulators, and biologic agents to induce and maintain remission, with colectomy as a surgical option for refractory or complicated disease. 12. Crohn's disease is an inflammatory bowel disease that can affect any part of the gastrointestinal tract from mouth to anus, characterized by transmural inflammation, skip lesions, and complications such as strictures, fistulas, and abscesses, presenting with abdominal pain, diarrhea, weight loss, and nutritional deficiencies. Diagnosis is made through endoscopic evaluation, imaging, and biopsy, and management involves anti-inflammatory medications, biologics, nutritional support, and, when necessary, surgical intervention to manage complications or treatment resistance. 13. Hepatic encephalopathy is a complex neuropsychiatric syndrome resulting from liver dysfunction, often triggered by acute or chronic liver disease, marked by confusion, altered level of consciousness, and asterixis, due to buildup of neurotoxic substances like ammonia, and diagnosed clinically and supported by blood ammonia levels. Management focuses on reducing ammonia production and absorption with lactulose and antibiotics, addressing precipitating factors, and consideration of liver transplantation in severe or refractory cases. (14) Achalasia is a motility disorder of the esophagus characterized by failure of the lower esophageal sphincter to relax and absent or impaired peristalsis, leading to symptoms of progressive dysphagia for solids and liquids, regurgitation, and chest pain, with diagnostic confirmation via esophageal manometry, barium swallow, and endoscopy. Treatment options include pneumatic dilation, surgical myotomy, and pharmacologic therapies such as botulinum toxin injections to relieve obstruction and improve swallowing function. (15) Clostridioides difficile infection is a significant cause of antibiotic-associated diarrhea, resulting from disruption of normal colonic microbiota, typically due to broad-spectrum antibiotic use, leading to toxin-mediated colitis with symptoms of watery diarrhea, fever, and abdominal pain, confirmed by stool toxin assays or PCR. Management involves cessation of the offending antibiotic, initiation of oral vancomycin or fidaxomicin, and infection control measures, with fecal microbiota transplantation considered in recurrent cases. (16) Celiac disease requires lifelong adherence to a gluten-free diet to manage symptoms and prevent complications, as it is an autoimmune disorder where ingestion of gluten leads to small intestinal mucosal injury, malabsorption, and symptoms like diarrhea, anemia, and neurological issues, confirmed by serologic testing for specific antibodies and duodenal biopsy showing villus atrophy, with diligent dietary management necessary to improve patient outcomes and quality of life significantly. 17. Colorectal cancer screening, crucial for early detection and improved survival, involves methods such as fecal occult blood testing, fecal immunochemical tests, sigmoidoscopy, and colonoscopy beginning at age 45 to 50 for average-risk individuals, aiming to identify and remove precancerous polyps and detect cancer at an early, more treatable stage, with high-risk individuals requiring earlier and more frequent screening intervals based on personal or family history and genetic factors. 18. Wilson's disease is a rare genetic disorder characterized by excessive copper accumulation in the body due to defective hepatic copper transport, leading to hepatic, neurologic, and psychiatric manifestations, often with Kayser-Fleischer rings on examination, and diagnostic confirmation includes serum ceruloplasmin, 24-hour urinary copper excretion, liver biopsy, or genetic testing. It is managed with copper chelating agents such as D-penicillamine or trientine, and zinc therapy to prevent disease progression and maintain normal copper balance. (19) Portal hypertension, most commonly resulting from cirrhosis, is characterized by increased pressure in the portal venous system, leading to complications such as variceal bleeding, ascites, and hepatic encephalopathy, with diagnosis made by assessing clinical signs and using imaging modalities like Doppler ultrasound and hepatic venous pressure gradient measurement, while treatment aims at lowering portal pressure through beta blockers, endoscopic variceal ligation, TIPS, transjugular intrahepatic portosystemic shunt, and managing underlying liver disease. (20) Lactose intolerance is the inability to digest lactose, a sugar found in milk and dairy products, due to deficient levels of the enzyme lactase produced by the small intestine, resulting in symptoms like bloating, diarrhea, and abdominal pain after consuming lactose-containing foods, diagnosed by hydrogen breath test, lactose tolerance test, or lactase gene testing, and managed through dietary modifications, lactose-free products, and lactase enzyme supplements to improve symptoms and dietary tolerance. 21. Gastrointestinal bleeding can present as hematemesis, melena, or hemodichezia, with upper GI bleeding most commonly caused by peptic ulcers, esophageal varices, and Mallory-Weiss tears, while lower GI bleeding often results from diverticulosis, colorectal cancer, or hemorrhoids. Diagnosis involves endoscopic evaluation, imaging, and laboratory tests assessing hematologic and coagulation status, while management depends on stabilization with intravenous fluids and blood products, endoscopic hemostatic procedures, and treating the underlying cause. 22. Dumping syndrome, often seen post-gastric surgery, occurs when ingested food moves too quickly from the stomach into the small intestine, causing early and late postprandial symptoms such as nausea, bloating, abdominal cramps, diarrhea, dizziness, and tachycardia, and is mitigated by dietary changes focusing on smaller, more frequent meals with reduced simple carbohydrates, along with medications to retard gastric emptying or surgery in refractory cases to restore normal gastric physiology. 23. Zollinger-Ellison syndrome is a rare condition characterized by gastrin-secreting tumors, gastrinomas, situated primarily in the pancreas or duodenum, leading to hypersecretion of gastric acid, peptic ulcer disease, and diarrhea, with diagnosis supported by elevated fasting gastrin levels, stomach pH measurement, and imaging studies to locate gastrinomas. Treatment includes high-dose proton pump inhibitors to control acid secretion and surgical resection or somatostatin analogs for tumor management. 24. Giardiasis is a common protozoal infection of the small intestine caused by Giardia lamblia, transmitted by contaminated water or food, leading to symptoms such as diarrhea, flatulence, stomach cramps, and weight loss. Diagnosis is confirmed by stool examination for cysts or trophozoites, antigen detection, or PCR testing, and it is treated effectively with antiparasitic agents like metronidazole or tinidazole, emphasizing the importance of safe drinking water and hygienic practices to prevent transmission. 25. Hepatocellular carcinoma, the most common primary liver cancer, often arises in the background of chronic liver disease and cirrhosis secondary to hepatitis B or C infection, alcohol abuse, or non-alcoholic fatty liver disease, presenting insidiously with weight loss, jaundice, and abdominal mass. Diagnosis is achieved through a combination of imaging modalities like ultrasound or MRI and serum alpha-fetoprotein measurement, with treatment options ranging from surgical resection, transarterial chemoembolization, local ablative therapies, to systemic treatments including kinase inhibitors and immunotherapy. 26. Constipation, a common digestive complaint, is characterized by infrequent bowel movements or difficulty evacuating stools, often due to inadequate dietary fiber, fluid intake, physical inactivity, or medications, and can be functional or secondary to underlying disorders like irritable bowel syndrome or neurological conditions. Management includes dietary modifications to increase fiber and water, behavioral interventions to establish regular bowel habits, and pharmacological treatments such as laxatives, stool softeners, or prokinetic agents to relieve symptoms and ensure regular bowel activity. 27. Non-alcoholic fatty liver disease, NAFLD, is the hepatic manifestation of metabolic syndrome, characterized by fat accumulation in the liver, which can progress to non-alcoholic steatohepatitis, NASH, fibrosis, and cirrhosis, associated with obesity, diabetes, dyslipidemia, and hypertension. Diagnosis involves imaging studies like ultrasound or MRI, and serological testing to exclude other liver diseases, while management focuses on lifestyle modifications, including dietary changes, physical activity, weight loss, and pharmacologic interventions targeting insulin resistance and hepatic inflammation. 28. Gastric cancer, often adenocarcinoma, is a malignancy arising from the stomach lining, associated with risk factors such as Helicobacter pylori infection, smoking, dietary factors, and certain genetic syndromes, presenting with vague symptoms like abdominal pain, weight loss, nausea, and early satiety, typically diagnosed through endoscopy with biopsy and staging through CT or PET scans. Management depends on the stage and may involve surgical resection, chemotherapy, radiation, and targeted therapies, with a focus on early detection and intervention to improve prognosis. 29. Bile acid malabsorption can lead to chronic diarrhea and stearia due to excessive bile acids reaching the colon after conditions such as ileal resection, Crohn's disease, or idiopathic causes. Diagnosis is often clinical, supported by a CAT scan or response to bile acid sequestrants, and management involves dietary modifications alongside medications like cholestyramine or colesevelam to bind unabsorbed bile acids in the gastrointestinal tract and reduce diarrhea. 30. Appendicitis is the inflammation of the vermiform appendix, often due to obstruction by fecaliths or lymphoid hyperplasia, presenting acutely with periumbilical pain that localizes to the right lower quadrant, accompanied by nausea, vomiting, and fever, with diagnosis supported by clinical examination, laboratory tests, and imaging like ultrasound or CT scan. Surgical removal via appendectomy, typically performed laparoscopically, is the definitive treatment to prevent complications such as perforation and peritonitis. 31. Primary sclerosing cholangitis, PSC, is a chronic liver disease characterized by progressive inflammation and fibrosis of the bile ducts, leading to strictures, cholestasis, and eventual cirrhosis, often associated with inflammatory bowel disease, particularly ulcerative colitis. Diagnosis is confirmed using cholangiography revealing a beaded appearance of biliary ducts, and management focuses on symptom relief, monitoring for complications, and liver transplantation in advanced cases, as no specific curative medical therapy exists. 32. Hemochromatosis is an iron overload disorder, predominantly genetic, characterized by excessive intestinal iron absorption and deposition in various organs, leading to symptoms including fatigue, arthralgia, diabetes, and skin hyperpigmentation, with diagnosis confirmed by elevated serum ferritin, transferrin saturation, and genetic testing for HFE mutations, while management involves regular phlebotomy to normalize iron levels and prevent organ damage, with liver biopsy used to assess the extent of hepatic fibrosis or cirrhosis. 3.3. Intussusception is a condition where a segment of the bowel telescopes into an adjacent segment, commonly seen in infants, resulting in symptoms such as sudden abdominal pain, vomiting, and current jelly stools, with diagnosis often confirmed by ultrasound showing the characteristic target sign. Treatment may involve air or contrast enema reduction, which is both diagnostic and therapeutic, with surgical intervention necessary in cases of failed non-operative reduction or signs of bowel necrosis or perforation. 34. Esophageal cancer, most commonly squamous cell carcinoma or adenocarcinoma, presents with progressive dysphagia, weight loss, odynophagia, and hoarseness, primarily affecting men over women, and associated with risk factors like tobacco use, alcohol consumption, Barrett's esophagus, and achalasia. Diagnosis requires endoscopy with biopsy and imaging for staging, while treatment varies by stage, including surgical resection, chemoradiotherapy, and palliative care to manage symptoms and improve quality of life. 35. Gastric polyps are growths found on the stomach lining, often discovered incidentally during endoscopy, and can be non-neoplastic, such as hyperplastic polyps, or neoplastic, like adenoma, with potential to progress to cancer. Management involves histological assessment via biopsy, with surveillance and removal of neoplastic polyps, especially those with high-grade dysplasia, to prevent malignant transformation, alongside evaluation for underlying conditions such as chronic gastritis or atrophic gastritis. 36. Steatohepatitis, characterized by liver inflammation and damage due to lipid accumulation, is an intermediate stage between simple fatty liver and cirrhosis, commonly seen in alcohol abuse, alcoholic steatohepatitis, or as part of non-alcoholic fatty liver disease, NAFLD, diagnosed through liver function tests and imaging showing fat infiltration, possibly confirmed with biopsy. Management focuses on lifestyle adjustments like weight reduction and abstinence from alcohol or steatosis-inducing agents to halt progression and prevent cirrhosis. 37. Intestinal obstruction can be caused by mechanical factors such as adhesions, hernias, or neoplasms, or functional issues like ileus, resulting in symptoms of abdominal pain, vomiting, distension, and constipation. Diagnosis is based on clinical examination and imaging, particularly abdominal X-ray or CT scan showing dilated bowel loops, air fluid levels, and potential transition points, while management often requires hospitalization for fluid and electrolyte replacement, bowel rest, and surgery when indicated, particularly in complete or strangulated obstructions. 38. Dyspepsia, often known as indigestion, encompasses chronic or recurrent upper abdominal discomfort or pain, typically related to eating, and may be functional, peptic ulcer related, or indicative of underlying biliary or pancreatic disorders. Diagnosis involves clinical evaluation, exclusion of alarm features, and possible endoscopy, with treatment consisting of lifestyle adjustments, dietary changes, and pharmacologic agents such as acid suppressants or prokinetics, tailored to patient response and underlying etiology. (39) Eosinophilic esophagitis is a chronic immune-mediated disease characterized by eosinophil infiltration in the esophagus, leading to symptoms like dysphagia and food impaction, triggered by food allergens or environmental factors. Diagnosis is confirmed by endoscopic findings of rings or furrows and a high eosinophil count in esophageal biopsies, with management involving dietary elimination, proton pump inhibitors, and topical corticosteroids to reduce inflammation and prevent structural changes in the esophagus. 40. Gastric emptying disorders, such as gastroparesis, involve delayed gastric emptying without an obstructive cause, leading to symptoms of nausea, vomiting, early satiety, and bloating, often associated with diabetes mellitus, post-surgical conditions, or idiopathic origins. Diagnosis requires gastric emptying scintigraphy to measure retention, and treatment focuses on dietary modifications, glycemic control in diabetic patients, and medications like prokinetics or antiemetics to manage symptoms effectively and enhance gastric motility. 41. Peritonitis, an inflammation of the peritoneum, usually due to bacterial infection from gastrointestinal perforation, rupture of an abdominal organ, or dialysis complications, presents with severe abdominal pain, tenderness, rigidity, and systemic symptoms like fever or shock, diagnosed by clinical examination and supported by laboratory tests and imaging. Prompt treatment involves broad-spectrum antibiotics and often surgical intervention to address the underlying cause and drain infectious material or perform necessary repairs. 42. Hepatorenal syndrome is a functional kidney failure complication associated with severe liver disease like cirrhosis, characterized by intense renal vasoconstriction and reduced renal perfusion, with criteria for diagnosis including cirrhosis with ascites and exclusion of other causes of renal dysfunction. Management includes addressing precipitating factors, using vasoconstrictors to improve renal function, and considering liver transplantation when feasible to provide long-term resolution through improved liver function. 43. Short bowel syndrome results from extensive surgical resection of the small intestine, causing malabsorption, diarrhea, and malnutrition due to insufficient intestinal absorptive surface, necessitating a multidisciplinary approach involving dietary adjustments, vitamin and mineral supplementation, and medications such as antidiarrheals or proton pump inhibitors. In severe cases, patients may require parenteral nutrition or surgical interventions like bowel lengthening procedures to improve nutritional status and quality of life. 44. Hemorrhoids are swollen vascular structures in the anal canal, often associated with increased intra-abdominal pressure from straining during defecation or prolonged sitting, manifesting as rectal bleeding, pain, pruritus, and palpable masses, classified into internal or external hemorrhoids based on location. Management includes dietary modifications to increase fiber intake, topical treatments, sclerotherapy, rubber band ligation, and surgical hemorrhoidectomy for persistent or complicated cases requiring resolution. 45. Mesenteric ischemia, involving reduced blood flow to the intestines, can be acute due to arterial embolism, thrombosis, or chronic from atherosclerotic disease. It presents with severe abdominal pain, particularly postprandial in chronic cases, often coupled with fear of eating leading to significant weight loss. Diagnosis relies on a combination of clinical suspicion, laboratory tests, and imaging modalities such as CT angiography, while management involves prompt revascularization, anticoagulation, and surgical intervention tailored to the underlying cause and clinical stability of the patient. 46. Diverticulosis refers to the presence of diverticula in the colon, often asymptomatic but identified incidentally during imaging or colonoscopy, related to increased intraluminal pressure and chronic low-fiber diet. While benign, they can lead to complications such as diverticulitis or bleeding, with management emphasizing dietary fiber intake to prevent progression and regular monitoring for symptoms indicating complications, which may need further medical or surgical intervention. 47. Autoimmune hepatitis is a chronic inflammatory liver disease characterized by immune-mediated hepatocytic injury, with diagnostic features including elevated liver enzymes, positive serology for autoimmune antibodies, such as ANA, SMA, or LKM1, and liver biopsy showing interface hepatitis with lymphoplasmacytic infiltrate. Treatment requires immunosuppression, typically starting with corticosteroids like prednisone, often in combination with azathioprine, to induce and maintain remission and prevent disease progression to cirrhosis or liver failure. 48. Gastroparesis, often idiopathic or associated with underlying conditions like diabetes mellitus, involves delayed gastric emptying leading to symptoms such as nausea, vomiting, early satiety, and bloating without mechanical obstruction. Diagnosis is confirmed by gastric emptying scintigraphy and exclusion of structural causes, with management focused on dietary modifications, glycemic control, prokinetic medications like metoclopramide, and symptomatic relief through antiemetics or gastric electrical stimulation in refractory cases. 49. SIBO, small intestinal bacterial overgrowth, is characterized by an increased number or alteration of bacteria in the small intestine, leading to symptoms like bloating, diarrhea, abdominal pain, and malabsorption. Diagnosis involves breath tests, such as lactulose or glucose, and treatment includes antibiotics such as rifaximin or metronidazole, probiotics, and addressing underlying anatomical or motility disorders to prevent recurrence and maintain a balanced gut microbiome. 50. Pyloric stenosis, typically seen in infants, involves hypertrophy of the pyloric muscle, causing gastric outlet obstruction with projectile vomiting, dehydration, and failure to thrive, diagnosed through ultrasound revealing elongation and thickening of the pylorus. Treatment is surgical, with pyloromyotomy to relieve obstruction and restore normal feeding and hydration status, emphasizing the importance of early recognition and intervention to prevent severe electrolyte imbalances and nutritional deficits. 1. Breast cancer is not a singular disease but rather a heterogeneous group with various subtypes such as luminal A, luminal B, HER2 positive, and triple negative, each exhibiting distinct molecular profiles and clinical behaviors, which necessitate personalized treatment strategies including targeted therapy, chemotherapy, radiation, or hormone therapy, thereby highlighting the importance of precision medicine in improving patient outcomes. 2. While most breast cancers originate in the lobules, starting as ductal carcinoma in situ, DCIS, the cancer can also arise from the connective tissue, leading to rarer forms like Phyllodes tumors, which require a surgical approach due to their tendency to recur locally despite being typically benign or borderline. 3. The triple-negative breast cancer subtype, characterized by the absence of estrogen receptor, progesterone receptor, PR, and HER2 amplification, remains one of the most aggressive forms, with limited targeted therapies, making ongoing research into immune checkpoint inhibitors and PARP inhibitors crucial to expanding therapeutic options for improving survival rates in affected women. 4. Novel imaging techniques such as contrast-enhanced mammography and automated breast ultrasound systems are increasingly used to improve sensitivity and specificity in detecting breast cancer, especially in women with dense breast tissue, potentially catching malignancies that could be missed using traditional mammography alone. 5. Dr. William Stewart Halsted pioneered the radical mastectomy in the late 19th century as a definitive treatment for breast cancer. However, advances in surgical techniques and a better understanding of tumor biology have shifted preference towards breast-conserving surgery and sentinel lymph node biopsy, significantly reducing surgical morbidity while maintaining oncologic efficacy. Six. The process of epithelial mesenchymal transition, EMT, plays a crucial role in the metastatic spread of breast cancer, as tumor cells lose their epithelial characteristics and gain mesenchymal traits, enhancing their mobility and invasiveness, which can lead to metastatic lesions in distant organs such as the bone, liver, lungs, and brain. 7. Oncotype DX and MammaPrint are two genomic assays that analyze the expression of multiple cancer-related genes in early-stage breast cancer, providing critical insights into recurrence risk and helping guide treatment decisions regarding the necessity of adjuvant chemotherapy, thus contributing to more personalized approaches for patient management. 8. Breast conservation therapy, BCT, which combines lumpectomy with radiation therapy, is as effective as mastectomy in early-stage breast cancer for survival outcomes and is associated with better cosmetic results and quality of life for many women, making it a preferred choice for eligible patients. 9. The risk of breast cancer increases with age, and around 80% of breast cancers occur in women over the age of 50, underscoring the importance of regular screening through mammography for early detection, as early-stage cancers are more amenable to treatment and have a higher likelihood of cure. 10. Inflammatory breast cancer is a rare but highly aggressive form of breast cancer characterized by skin changes resembling an infection, such as redness and warmth, and often presents without a distinct lump, requiring immediate treatment with chemotherapy followed by surgery and radiation to improve the historically poor prognosis associated with its rapid progression. 11. Breast cancer survivors face the long-term health challenges of treatment-induced side effects, including cardiotoxicity from anthracyclines and trastuzumab, lymphedema post-axillary surgery, and osteoporosis from aromatase inhibitors, necessitating a multidisciplinary follow-up to monitor and manage these chronic conditions to enhance survivors' quality of life. 12. Prophylactic mastectomy, the surgical removal of one or both breasts to reduce cancer risk, is considered in women with a high genetic predisposition to breast cancer, particularly those carrying BRCA1 or BRCA2 mutations, reducing the risk of developing breast cancer by about 90%, although the decision remains deeply personal and complex. 13. Neoadjuvant chemotherapy, administered before surgical intervention, is increasingly utilized in locally advanced breast cancer to shrink tumors, potentially allowing for less extensive surgery and providing early indication of how responsive the cancer is to the treatment regimen, which can inform further therapeutic strategy. 14. The role of the tumor microenvironment in breast cancer progression and treatment resistance is gaining attention, with the surrounding stromal cells, immune cells, and extracellular matrix components interacting dynamically with cancer cells, suggesting potential therapeutic targets that could prevent or alter metastatic spread. 15. Recent advances in biomarker discovery, such as the identification of circulating tumor cells, CTCs, and cell-free DNA, cfDNA, in the bloodstream, hold promise for creating less invasive diagnostic and prognostic tools for monitoring breast cancer progression and treatment response, providing real-time insights into disease dynamics. 16. Some breast cancer treatments target the angiogenesis process, crucial for tumor blood supply, with drugs like bevacizumab inhibiting the vascular endothelial growth factor, VEGF, though its use remains controversial due to varying responses and concerns about side effects outweighing survival benefits, prompting ongoing evaluations of optimal clinical settings for its application. 17. Male breast cancer, comprising about 1% of all breast cancer cases, often presents at a more advanced stage partly due to limited awareness and lack of routine screening, highlighting the need for increased recognition and tailored screening strategies that address the distinct risk factors and genetic predispositions unique to men. 18. Breast cancer incidence shows significant geographical variability worldwide, influenced by factors such as lifestyle, diet, reproductive history, and access to screening, enabling epidemiologists to construct risk prediction models that contribute to targeted prevention strategies within diverse populations. 19. Emerging breast cancer vaccine research aims to harness the immune system to recognize and target tumor-specific antigens, with experimental vaccines showing promise in eliciting immune responses in preclinical trials, potentially offering adjuvant tools for preventing recurrence in high-risk individuals and improving long-term survival. 20. Bisphosphonates and denosumab are agents used in breast cancer with bone metastasis to reduce skeletal-related events, such as pathologic fractures and spinal cord compression, by inhibiting cancer-induced bone resorption, thereby improving quality of life for patients with advanced stage disease. 21. Breast density, categorized through mammographic assessment, is a strong independent risk factor for breast cancer, with women having dense breast tissue at a higher risk due to the difficulty in detecting tumors and the increased probability of harboring aggressive features, sparking conversations on supplemental screening modalities like MRI and ultrasound. 22. Breast cancer metastasis to the brain occurs in approximately 10 to 15% of metastatic cases and is more common in patients with HER2-positive or triple-negative subtypes, necessitating systemic treatment with HER2-targeted therapies and the consideration of stereotactic radiosurgery or whole-brain radiotherapy to manage neurological symptoms and maintain life quality. 23. Breast cancer prognosis is evaluated using the TNM staging system, which considers the size and extent of the primary tumor, T, lymph node involvement, N, and metastatic spread, M, providing valuable information on the severity of the disease and guiding treatment decisions, with higher stages typically indicating more aggressive therapy is needed. 24. Hormone receptor-positive breast cancers, characterized by the expression of estrogen and/or progesterone receptors, often respond well to hormonal therapies such as tamoxifen or anastrozole, which block the oncogenic signaling pathways activated by these hormones, and are key components in both adjuvant and metastatic treatment settings. 25. The concept of oncogene addiction in breast cancer highlights how tumors may become reliant on particular genetic drivers, like the amplification of HER2, making targeted therapies addressing these vulnerabilities an effective strategy, as evidenced by the success of HER2 inhibitors like trastuzumab and pertuzumab in transforming the treatment landscape for these cancers. 26. The Gail model is a widely used tool for assessing breast cancer risk, employing a combination of factors such as age, family history, hormonal factors, and reproductive history to calculate an individual's risk of developing breast cancer, aiding in decision-making regarding preventive interventions like increased surveillance or chemoprevention. 27. The presence of tumor-infiltrating lymphocytes, TILs, in breast cancer, particularly in triple-negative and HER2-positive subtypes, is associated with better prognosis and response to chemotherapy, indicating that the host immune response plays a crucial role in modulating cancer progression and therapeutic outcomes. 28. The introduction of digital mammography has revolutionized breast cancer screening by offering superior image quality, better detection rates, and lower radiation doses compared to traditional film mammography, making it a cornerstone in the early detection of malignancies and contributing significantly to decreased mortality rates through early intervention. 29. Microenvironmental hypoxia, often present in rapidly growing breast tumors, is a critical factor that drives cancer cell adaptation and therapy resistance by activating hypoxia-inducible factors, HIFs, which promotes angiogenesis, metabolic reprogramming, and an aggressive phenotype, presenting opportunities for therapeutic intervention with HIF inhibitors. The American Joint Committee on Cancer, AJCC, introduced the 8th edition breast cancer staging system incorporating genomic panels and biomarkers like the 21-gene recurrence score, emphasizing the adoption of molecular data in refining prognostication and guiding the use of adjuvant systemic therapies more precisely. The risk of developing breast cancer is influenced by lifestyle factors, with increased alcohol consumption, obesity, and sedentary behaviors contributing to higher risks, encouraging interventions focused on lifestyle modifications, such as diet, exercise, and reducing alcohol intake, to potentially lower the incidence of breast cancer in the general population. Sentinel lymph node biopsy has become the standard practice for axillary staging in early breast cancer, significantly reducing the morbidity of axillary lymph node dissection by targeting the first draining nodes, allowing you to determine if cancer cells have spread without the need for extensive node removal in the absence of metastatic disease. Breast cancer during pregnancy presents unique challenges, as diagnostic and treatment options must be carefully balanced to protect fetal health while ensuring effective cancer management, with strategies often involving modified chemotherapy regimens compatible with pregnancy and coordinated multidisciplinary care to guide optimal outcomes. The role of the BRCA1 and BRCA2 genes in breast cancer risk extends beyond simple genetic predisposition. These genes are crucial components of the homologous recombination DNA repair pathway, and their mutation results in genomic instability, making cells more susceptible to malignant transformation but also creating opportunities for treatment with PARP inhibitors. Triple-negative breast cancer, TNBC, is being explored for novel therapeutic targets like the androgen receptor, AR, and other non-estrogen receptor pathways, as some TNBCs may express AR, offering potential for anti-androgen therapies to complement existing treatment paradigms and enhance outcomes in this challenging breast cancer subtype. Breast cancer patients may exhibit cancer-related cognitive impairment, often referred to as chemo brain, which includes symptoms such as memory lapses, difficulty concentrating, and mental fog, likely resulting from chemotherapy agents, stress, and inflammatory cytokines, warranting support strategies and cognitive rehabilitation to improve daily functioning. HER2 amplification in breast cancer, traditionally considered as an adverse prognostic indicator, has evolved as a therapeutic target with the development of monoclonal antibodies like trastuzumab, which specifically targets the HER2 receptor, demonstrating improved survival rates and being paramount in the management of HER2-positive breast cancer. Recent studies suggest a possible link between night shift work and elevated breast cancer risk, potentially due to altered levels of melatonin, which is hypothesized to have cancer protective properties, emphasizing the need for additional research and interventions that could mitigate occupational risk factors in shift workers. The integration of artificial intelligence, AI, in breast cancer diagnostics is advancing, with AI algorithms being developed to enhance mammogram interpretations, identify patterns indicative of malignancies with high accuracy, and assist radiologists in reducing false positives and unnecessary biopsies, further streamlining the diagnostic process. 40. Breast cancer recurrence can occur years after initial treatment completion, often influenced by factors such as tumor biology, treatment adherence, and lifestyle, reinforcing the necessity for long-term follow-up and vigilance in survivorship care to detect and manage recurrences early, ensuring timely intervention and improved survival chances. 41. The phenomenon of liquid biopsy is emerging as a game-changer in breast cancer management. It entails the non-invasive collection of blood samples to detect circulating tumor cells or tumor-derived fragments, enabling real-time monitoring of tumor burden, treatment efficacy, and the detection of minimal residual disease, potentially guiding timely therapeutic adjustments. 42. Breast cancer care disparities exist across socioeconomic and racial lines, with access to screening programs, treatment availability, and quality of care often affecting outcomes, calling for public health initiatives to bridge these gaps, ensuring equitable access to preventive measures and treatments for all demographics. 43. While traditionally limited to invasive approaches, focal therapy for breast cancer, including techniques like cryoablation and high-intensity focused ultrasound, offers minimally invasive alternatives to surgical excision, potentially allowing for effective tumor control while preserving breast tissue integrity and patient quality of life. 44. Axillary locoregional recurrence is a concern after initial breast cancer surgery, with the risk factors including incomplete resection and aggressive histology, highlighting the need for careful surgical planning and the potential benefit of adjuvant radiation in cases with unfavorable pathological features to reduce recurrence likelihood. 45. Breast cancer molecular subtyping has transformed therapeutic approaches, as differences in genetic expression profiles guide treatment selection between hormone therapy, HER2 targeted agents, and chemotherapy, tailoring regimens to the unique biology of each case and maximizing treatment efficacy. 46. Phyllodes tumors, a rare form of breast tumors, exhibit a spectrum of behavior from benign to malignant, distinguished by the stromal overgrowth component, and are predominantly treated with wide local excision to ensure clear margins, as the risk of local recurrence is significant, often mandating vigilant follow-up. 47. Radiation therapy advancements, such as intensity-modulated radiation therapy, IMRT, allow for better targeting of breast tumors while sparing healthy tissue, reducing side effects, and improving cosmetic outcomes, representing a substantial progression in adjuvant breast cancer therapy for individuals undergoing conservative surgery. 48. Breast cancer prevention strategies go beyond lifestyle modifications and familial risk assessments. They also include chemoprevention with agents like tamoxifen and raloxifene in high-risk women, which have shown efficacy in reducing breast cancer incidence by modulating estrogen receptor pathways and acting as selective estrogen receptor modulators. 49. Breast cancer metastasis remains a major therapeutic challenge, as disseminated disease becomes less curable and focuses on prolonging survival and maintaining quality of life, highlighting the importance of understanding the molecular mechanisms driving metastasis and exploring targeted therapies to prevent or retard the spread of tumors. 50. The role of autophagy in breast cancer is a double-edged sword, where it can be both tumor suppressive by removing damaged organelles and protein aggregates, and tumor promotive by providing nutrients through cellular recycling during metabolic stress, making it a complex target for therapeutic manipulation in enhancing treatment outcomes. 1. Colon cancer, also known as colorectal cancer, is a form of malignancy that develops from the epithelial cells lining the colon or rectum. It often begins as benign polyps that can become cancerous over time, emphasizing the importance of early detection and intervention through routine screenings such as colonoscopies. 2. The pathophysiology of colon cancer typically involves a series of genetic mutations, including those in the APC, KRAS, and p53 genes, which disrupt normal cell growth and regulatory mechanisms, facilitating uncontrolled cell division and tumor formation. Three risk factors for colon cancer include age over 50, a family history of colorectal cancer, certain inherited syndromes such as Lynch syndrome, a diet high in red and processed meats, obesity, physical inactivity, and smoking, which collectively highlight the multifactorial nature of the disease. 4. Adenomatous polyps, especially those that are larger than 1 cm, possess a higher risk of malignancy due to their glandular origin, making regular monitoring crucial for individuals with these types of polyps to prevent progression to colon cancer. Five. Symptoms of colon cancer can vary but often include changes in bowel habits like diarrhea or constipation, stool consistency changes, rectal bleeding or blood in the stool, persistent abdominal discomfort, weakness or fatigue, and unexplained weight loss, necessitating medical evaluation for such presentations. 6. Diagnosis of colon cancer is typically confirmed through a combination of colonoscopy, which allows direct visualization and biopsy of suspicious lesions, and imaging techniques like CT scans or MRI to evaluate the extent of the disease and potential metastasis. 7. The staging of colon cancer, ranging from stage 1 to IV, is vital for treatment planning and is based on the extent of tumor invasion into the colon wall, involvement of regional lymph nodes, and the presence of distant metastasis, with more advanced stages requiring more aggressive treatment. 8. Surgical resection remains the primary treatment for localized colon cancer, aiming to completely remove the tumor and surrounding tissues. The surgical approach may include partial colectomy, segmental resection, or more extensive procedures depending on tumor location and stage. 9. Adjuvant chemotherapy, often involving drugs like 5-fluorouracil, leucovorin, and oxaliplatin, is commonly used post-surgery in cases of stage 3 and some stage 2 colon cancer to eradicate microscopic residual cancer cells and reduce recurrence risk. 10. Radiation therapy is not routinely used for colon cancer but is more commonly part of the treatment for rectal cancer, where it helps reduce the size of the tumor before surgery and improve local control, especially in higher stage disease. 11. Targeted therapies, such as bevacizumab, which inhibits angiogenesis, and cetuximab and panitumumab, which target the epidermal growth factor receptor, EGFR, have expanded treatment options for metastatic colon cancer and are commonly used alongside traditional chemotherapy regimens. 12. Immunotherapy, including drugs like pembrolizumab and nivolumab, has shown promise in the treatment of mismatch repair deficient or microsatellite instability high metastatic colon cancers, capitalizing on the concept of harnessing the body's immune system for tumor eradication. 13. The role of genetic testing in colon cancer, particularly looking for mutations such as those in the Lynch syndrome-associated mismatch repair genes, is crucial for identifying hereditary cancer syndromes and informing both treatment and screening strategies for patients and their families. 14. Regular colon cancer screening is recommended to begin at age 45 for average-risk individuals, using methods such as fecal occult blood tests, stool DNA testing, sigmoidoscopy, or colonoscopy, which are effective in reducing mortality by detecting precancerous polyps and early-stage cancers. 15. Lifestyle modifications, including a high-fiber diet rich in fruits, vegetables, and whole grains, regular physical activity, maintaining a healthy weight, and minimizing alcohol consumption and tobacco use, play a significant role in the prevention of colon cancer. 16. The recurrence of colon cancer post-treatment is a major concern, with follow-up protocols typically including regular surveillance colonoscopies, periodic imaging, and carcinoembryonic antigen (C) testing to monitor for disease return and ensure prompt intervention if needed. 17. The prognosis of colon cancer is highly stage-dependent, with localized disease, stage 1, having a 5-year survival rate exceeding 90%, while distant metastatic disease, stage 4, has a significantly reduced survival rate, underscoring the importance of early detection. 18. Palliative care in advanced colon cancer focuses on symptom management, such as pain control and addressing nutritional issues, to enhance the quality of life for patients rather than curing the disease, making it an integral part of comprehensive cancer care. 19. Research into the molecular and genetic underpinnings of colon cancer continues to be a vibrant field, with studies exploring novel biomarkers for early detection and new molecular targets for treatment, offering hope for more personalized and effective management strategies in the future. 20. The mucinous subtype of colon cancer, characterized by abundant extracellular mucin production, presents unique pathological features and is often associated with a poorer prognosis compared to the more common adenocarcinoma subtype, demanding specialized treatment considerations. 21. Colon cancer can metastasize to distant organs, with the liver and lungs being the most common sites, and managing such metastatic spread often involves systemic therapies and, in select cases, surgical resection or radiofrequency ablation of metastasis to prolong survival. 22. Colon cancer incidence shows considerable geographic and ethnic disparities, with higher rates in developed countries, possibly due to lifestyle factors and dietary patterns, although ongoing research is needed to unravel the complex interplay of genetics and environment in these trends. 23. Biomarker testing in colon cancer, such as for mutations in the KRAS, NRAS, and BRAF genes, guides the use of targeted therapies and provides important prognostic information, helping to tailor treatment plans for optimal patient outcomes. 24. Neoadjuvant chemotherapy or chemoradiation therapy before surgical resection has gained traction in advanced rectal cancer treatment, aiming to downstage the tumor and increase the likelihood of complete resection, thereby improving long-term survival rates. 25. Colon cancer in younger adults, while less common than in older populations, is on the rise, warranting increased awareness and consideration of hereditary syndromes, as well as lower screening age guidelines, to address this concerning trend effectively. 26. BRAF mutations in colon cancer are associated with a distinct clinical profile, often demonstrating more aggressive behavior and a poor response to conventional therapies, calling for innovative therapeutic approaches in clinical trials to improve outcomes for affected patients. 27. Inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, significantly increase the risk of developing colon cancer due to chronic inflammation and dysplasia, necessitating vigilant surveillance and perhaps earlier intervention in these at-risk populations. 28. Genetic counseling is an essential component for families with Lynch syndrome or familial adenomatous polyposis, providing information about cancer risks, the importance of surveillance, and preventive options, including prophylactic surgery, for mutation carriers. 29. The gut microbiome, a complex community of microorganisms residing in the colon, is increasingly recognized for its role in colon cancer, with dysbiosis and specific bacterial species being implicated in carcinogenesis, paving the way for innovative microbiome-targeted therapies. 30. Identifying circulating tumor DNA, ctDNA, in the blood offers a promising non-invasive method for monitoring colon cancer recurrence and treatment response, potentially providing real-time insights into tumor dynamics and guiding personalized treatment adjustments. '31. The MSI, microsatellite instability, testing status of colon cancer is a critical factor that impacts treatment decisions, as MSI-high tumors are more likely to respond to immunotherapy, offering a tailored approach that capitalizes on the tumor's unique molecular phenotype. '32. Advances in laparoscopic and robotic surgery have refined the surgical treatment of colon cancer, offering the benefits of minimally invasive techniques such as shorter recovery times, reduced postoperative pain, and smaller incisions, without compromising oncological outcomes. '33. The concept of field cancerization in colon cancer suggests that genetic and epigenetic alterations may occur over a large area of the colon epithelium, potentially leading to multiple primary cancers or recurrences, highlighting the need for thorough surveillance and intervention strategies. '34. Tumor budding, a histopathological feature characterized by isolated cells or small clusters at the invasive front of colon cancer, is emerging as a robust prognostic marker associated with poor clinical outcomes, and it may eventually guide therapeutic decisions in the clinical setting. '35. Tertiary lymphoid structures within the tumor microenvironment of colon cancer are increasingly recognized for their role in mounting anti-tumor immune responses, and their presence correlates with improved survival, representing an area of intense research interest in cancer immunology. '36. Colon cancer prevention may involve the use of chemopreventive agents such as aspirin and other non-steroidal anti-inflammatory drugs, NSAIDs, which have been shown to reduce the risk of adenoma formation and colorectal cancer, although potential side effects must be carefully weighed. '37. Meditation and other forms of stress reduction may play a supportive role in colon cancer care, potentially influencing biomarkers of inflammation and immune function, although more research is required to solidify the evidence base regarding their impact on disease outcomes. '38. Polygenic risk scores, which combine the effects of multiple genetic risk variants, are under development to better predict colon cancer risk in individuals, facilitating personalized screening recommendations and potentially improving early detection rates for high-risk populations. '39. Aromatase inhibitors show promise as a potential treatment for a subset of colon cancers that express estrogen receptors, highlighting the ongoing exploration of hormone modulation as a novel therapeutic avenue in colorectal carcinogenesis. '40. The Warburg effect, characterized by increased glycolysis and lactate production even under normoxic conditions, is a key metabolic feature of colon cancer cells, and targeting this metabolic reprogramming offers a potential strategy for selective cancer therapy. '41. Serrated polyps, which include sessile serrated lesions and traditional serrated adenoma, have distinct molecular and histological features and are an important precursor to colon cancer, underscoring the need for their accurate identification and removal during colonoscopy. '42. The PI3K/AKT/mTOR signaling pathway is frequently dysregulated in colon cancer, contributing to tumor growth and survival, and it represents an attractive target for therapeutic intervention, although drug resistance remains a significant challenge in clinical applications. '43. Anti-angiogenic strategies in colon cancer focus on inhibiting the formation of new blood vessels necessary for tumor growth and metastasis, with agents like bevacizumab demonstrating efficacy in improving survival when combined with chemotherapy in advanced stage disease. '44. In the context of colon cancer, the CpG island methylator phenotype, CIMP, represents a subset with distinct clinical and pathological features, including silencing of tumor suppressor genes through hypermethylation, and has implications for prognosis and treatment responses. #45. Physical exercise is noted to be beneficial for colon cancer survivors, assisting in recovery, reducing fatigue, and potentially lowering recurrence risk through mechanisms involving improved insulin sensitivity, reduction of inflammatory markers, and modulation of metabolic pathways. #46. Research into exosomal communication in colon cancer suggests that these small extracellular vesicles can mediate intercellular transfer of molecules such as proteins, RNAs, and microRNAs, influencing tumor progression and metastasis, and opening avenues for targeted therapeutic manipulation. #47. The involvement of cancer-associated fibroblasts in the desmoplastic response within the tumor microenvironment of colon cancer highlights their role in promoting invasion and resistance to therapy, thus representing a potential target for novel anti-stromal therapeutic approaches. #48. Understanding the interplay between chronic inflammation, often driven by cytokines and inflammatory pathways like NF-κB, and colon carcinogenesis provides insights into potential preventive and therapeutic strategies aiming to modulate the inflammatory milieu in colorectal cancer. #49. The development of inhibitors targeting mutant forms of the APC protein, a tumor suppressor frequently altered in colon cancer, remains a significant research focus, as restoring or compensating for lost APC function could curb abnormal cell proliferation and reduce cancer progression. #50. Progress in organoid technology allows the cultivation of patient-derived colon cancer cells in three-dimensional cultures, offering powerful platforms for personalized drug screening, understanding tumor biology, and advancing precision medicine endeavors in colorectal cancer research. #1. Pancreatic cancer, predominantly adenocarcinomas, arising from the exocrine component, exhibits a notorious track record for poor prognosis due to its insidious onset, often presenting at an advanced stage when the tumor has already invaded surrounding structures or metastasized, emphasizing the potential for future diagnostic innovation in early molecular markers within ductal systems. #2. Clinicians must consider the high propensity for pancreatic cancer to involve neural invasion, a process by which neoplastic cells infiltrate perineural spaces, contributing significantly to severe abdominal and back pain seen in patients, as neurotropic behaviors differ among histological subtypes and offer potential therapeutic targets. #3. While risk factors such as smoking, chronic pancreatitis, obesity, and diabetes mellitus contribute significantly to the pathogenesis of pancreatic cancer, emerging data elucidates how genetic predispositions, specifically BRCA1 and BRCA2 mutations, underpin a subgroup of patients, enhancing the need for personalized genomic screening and tailored vigilance. #4. CT imaging remains a cornerstone in pancreatic cancer diagnosis, particularly multiphase contrast-enhanced scans, which reveal the characteristic hypovascular appearance of these tumors. Nevertheless, the advancement of functional MRI techniques presents an innovative means to assess tumor dynamics, offering critical insights into vascular and perfusion characteristics. #5. The tumor microenvironment in pancreatic cancer is a complex and hostile ecosystem primarily shaped by a dense desmoplastic stroma that not only impedes the delivery of chemotherapeutic agents but also contributes to the immunosuppressive milieu, thus making strategies targeting stromal remodeling an intriguing therapeutic frontier. #6. The clinical presentation of pancreatic cancer commonly includes obstructive jaundice caused by compression of the bile duct. However, an under-recognized manifestation is the new-onset diabetes mellitus, which often precedes cancer diagnosis by months to years, suggesting an intricate relationship between pancreatic beta cell function and carcinogenesis. 7. Innovative therapeutics in the treatment of pancreatic cancer are gradually emerging, with immune checkpoint inhibitors and novel monoclonal antibodies offering measurable yet modest successes, prompting investigational pursuits into combination regimens that could potentially overcome the tumor's notorious resistance mechanisms. 8. Emerging evidence suggests that exosomes, nanovesicles shedding from pancreatic tumor cells, carry specific mRNAs and can modulate distant organ environments, offering a promising new avenue for biomarker discovery and understanding metastatic niche priming, potentially allowing for earlier intervention and monitoring. 9. Surgical resection remains the only potentially curative option for pancreatic cancer, where the Whipple procedure, or pancreaticoduodenectomy, is performed, though novel minimally invasive techniques and robotic-assisted surgeries are reducing morbidity and expanding criteria for operability in borderline resectable cases. 10. Tumor-associated macrophages in the pancreatic cancer microenvironment have been identified as key modulators of immune evasion and tumor progression. Thus, therapies aimed at repolarizing these cells from a pro-tumoral M2 phenotype to an anti-tumoral M1 phenotype are being rigorously explored. 11. In the sphere of chemotherapy for pancreatic cancer, FOLFIRINOX, a regimen comprised of folinic acid, fluorouracil, irinotecan, and oxaliplatin, has shown superiority over the traditional gemcitabine, significantly improving survival in select patients, albeit with an increased risk of adverse effects requiring adept management. 12. Liquid biopsies, leveraging circulating tumor DNA, ctDNA, hold promise for real-time monitoring of pancreatic cancer dynamics, offering a less invasive means to assess mutation landscapes and therapeutic resistance, thus heralding an era of highly tailored and adaptive treatment strategies. 13. Recent advances in molecular pathology have delineated various genetic pathways implicated in pancreatic cancer, with KRAS mutations being particularly prevalent, leading researchers to focus on downstream effector pathways like MEK and ERK as potential targets for innovative anti-tumor interventions. 14. The concept of pancreatic cancer stem cells, a subpopulation within tumors driving long-term proliferation and relapse, underscores the necessity for developing therapies that specifically eradicate these cells, aiming to prevent progression and achieve enduring remission. 15. Pancreatic cancer cells exhibit a metabolic shift toward glycolysis, even under normoxic conditions, a phenomenon known as the Warburg effect, proffering potential therapeutic targets aimed at disrupting the cancer cell's metabolic reprogramming and promoting apoptotic pathways. 16. Despite its aggressive nature, early detection of pancreatic cancer could potentially be achieved via surveillance strategies in high-risk families through regular endoscopic ultrasound screenings, which allow for the assessment of ductal changes and preneoplastic lesions like intraductal papillary mucinous neoplasms, IPMNs. 17. The aggressive metastatic capacity of pancreatic cancer is facilitated by epithelial mesenchymal transition, EMT, where the loss of cellular adhesion and increased invasiveness are mediated by transcription factors such as snail and twist, representing focal points for therapeutic intervention aimed at metastasis suppression. 18. Augmenting the immune response against pancreatic cancer, experimental therapies include the use of oncolytic viruses engineered to selectively infect and lyse tumor cells, triggering a robust immune response, a strategy that is gaining traction in clinical trials for its innovative approach towards breaking tolerance. 19. An often overlooked complication, the thromboembolic phenomenon known as Trousseau's syndrome, pertains to pancreatic cancer's ability to induce hypercoagulability, necessitating proactive management strategies to prevent venous thromboembolism through prophylactic anticoagulation in high-risk scenarios. 20. Research underscores the role of gut microbiota composition in pancreatic cancer progression, revealing that an imbalance or dysbiosis may modulate immune responses and worsen outcomes, sparking interest in microbiome modulation as a novel adjunctive therapeutic avenue. 21. Nutritional support plays a crucial role in the management of pancreatic cancer patients, particularly those undergoing intensive treatment regimens that often lead to malnutrition and cachexia. Thus, careful dietary planning and enzyme supplementation are vital to maintain an optimal nutritional status. 22. Pancreatic cancer's infamy for chemoresistance is partly attributed to the abundance of cancer-associated fibroblasts, CAFs, within its stroma, which secrete factors that not only promote tumor growth but also protect cancer cells from apoptosis, suggesting that targeting CAFs could enhance therapeutic efficacy. 23. The prolonged latency and diverse genetic alterations in the adenomatous precursors of pancreatic cancer necessitate robust screening and stratification strategies, as identification of precursor lesions like PAN-INs offers a window of opportunity for intervention prior to malignant transformation. 24. Hyperangiogenesis, frequently observed in pancreatic cancer, is driven by aberrant production of proangiogenic factors like VEGF, resulting in a poorly organized vasculature. Thus, anti-angiogenic therapies are being explored to disrupt vascular supply and constrain tumor growth. 25. Autophagy, a cellular process of degradation and recycling, plays a paradoxical role in pancreatic cancer, fostering tumor survival under metabolic stress conditions but also offering potential for targeted therapies designed to manipulate autophagic pathways and induce tumor cell death. 26. The utilization of advanced proteomics in pancreatic cancer research allows for the elucidation of protein expression profiles and post-translational modifications unique to tumor cells, serving as a promising platform for the discovery of novel biomarkers and therapeutic targets. 27. Advanced glycation end products, AGEs, and their receptors have surfaced as pivotal players in the pathophysiology of pancreatic cancer, where they mediate pro-inflammatory pathways that enhance tumor progression, offering a unique target for attenuating inflammation-driven carcinogenesis. 28. The presence of occult peritoneal metastasis in pancreatic cancer patients, often undetectable through conventional imaging, necessitates the use of diagnostic laparoscopy or peritoneal washing cytology to guide therapeutic decisions and avoid futile surgical interventions. 29. The intricate interplay between pancreatic cancer and diabetes is further complicated by cancer-induced alterations in insulin resistance and secretion, prompting a need for interdisciplinary management approaches that address the metabolic derangements alongside oncological treatment. 30. Carbohydrate antigen 19-9, CA19-9, remains the most widely used biomarker for pancreatic cancer, despite its limitations in sensitivity and specificity, underscoring the ongoing quest for more reliable serological markers to aid in early detection and monitoring of therapeutic responses. 31. The surgical margin status post-resection, RO, clear margins, versus R1, microscopically positive margins, serves as a critical prognostic indicator, influencing postoperative survival outcomes and the decision-making process regarding adjuvant therapy necessity. 32. Pancreatic neuroendocrine tumors, PNETs, distinct from adenocarcinomas, possess unique pathophysiological traits with varying degrees of lethality depending on their hormonal activity and Ki67 proliferation index, necessitating individualized approaches to treatment and follow-up strategies. 3.3. Understanding the metastatic tropism of pancreatic cancer, whereby disseminated tumors preferentially colonize the liver, lung, and peritoneal cavity, is critical for developing site-specific therapeutic strategies and improving systemic control of the disease. The progressive development of radiomics, involving quantitative imaging analysis, offers unprecedented insights into pancreatic tumor phenotypes, potentially uncovering subtle changes in tissue characteristics beyond visual perception, thus refining diagnostic accuracy and guiding therapy. 35. Surgical and clinical outcomes in pancreatic cancer patients are notably influenced by hospital and surgeon volume, emphasizing the importance of centralized referral systems to high-volume centers to optimize patient care and surgical expertise. 36. Clinical research continually explores neoadjuvant therapy, treatment given prior to surgery, to downstage borderline resectable tumors, facilitating successful complete resections and improving survival outcomes, although patient selection and regimen optimization remain pivotal. 37. Hyperthermic intraperitoneal chemotherapy, HIPEC, while still largely investigational for pancreatic cancer, proposes an intriguing adjunctive treatment by delivering heated chemotherapy directly into the abdominal cavity post-surgery, targeting residual microscopic disease with augmented cytotoxicity. 38. Innovations in personalized medicine are gaining momentum through the development of patient-derived xenografts (PDXs) for pancreatic cancer, which allow the testing of therapeutic responses in individualized tumor models, tailoring treatments according to genetic and phenotypic diversity. 39. While intratumoral heterogeneity in pancreatic cancer complicates therapeutic strategies, advanced single-cell sequencing technologies are beginning to unveil genomic variations at the cellular level, aiding in the identification of resistant clones and informing dynamic treatment adjustments. 40. Racial and ethnic disparities persist in pancreatic cancer incidence and outcomes, rooted in complex socioeconomic, environmental, and biological factors, necessitating targeted public health interventions and equitable healthcare access to bridge the gap in management and survival. 41. Cachexia, a debilitating syndrome associated with pancreatic cancer, involves a complex interplay of inflammatory cytokines, muscle protein degradation, and altered nutrient metabolism, requiring comprehensive management strategies encompassing medical, nutritional, and rehabilitative support. 42. With the advent of artificial intelligence and deep learning algorithms, the potential to revolutionize pancreatic cancer diagnostics is perceptible, specifically in automating the detection of early neoplastic changes in imaging, thereby transforming diagnostic workflows and enabling preemptive therapeutic measures. 43. Emerging evidence indicates that certain lifestyle factors, including moderate alcohol consumption and regular physical activity, may inversely correlate with pancreatic cancer risk, presenting avenues for preventive measures that incorporate lifestyle modification alongside traditional interventions. 44. Epigenetic modifications such as DNA methylation and histone acetylation are increasingly recognized as pivotal in pancreatic cancer pathogenesis, with insights into these alterations paving the way for novel epigenetic therapies aimed at reprogramming malignant gene expression profiles. 45. The development of comprehensive databases integrating clinical, genomic, and proteomic information on pancreatic cancer patients facilitates precision oncology, enabling the identification of molecular alterations that can be matched with targeted therapies, thus revolutionizing disease management. (46) Despite pancreas transplantation being a well-established treatment for diabetes, it remains a largely experimental avenue in pancreatic cancer, with ongoing research exploring its viability and impact on metabolic control in select cases of refractory hypoglycemia-inducing neoplasms. (47) Retinoic acid, a derivative of vitamin A, has shown potential in preclinical models for modulating differentiation and growth in pancreatic cancer cells, offering insights into nutritional and pharmacological interventions that could influence cancer cell fate and reduce proliferation. (48) As our understanding of tumor angiogenesis evolves, innovative approaches including the normalization of tumor vasculature aim to enhance the delivery and efficacy of chemotherapeutics, potentially overcoming the notorious drug resistance and hypoxia associated with pancreatic tumors. (49) The exploration of clonal evolution in pancreatic cancer through advanced genomic techniques reveals how intratumoral genetic diversity can shape the trajectory of tumor growth in response to treatment, underscoring the need for adaptive and continuous management strategies. (50) While pancreatobiliary cancers, including pancreatic adenocarcinoma, are notoriously aggressive, ongoing research into the interplay between the immune system and tumor microenvironment highlights the potential for harnessing autologous or allogeneic immune cells to enhance anti-tumor immunity and complement conventional treatments. (1) Bronchial asthma is a chronic inflammatory disorder of the airways characterized by episodic exacerbations of dyspnea, coughing, wheezing, and chest tightness, driven primarily by eosinophils and mast cells that release inflammatory mediators, leading to a reversible obstruction of airflow and hyperreactivity of the bronchial passages. (2) The pathophysiology of bronchial asthma involves an imbalance of Th1, Th2 cytokine response, where a predominance of Th2 cells promotes an allergic cascade, producing cytokines like IL-4, IL-5, and IL-13, which facilitate IgE synthesis, eosinophil recruitment, and airway remodeling. (3) In diagnosing bronchial asthma, spirometry is a fundamental tool and generally reveals a reversible obstructive pattern, evidenced by a reduced forced expiratory volume in the first second, FEV1, that improves by at least 12% in 200 ml post-bronchodilator administration. (4) The Global Initiative for Asthma Management recommends a stepwise approach to asthma treatment, starting with as-needed low-dose inhaled corticosteroid formoterol for mild cases and escalating to higher doses and additional controller therapies like long-acting beta-2 agonists, LABAs, or leukotriene receptor antagonists for more severe asthma. (5) Exhaled nitric oxide (ENO) levels can serve as a non-invasive biomarker for airway inflammation in asthma, with elevated levels indicating eosinophilic inflammation and a likely positive response to inhaled corticosteroids, thus guiding asthma management tailored to inflammation levels. (6) Common environmental triggers of asthma include inhaling allergens such as pollen, dust mites, pet dander, and mold, alongside air pollutants and tobacco smoke, which can provoke an inflammatory cascade in sensitized individuals, exacerbating asthma symptoms and leading to acute exacerbations. 7. Nocturnal asthma, a variant where symptoms worsen at night, is influenced by circadian variations in bronchial tone and responsiveness, peaking in the early morning due to increased vagal tone, heightened airway inflammation, and potentially reduced levels of circulating glucocorticoids. 8. A significant innovation in asthma management is the use of monoclonal antibodies like omalizumab, an anti-IgE therapy specifically designed for individuals with moderate to severe allergic asthma not adequately controlled by conventional therapies, by binding free IgE, reducing its activity and downstream allergic inflammation. 9. Distinguishing asthma from chronic obstructive pulmonary disease, COPD, requires keen clinical acumen, as patients with asthma typically present with a history of allergies and variable symptoms, while COPD generally arises in older individuals with a history of smoking, showing a progressive and non-reversible pattern of airflow limitation. 10. Asthma exacerbations are acute or subacute episodes of worsening symptoms often precipitated by infections, allergens, irritants, or exercise, owing to increased airway inflammation and narrowing that demand immediate intervention with systemic corticosteroids and bronchodilators to restore airflow and prevent progression. 11. Bronchial thermoplasty represents an innovative treatment for severe refractory asthma, employing controlled thermal energy delivered via bronchoscopy to selectively reduce airway smooth muscle mass, diminishing the excessive contractile response that characterizes asthma and thereby reducing exacerbations and improving quality of life. 12. A personalized approach in asthma management encompasses phenotyping patients into endotypes such as eosinophilic, neutrophilic, mixed granulocytic, or posagranulocytic inflammation, which allows for targeted therapies that specifically address the dominant inflammatory pathway most active in an individual's asthma. 13. Exercise-induced bronchoconstriction, IBD, is asthma triggered by physical activity, due to rapid air movement causing airway drying and cooling, followed by hyperemia and mast cell mediator release. Preventive pre-exercise inhalation of short-acting beta-2 agonists can help mitigate frequency and severity of such attacks. 14. Understanding asthma pathogenesis involves recognizing the role of genetics and environmental interactions, with genetic predispositions such as polymorphisms in genes encoding for cytokines, beta-2 adrenergic receptors, and proteins involved in the inflammatory process that increase the risk of developing asthma when exposed to environmental triggers. 15. Pediatric asthma presents unique challenges due to the developing respiratory system and distinct patterns of inflammation. Small airway size, more pronounced reactions to viral infections, and differential responses to allergen exposure necessitate tailored management strategies aligned with the child's specific triggers and symptom patterns. 16. One innovative diagnostic approach for asthma involves fractional exhaled nitric oxide (FeNO) testing, where elevated levels indicate eosinophilic inflammation that may predict the response to corticosteroid therapy and serve as a marker for adherence to controller medications, providing insight into inflammation control. 17. Occupational asthma is caused by an exposure to specific allergens or irritants at work, such as isocyanates, flour dust, or animal dander, requiring both confirmation of the diagnosis through occupational history and physiological testing, and implementation of exposure controls or workplace changes to alleviate symptoms. 18. In recent years, personalized medicine in asthma has advanced with the advent of biologics targeting specific cytokines such as IL-5, with drugs like mepolizumab and benralizumab that focus on reducing eosinophilia, thereby preventing exacerbations and reducing the need for oral corticosteroids in patients with severe eosinophilic asthma. 19. Allergen immunotherapy is a proactive treatment strategy for allergic asthma sufferers, involving gradual exposure to increasing amounts of specific allergens, which aims to desensitize the immune system, reduce IgE-mediated responses, and provide long-term mitigation of allergic symptoms linked to asthma. 20. The Asthma-COPD Overlap Syndrome, ACOS, poses diagnostic and therapeutic challenges, requiring a nuanced approach that combines treatments addressing both reversible bronchoconstriction and persistent airflow obstruction while considering the presence of airway inflammation characteristic of each condition. 21. Peak expiratory flow rate, PEFR, monitoring provides a practical method to assess airway obstruction in asthma patients. Personal bests are used to set action plans to guide patients on self-management, helping detect early signs of exacerbation and thereby preventing deterioration of lung function. 22. Asthma control is critically evaluated through patient-reported outcomes and validated questionnaires such as the Asthma Control Test, ACT, allowing healthcare providers to quantify symptom presence and severity, and adjust therapeutic regimens accordingly to achieve optimal symptom-free days and nights. 23. Complementary asthma treatments like yoga and breathing exercises can improve respiratory function and reduce stress-related symptom exacerbations, working synergistically with conventional treatment to promote overall well-being, improved lung capacity, and better control of symptoms. 24. The association of asthma with obesity is supported by evidence showing that adipose tissue contributes to systemic inflammation via secretion of adipokines, potentially exacerbating asthma symptoms and reducing lung function, making weight management a critical component of comprehensive asthma management strategies. 25. Vocal cord dysfunction, VCD, is an important differential diagnosis in patients with severe asthma, where an inappropriate vocal cord closure during inspiration mimics asthma symptoms, highlighting the need for precise laryngoscopy to accurately distinguish between VCD and asthma for effective management. 26. Severe asthma, often refractory to standard treatments, may be guided by genomic studies identifying biomarkers and genetic variations associated with treatment responses, providing a basis for precision medicine approaches that optimize therapy selection and outcome predictions. 27. Asthma management in pregnancy requires careful balancing to ensure maternal health without compromising fetal development, with inhaled corticosteroids remaining the preferred controller medication, while ensuring any pharmacotherapeutic intervention is safe for both mother and child. 28. The hygiene hypothesis suggests that asthma has become more prevalent due to reduced early childhood exposure to infections, leading to an unbalanced immune response favoring allergic sensitization, supporting the importance of early exposure to diverse microbial environments in mitigating the risk of asthma. 29. Prolonged exposure to low-grade air pollution, particularly particulate matter and nitrogen dioxide, not only exacerbates asthma symptoms but is linked with increased onset risk, underscoring the importance of environmental policies and individual practices aimed at minimizing exposure to air pollutants. 30. Digital health technologies and smart inhalers are emerging as valuable tools in asthma management, offering real-time monitoring of medication usage and adherence, providing data-driven insights that inform personalized treatment adjustments and foster improved patient engagement in their healthcare regimen. 31. Asthma in the elderly poses unique challenges, often presenting with atypical symptoms and underdiagnosed due to attribution of symptoms to aging, necessitating vigilant assessment practices that discern asthma from comorbidities, ensuring accurate diagnosis and tailored management. 32. Viral respiratory infections, particularly those caused by rhinoviruses, are significant triggers of asthma exacerbations, inciting inflammation and hyper-responsiveness through pathogen recognition receptors on airway cells, thereby making preventative strategies against respiratory infections essential in asthma management. Pediatric asthma education programs focusing on self-management skills tailored to developmental stages, emphasize understanding trigger avoidance, inhaler technique, and recognizing asthma action plans, which significantly enhance health outcomes and reduce emergency department visits in children. In recent developments, heat maps generated from wearable biosensors monitoring physiological parameters like heart rate and respiratory patterns can provide predictive analytics of asthma exacerbations, offering cutting-edge opportunities for early intervention in asthma management. Lifestyle modifications, including dietary adjustments that prioritize omega-3 fatty acids, antioxidants, and decreased processed foods, have shown promise in reducing inflammation and improving asthma control, supporting the role of nutrition in comprehensive asthma management. The spiraling costs of asthma care have prompted exploration into cost-effective strategies like telemedicine consultations, which improve access to specialist care and are associated with positive outcomes in asthma management, reinforcing the viability of technology-assisted healthcare delivery. Inflammation in asthma is traditionally focused on the eosinophilic variety, yet neutrophilic and mixed inflammatory profiles are increasingly recognized, necessitating distinct approaches such as non-steroidal anti-inflammatory agents or macrolides that efficiently target the specific inflammatory cell populations. The role of the microbiome in asthma is an expanding field of research. Disruptions in microbial diversity in the airway and gut have been linked to increased asthma risk, thus influencing potential therapeutic strategies aimed at modulating the microbiome to maintain immune system balance. Precision-guided inhaler drug delivery systems are being enhanced by leveraging particle engineering technology to optimize drug particle size and distribution, aiming at maximizing deposition in the lower airways and consequently improving efficacy for controlling asthma symptoms and exacerbations. Advances in epigenetic research have opened new frontiers in asthma treatment, revealing how modifications in gene expression, driven by environmental factors, contribute to the asthma phenotype and could become targets for epigenetic therapeutics aimed at altering the disease trajectory. Asthma action plans, individually tailored and regularly reviewed, are critical elements in disease management that empower patients to respond effectively to changing symptoms, preventing exacerbations through a structured approach that defines specific actions based on symptom severity and peak flow measurements. The role of health literacy in asthma outcomes is profound, with studies indicating that improved literacy and understanding of asthma pathophysiology, triggers, and treatments correlate with better disease control, reduced healthcare utilization, and the empowerment of patients to participate actively in their care. Airway remodeling, a chronic outcome of untreated or poorly controlled asthma, results from persistent inflammation leading to structural changes such as subepithelial fibrosis and smooth muscle hypertrophy, emphasizing the importance of timely and consistent treatment to prevent irreversible airway obstruction. Innovations in AI-driven asthma management explore algorithms that integrate patient-specific data, predictive analytics, and clinical guidelines to support healthcare providers in making informed decisions, thereby optimizing individualized care protocols and potentially improving long-term asthma control. The development of fixed-dose combination inhalers that contain both a long-acting beta-2 agonist and an inhaled corticosteroid improves patient adherence, simplifies treatment regimens, and delivers consistent therapeutic benefit by targeting both inflammation and bronchoconstriction in asthma management. '46. Psychological stress has a profound impact on asthma exacerbations, mediated through neuroendocrine pathways that affect immune system function, highlighting the need for integrated care approaches that address both psychological and physiological aspects of asthma to enhance disease management. '47. Clinical trials investigating heat shock proteins in asthma reveal potential therapeutic targets, as these proteins modulate inflammation and protect against cellular damage, offering a novel angle in asthma treatment strategies aimed at reducing immune activation and asthma-associated tissue damage. '48. Environmental control in asthma, especially in homes with allergic asthma patients, demands meticulous attention to allergen sources. Important interventions include the use of high-efficiency particulate air, HEPA, filters, frequent cleaning, and encasing mattresses to mitigate the allergen burden effectively. '49. Inflammation resolution in asthma is a critical focus, where emerging therapies aim to foster pro-resolution lipid mediators like lipoxins and resolvins that actively terminate inflammatory responses, restoring airway homeostasis without compromising host defense mechanisms. '50. The application of therapeutic phage therapy in asthma is under exploration, targeting bacterial infections associated with asthma exacerbations, where phages specifically lyse pathogenic bacteria, thus minimizing bacterial-induced inflammation and presenting a precision treatment modality with potential for personalization. '1. Esophageal cancer is a malignancy arising from the esophagus characterized by two main histological types: squamous cell carcinoma, which typically affects the upper portion of the esophagus and is strongly associated with smoking and alcohol consumption, and adenocarcinoma, which often develops in the lower part of the esophagus and is linked to chronic gastroesophageal reflux disease and Barrett's esophagus. '2. The pathophysiology of esophageal cancer involves the uncontrolled proliferation of cells lining the esophagus, often initiated by chronic irritation or inflammation caused by factors such as tobacco, alcohol, and gastroesophageal reflux, which over time can lead to genetic mutations and the development of neoplasms. '3. Early-stage esophageal cancer is often asymptomatic or presents with subtle symptoms like difficulty swallowing, dysphagia, which is frequently noticed with solid foods and can progressively worsen to include liquids as the tumor grows, causing obstruction within the esophageal lumen. '4. Diagnosis of esophageal cancer commonly involves upper endoscopy with biopsy for histological examination, offering direct visualization of the mucosal abnormalities, combined with imaging techniques such as CT and PET scans to assess tumor staging and metastatic spread. '5. The most significant risk factor for esophageal adenocarcinoma is chronic gastroesophageal reflux disease, GERD, which can cause Barrett's esophagus, a precancerous condition marked by the metaplastic transformation of normal squamous epithelium to columnar-lined epithelium over time. '6. Squamous cell carcinoma of the esophagus is more prevalent in certain geographic regions such as East Asia and Eastern Africa, with dietary influences, consumption of very hot beverages, and nutritional deficiencies playing contributory roles in its etiology. '7. Treatment for esophageal cancer varies based on the stage and location of the tumor but generally involves a combination of surgery, radiation, and chemotherapy, with esophagectomy being the mainstay curative approach for localized tumors, while systemic chemotherapy is pivotal for metastatic disease. 8. Barrett's esophagus represents a premalignant condition in which the squamous epithelium of the distal esophagus is replaced by intestinal columnar epithelium, increasing the risk of developing esophageal adenocarcinoma due to chronic acid exposure and inflammation. Nine. Endoscopic ultrasound, EUS, serves as a critical tool in the staging of esophageal cancer, allowing for detailed assessment of tumor penetration into the esophageal wall and surrounding lymph nodes, which is crucial for planning effective treatment strategies. The prognosis of esophageal cancer varies significantly by stage at diagnosis, with localized disease offering the best chance of cure, whereas advanced or metastatic disease is associated with a poor prognosis and a 5-year survival rate of less than 20%. 11. Symptomatic treatments for esophageal cancer may include esophageal dilation or stenting to alleviate obstructive symptoms, thereby improving swallowing and nutritional intake, especially in cases where the tumor is unresectable or the patient is unfit for surgery. 12. Molecular markers and genetic profiling are gaining attention in the prognosis and targeted therapy of esophageal cancer, with HER2 overexpression and PD-L1 expression being examples of biomarkers that can influence treatment plans, including the use of targeted therapies like trastuzumab or immune checkpoint inhibitors. Smoking cessation is crucial in reducing the risk of esophageal squamous cell carcinoma, as tobacco smoke contains numerous carcinogens that contribute to the development of various intraepithelial lesions and malignant transformations in the esophagus. The role of the p53 tumor suppressor gene is pivotal in esophageal carcinogenesis, with mutations in this gene frequently encountered in both adenocarcinomas and squamous cell carcinomas, leading to impaired cell cycle regulation and increased susceptibility to neoplastic transformation. Nutritional support is a key component of managing esophageal cancer, especially when advanced disease or treatment side effects compromise oral intake, necessitating interventions such as enteral feeding or supplementation to maintain adequate nutrition and weight. Esophageal leiomyoma is the most common benign esophageal tumor, often asymptomatic and discovered incidentally on imaging, and differs from malignant lesions by its smooth muscle origin and low potential for malignant transformation. Surgical removal is warranted only if symptomatic. PET cord scanning is invaluable for detecting metabolic activity and assessing distant metastasis in esophageal cancer, giving comprehensive information on disease spread that cannot be obtained through conventional imaging alone, thereby influencing decisions on the need for neoadjuvant therapy. Alcohol use is a major risk factor for esophageal squamous cell carcinoma, with a dose-dependent relationship indicating that higher alcohol intake significantly elevates the risk of developing this type of cancer, emphasizing the importance of moderation or avoidance in at-risk populations. Chemoradiotherapy can serve as a neoadjuvant treatment for esophageal cancer, intending to shrink the tumor preoperatively, improve the surgical outcome, and address microscopic metastatic disease, particularly in patients with locally advanced but still resectable tumors. The development of minimally invasive esophagectomy (MIE) techniques has revolutionized the surgical management of esophageal cancer, offering reduced postoperative morbidity, faster recovery times, and comparable oncological outcomes to traditional open surgical approaches. The expression of matrix metalloproteinases (MMPs) in esophageal cancer correlates with aggressive tumor behavior and metastatic potential, as these enzymes degrade extracellular matrix components, facilitating tumor invasion and spread, making them potential targets for therapeutic intervention. 22. Regular monitoring through endoscopic surveillance is critical for patients with Barrett's esophagus to detect dysplastic changes early, allowing for timely intervention strategies aimed at preventing progression to esophageal adenocarcinoma, including endoscopic resection or ablation techniques. 23. Dysphagia, or difficulty swallowing, is often one of the earliest and most common presenting symptoms of esophageal cancer, primarily resulting from tumor-induced luminal narrowing, progressing from solids to liquids as the disease advances, warranting prompt diagnostic evaluation. 24. The incidence of esophageal adenocarcinoma has been rising in Western countries, likely related to increased prevalence of obesity and gastroesophageal reflux disease, highlighting the role of lifestyle modification and surveillance in at-risk populations to curb this trend. 25. Adenocarcinoma of the esophagus frequently exhibits overexpression or amplification of the HER2/Neu oncogene, which has made the trastuzumab-based therapeutic regimen a viable option for improving outcomes in HER2-positive esophageal cancer, similar to its use in breast cancer. 26. Genetic syndromes such as tylosis, characterized by palmoplantar keratoderma, are associated with esophageal cancer, particularly squamous cell carcinoma, underscoring the importance of genetic counseling and early surveillance in affected families due to their markedly increased risk. 27. The role of E-cadherin, a cell adhesion molecule, is significant in esophageal cancer, with loss of its expression being linked to epithelial to mesenchymal transition, increased invasiveness, and metastatic potential, suggesting its potential utility as a prognostic marker. 28. Achalasia, a primary esophageal motility disorder, increases the risk of esophageal squamous cell carcinoma due to long-standing stasis and inflammation, making periodic endoscopic surveillance vital in patients with this condition to detect early neoplastic changes. 29. Proton pump inhibitors, PPIs, are commonly prescribed to manage gastroesophageal reflux disease and can play a role in preventing progression to Barrett's esophagus and esophageal adenocarcinoma by significantly reducing acid exposure and subsequent esophageal inflammation. 30. The overexpression of VEGF, a potent angiogenic factor, in esophageal cancer correlates with poor prognosis due to its role in promoting tumor angiogenesis and growth, making it a potential target for anti-angiogenic therapies such as bevacizumab in the treatment of advanced disease. 31. Photodynamic therapy, PDT, is an endoscopic treatment option for early-stage esophageal cancer or dysplasia in Barrett's esophagus, utilizing photosensitizing agents activated by light to destroy cancerous cells with minimal damage to surrounding healthy tissue. 32. Multidisciplinary management of esophageal cancer, incorporating input from gastroenterologists, oncologists, surgeons, radiologists, and nutritionists, is essential to delivering comprehensive care tailored to individual patient needs and maximizing therapeutic outcomes. 33. Epstein-Barr virus, EBV, has been implicated in certain cases of esophageal squamous cell carcinoma, with studies suggesting a possible etiological role, though the exact mechanisms of oncogenesis remain unclear and warrant further investigation to establish causation. 34. The assessment of esophageal tumor margins post-resection is critical to ensure complete excision and prevent local recurrence, often involving frozen section analysis intraoperatively to guide the surgical approach and achieve clear margins for optimal oncological outcomes. 35. Targeted therapies, such as monoclonal antibodies and small molecule inhibitors, are increasingly explored in esophageal cancer treatment, with ongoing research focusing on biomarkers like EGFR, MET, and PD-1/PD-L1 pathways to enhance response rates and survival benefits. 36. Monitoring treatment response in esophageal cancer often involves serial imaging studies, including CT or PET scans, combined with clinical evaluation of symptom resolution, providing key insights into therapeutic effectiveness and facilitating timely adjustments in management plans. (37) Obesity is a known risk factor for esophageal adenocarcinoma, primarily through its association with gastroesophageal reflux and subsequent Barrett's esophagus, emphasizing the importance of weight management and lifestyle modifications in lowering cancer incidence in overweight populations. (38) Human papillomavirus (HPV) has been investigated for its potential role in esophageal squamous cell carcinoma, with some studies identifying HPV DNA in tumor tissue, yet its significance remains controversial, and additional research is needed to clarify its impact on esophageal carcinogenesis. (39) The use of serological markers, such as squamous cell carcinoma antigen, SCC-AG, provides supplementary information in monitoring and prognosticating esophageal squamous cell carcinoma, although their utility is limited by specificity and the need for further validation. (40) Brachytherapy, a form of internal radiation therapy, can be employed as a palliative treatment in esophageal cancer, particularly in advanced or recurrent disease, to provide symptomatic relief from dysphagia and improve the quality of life, especially when external beam radiation is not feasible. (41) Robotic-assisted esophagectomy offers a modern surgical approach with advantages including enhanced precision, reduced blood loss, and shorter hospital stays compared to traditional methods, though it requires specialized training and equipment, contributing to its limited availability. (42) Chronic esophagitis, resulting from prolonged gastroesophageal reflux, can cause progressive cellular alterations, ultimately leading to Barrett's esophagus and increasing the risk for esophageal adenocarcinoma, hence the importance of early and effective management of reflux symptoms. (43) The gut microbiome's role in esophageal cancer is an emerging field of study, with research suggesting that dysbiosis or alterations in the microbial balance may influence carcinogenesis, although the precise mechanisms and implications for prevention and therapy remain to be fully elucidated. (44) Neoangiogenesis, the formation of new blood vessels, is crucial for esophageal tumor growth and progression, often driven by factors like VEGF, making anti-angiogenic agents an appealing therapeutic option to limit nutrient supply and impair tumor expansion in advanced cancer stages. (45) Inflammatory mediator overproduction, such as prostaglandins, in chronic reflux esophagitis can exacerbate tissue damage and increase cancer risk, supporting the use of anti-inflammatory drugs, like COX-2 inhibitors, in potentially reducing the progression to esophageal cancer. (46) Salvage surgery is sometimes employed in esophageal cancer for recurrent disease following chemoradiation, offering the possibility of disease control or cure when initial non-surgical treatments fail, though it is associated with higher morbidity and requires careful patient selection. (47) Nanotechnology applications in esophageal cancer encompass drug delivery systems aimed at enhancing therapeutic efficacy and reducing systemic toxicity, utilizing nanoparticles to target cancer cells more precisely, representing a burgeoning area of research with promising potential. (48) Esophageal cancer screening is not widely implemented due to the lack of a sufficiently sensitive and cost-effective method for the general population, although high-risk groups, such as those with Barrett's esophagus, may benefit from regular endoscopic surveillance to identify early malignancies. (49) Dysregulation of cyclooxygenase 2, COX2 expression in esophageal cancer is associated with increased proliferation and resistance to apoptosis, providing a rationale for using COX2 inhibitors as a potential therapeutic strategy to enhance treatment response and inhibit tumor progression. Cryotherapy is an emerging endoscopic treatment for early esophageal cancer or precancerous lesions, utilizing extreme cold to ablate dysplastic tissue with minimal invasiveness and complications, offering an alternative to more invasive surgical options in select patients. Hepatitis C is a liver infection caused by the hepatitis C virus, HCV, which primarily spreads through exposure to blood contaminated with the virus, often through sharing needles or medical equipment, making early detection crucial in preventing liver damage and complications. The pathophysiology of hepatitis C involves the HCV triggering chronic inflammation in the liver, causing liver cells to die and be replaced with fibrous scar tissue, which can eventually lead to cirrhosis, impairing liver function and increasing the risk for liver cancer. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering cure rates above 90% with typically few side effects, although the choice of a specific DAA regimen depends on the viral genotype and presence of liver disease complications. Hepatitis C can remain asymptomatic for years, making routine screening for people at risk vital because early diagnosis allows for timely initiation of antiviral therapy to prevent progression to severe liver disease. There are 6 genotypes of hepatitis C virus, each affecting treatment choices and duration, with genotype 1 being the most common in the United States and often requiring a different therapeutic approach compared to other genotypes. The diagnosis of hepatitis C involves initial screening with an HCV antibody test, followed by a confirmatory HCV RNA test if antibodies are detected, to determine whether there is an active infection needing treatment. Chronic hepatitis C infection is a leading cause of liver transplants globally due to its potential to cause cirrhosis or liver cancer, emphasizing the importance of antiviral treatment in preventing these severe outcomes. Despite there being no vaccine for hepatitis C, preventive measures such as avoiding needle sharing and ensuring safe blood transfusion practices are crucial to reduce the transmission of this virus. The liver damage from hepatitis C can cause complications like portal hypertension, characterized by increased blood pressure in the portal vein, leading to varices or ascites, highlighting the importance of regular monitoring in chronic cases. Advanced hepatitis C with cirrhosis is a known risk factor for hepatocellular carcinoma, making regular liver ultrasounds and alpha-fetoprotein tests essential in the surveillance for liver cancer in these patients. Some patients with hepatitis C might experience extrahepatic manifestations such as mixed cryoglobulinemia, a condition causing systemic vasculitis, often requiring additional treatments like immunosuppressive therapy. Certain lifestyle modifications, like avoiding alcohol which can exacerbate liver damage, are crucial in managing hepatitis C, as alcohol consumption accelerates the progression to cirrhosis. A liver biopsy, though less commonly used now, can be helpful in assessing the extent of liver damage in hepatitis C, including the degree of inflammation and fibrosis, which can guide treatment decisions. While hepatitis C attacks liver cells preferentially, it can also affect organs outside the liver, potentially leading to complications such as renal disease or lymphomas, underscoring the need for comprehensive care. 15. The sustained virologic response, SVR, is the goal of hepatitis C treatment, indicating that the virus remains undetectable in the blood 12 weeks after completing therapy, which is equated to a cure. (16) In the era of DAAs, treatment regimens for hepatitis C have become shorter, typically ranging from 8 to 12 weeks, marking a significant advancement over prior treatments that could last up to a year with inferior outcomes. (17) Hepatitis C virus can undergo genetic mutations, aiding its evasion from the immune system and the development of resistance to antiviral treatments, which necessitates the use of combination drug therapies. (18) Blood donor screening and the introduction of direct-acting antivirals have significantly reduced new hepatitis C infections, yet public health efforts continue to bridge gaps in diagnosis and treatment accessibility. 19. Hepatitis C is more infectious than HIV but less than hepatitis B in terms of blood-borne pathogens, stressing the importance of public health interventions to remain vigilant in controlling its spread. 20. During acute hepatitis C infection, only a minority of people will exhibit symptoms such as jaundice, fatigue, or abdominal pain, which often resolve spontaneously but still require medical evaluation due to the risk of progression to a chronic state. (21) Reinfection with hepatitis C is possible even after successful treatment, particularly in individuals who continue engaging in behaviors that expose them to the virus, emphasizing the importance of preventive education. (22) During pregnancy, there is a low risk of mother-to-child transmission of hepatitis C, but women with chronic infection should be monitored and counseled accordingly to minimize risk and plan for management. 23. In patients co-infected with HIV and hepatitis C, treating both conditions is crucial as they can exacerbate each other's progression, with newer direct-acting antivirals greatly improving cure rates for HCV in such cases. (24) Certain rare genetic conditions might affect the progression and treatment outcomes in hepatitis C infection, with ongoing research aiming to better understand these genetic factors and their role in personalized medicine. (25) The introduction of second-generation direct-acting antivirals marked a milestone in the management of hepatitis C, as these drugs target multiple stages of the viral life cycle, offering improved efficacy and tolerability compared to older treatments. (26) The hepatitis C virus can survive outside the body for several weeks, which highlights the importance of environmental cleaning and sterilization procedures, particularly in settings like healthcare facilities. 27. Besides liver damage, patients with chronic hepatitis C may develop insulin resistance and type 2 diabetes, necessitating diligent monitoring and management of these metabolic disorders as part of comprehensive care. (28) The global burden of hepatitis C is substantial, with millions affected across diverse geographies, necessitating international collaboration and tailored strategies to effectively manage and eliminate the disease. (29) Recent advancements in blood testing technology allow for early detection of hepatitis C, including the use of rapid diagnostic tests, which enhance screening efforts particularly in resource-limited settings. 30. Injection drug use remains the most significant risk factor for hepatitis C transmission in high-income countries, driving initiatives aimed at harm reduction, such as needle exchange programs to mitigate disease spread. (31) Chronic hepatitis C infection can affect mental health, contributing to cognitive impairment or depression, which calls for an integrative treatment approach that includes psychosocial support services. 32. Healthcare workers are at occupational risk for hepatitis C due to potential needle stick injuries, making adherence to standard precautions and the use of safety-engineered devices vital to prevent transmission. 3. Antiviral resistance in hepatitis C treatment is rare but can occur in poorly adherent patients or those with prior treatment experience, making rigorous follow-up and education on adherence crucial for achieving optimal outcomes. 34. Given that hepatitis C can lead to hepatic encephalopathy, a condition characterized by confusion and altered consciousness due to liver dysfunction, monitoring and preventive strategies, including supplemental treatment to manage ammonia levels, are critical. 35. Exposure to hepatitis C does not confer protective immunity as seen in some other viral infections, thus individuals remain susceptible to future reinfections and should continue adopting preventive measures post-treatment. 36. Hepatitis C virus belongs to the Flaviviridae family, possessing a single-stranded RNA genome, with its genotype and viral load influencing clinical manifestation, natural progression, and response to treatment. 37. In patients with hepatitis C cirrhosis, careful management and regular monitoring of liver function are essential, as portal hypertension can lead to life-threatening variceal hemorrhage if not controlled properly. 38. Direct-acting antivirals targeting protease, nucleotide polymerase, and NS5A proteins are the cornerstone of modern hepatitis C treatment regimens, disrupting viral replication at different stages to achieve sustained virologic response. 39. Co-infection with hepatitis B and hepatitis C complicates clinical management as both viruses have the potential to cause liver damage, necessitating individualized treatment strategies and careful monitoring for reactivation. 40. Hepatitis C testing is recommended for all individuals born between 1945 and 1965 in the United States, as this cohort, often termed baby boomers, demonstrates a significantly higher prevalence of the infection. 41. Although previously thought incurable, advancements in hepatitis C research have highlighted the critical role of the host immune system, leading to innovative therapies exploiting both direct-acting antivirals and immunomodulatory effects. 42. Individuals with advanced liver fibrosis from chronic hepatitis C are at an increased risk for cardiovascular diseases such as myocardial infarction, pointing to the need for comprehensive health monitoring beyond just liver function. 43. Adequate nutritional support is paramount in managing hepatitis C, with an emphasis on maintaining healthy body weight, optimizing liver function, and potentially reducing inflammation through a well-balanced diet. 44. In pediatric hepatitis C infections, though rare, early diagnosis and treatment are key to preventing disease progression and ensuring long-term liver health, as children generally respond well to direct-acting antiviral regimens. 45. Researchers continue to explore potential therapeutic vaccines for hepatitis C, focusing on stimulating the body's immune response to prevent infection or aiding in viral clearance in those already infected. 46. Hepatitis C treatment adherence remains crucial in achieving viral eradication, as missing doses or incomplete therapy can lead to suboptimal outcomes and increased risk of developing drug-resistant virus strains. 47. While telemedicine has expanded access to hepatitis C care, contributing to improved treatment uptake in remote or underserved areas, ongoing challenges include ensuring adequate patient follow-up and managing compliance. 48. The social stigma associated with hepatitis C can be a barrier to diagnosis and treatment. Therefore, public health initiatives must address misconceptions and educate communities to foster an environment conducive to seeking care. 49. Recent efforts in mapping the hepatitis C genome have provided insights into viral diversity and mechanisms of persistence, paving the way for more effective and targeted therapies that could potentially lead to the virus's eradication. 50. Understanding the role of liver stiffness measurement via transient elastography offers a non-invasive method to assess liver fibrosis in hepatitis C patients, aiding in diagnosis and monitoring disease progression without the need for liver biopsy. 1. Understanding leukemia begins with recognizing its pathophysiology, where unchecked proliferation of abnormal white blood cells in the bone marrow disrupts normal hematopoiesis, leading to overproduction of dysfunctional leukocytes that can infiltrate vital organs and severely compromise immune system functioning. 2. A groundbreaking aspect of leukemia diagnosis involves flow cytometry, a sophisticated technique that enables clinicians to identify and quantify various cell populations in a blood sample, thus differentiating between subtypes of leukemia with unparalleled precision and informing subsequent treatment decisions. 3. The evolution of targeted therapy in leukemia is exemplified by tyrosine kinase inhibitors, such as imatinib, which specifically antagonize the BCR-ABL fusion protein in chronic myeloid leukemia, CML, thereby halting cancer cells' proliferation without substantially impacting normal cellular processes. 4. In acute lymphoblastic leukemia, all cytogenetics plays a pivotal role, as identifying chromosomal abnormalities such as the Philadelphia chromosome or translocations involving chromosome 12 and 21 informs prognosis and the selection of precise therapeutic protocols that are tailored to individual genetic profiles. 5. Leukapheresis is an innovative therapeutic intervention for acute leukemic presentations, where the removal of excess leukocytes from the bloodstream through apheresis rapidly diminishes hyperviscosity syndromes, thereby preventing cerebrovascular accidents and relieving symptomatic leukostasis. 6. Acute myeloid leukemia, AML, pathophysiology hinges on mutations in hematopoietic progenitor cells leading to clonal expansion of immature myeloid blasts, which not only crowd out normal precursors but also manifest in varied clinical presentations such as anemia, infection, and thrombocytopenia. 7. The notion of minimal residual disease, MRD, detection in leukemia has transformed remission monitoring, with sensitive techniques such as next-generation sequencing allowing for the detection of residual leukemic cells at a molecular level, thereby preempting relapse and refining therapeutic regimens. 8. Educational outreach in leukemia highlights the risk factors, including previous chemotherapy, radiation exposure, and genetic predisposition, emphasizing preventive strategies and early intervention to potentially mitigate the disease burden and improve demographic-specific outcomes. 9. Leukemia stem cells represent a paramount challenge due to their self-renewing capacity and resistance to conventional therapies. Targeting these cells with inhibitors of specific signaling pathways could potentially eradicate the root of the disease and prevent relapse. 10. The discovery and differentiation of T-cell and B-cell leukemias have provided a greater understanding of leukemogenesis, enabling specialized treatment plans that target distinct immunophenotypes, thereby improving therapeutic efficacy by directly engaging the malignancy's cellular origin. 11. Bone marrow aspiration and biopsy remain gold standard procedures for leukemia diagnosis, providing vital morphological and cytogenetic information necessary for classifying leukemia type, assessing marrow cellularity, and pinpointing specific chromosomal or molecular aberrations. The role of the tumor microenvironment in leukemia progression is gaining attention, with stromal cell signals and cytokine networks being investigated for their contributions to drug resistance and establishing niches that protect leukemic cells from therapeutic elimination. Personalized medicine in the management of leukemia now capitalizes on genetic and molecular data to customize treatment regimens, using pharmacogenomics to predict drug response and toxicity, thereby optimizing therapeutic outcomes while minimizing adverse effects. Advances in leukemia research emphasize the potential of CAR T-cell therapy, wherein genetically modified autologous T-cells are engineered to express chimeric antigen receptors that target specific leukemia-associated antigens, achieving unprecedented remission rates in refractory cases. Pediatric leukemia research underscores that children with Down syndrome have an elevated risk of developing acute leukemia, necessitating vigilant clinical surveillance and tailored therapeutic approaches to maximize outcomes while minimizing treatment-related morbidity. High-dose chemotherapy followed by hematopoietic stem cell transplantation remains a cornerstone in treating certain high-risk leukemias, wherein autologous or allogeneic stem cells are infused to replace the eradicated leukemic marrow and restore hematopoietic functions. Understanding the role of epigenetic modifications in leukemia, such as DNA methylation and histone acetylation, has opened new avenues for therapies like hypomethylating agents, which seek to reverse aberrant epigenetic states and reactivate tumor suppressor genes. The application of machine learning in leukemia is revolutionizing diagnostics by analyzing vast datasets to identify patterns and anomalies, offering the potential for early detection and personalized prognosis while continuously refining therapeutic approaches through adaptive algorithms. Leukemia-related fatigue, a pervasive symptom that significantly impacts quality of life, is being re-evaluated through comprehensive patient-centered studies aiming at integrative management approaches that encompass physical, psychological, and pharmacologic strategies. Chronic lymphocytic leukemia (CLL) pathogenesis is heavily influenced by the accumulation of functionally inert yet non-apoptotic B lymphocytes, with research targeting the B-cell receptor signaling pathway to inhibit downstream survival signals and induce cancer cell apoptosis. Translational research in leukemia has spotlighted the significance of microRNAs in post-transcriptional regulation, with select mRNAs serving as potential biomarkers for early diagnosis, therapeutic targets, or as modulators of drug sensitivity and resistance mechanisms. In pediatric leukemia, supportive care has gained prominence, encompassing measures to address treatment-related toxicities such as infections, organ dysfunction, and growth impairment, thus elevating survivors' quality of life and fostering holistic recovery journeys. The discovery of oncogenes such as TET2 and FLT3 in leukemia has catalyzed research into their role in leukemic transformation, with ongoing trials testing inhibitors and prototypic compounds aimed at these genes to arrest disease progression at a molecular level. Recognition of therapy-related acute leukemia, resulting from previous treatment for other malignancies, highlights the need for judicious therapeutic planning, grasping personalized risk assessments and monitoring to prevent secondary leukemogenesis. Cutting-edge metabolomics research is revealing leukemia's distinct metabolic profiles, where aberrant metabolic pathways not only drive leukemic cell survival but also present opportunities for therapeutic interventions targeting critical metabolic vulnerabilities. '26. Investigative efforts are unraveling how the immune system's evasion by leukemic cells relies on down-regulating checkpoint molecules. Thus, therapeutic strategies rekindling anti-leukemic immune responses are being refined to overcome immune escape mechanisms. '27. For adolescent leukemia survivors, long-term follow-up care is critical, given the potential for late effects such as secondary cancers, cardiac dysfunction, or cognitive impairment, necessitating comprehensive survivorship programs that address these diverse health challenges. '28. Exploring the interplay between leukemia and the central nervous system is crucial, as certain leukemias demonstrate proclivity for CNS invasion. Lumbar puncture and prophylactic CNS-directed therapies are integral to preventing neurological manifestations and relapses. '29. Investigating the therapeutic potential of bispecific antibodies in leukemia involves engineering molecules that simultaneously bind to leukemic cells and T cells, harnessing the immune system for precise targeting and elimination of malignant hematopoietic cells. '30. Advances in leukemia diagnostics incorporate liquid biopsy technology, allowing non-invasive detection of circulating tumor DNA and clonal evolution monitoring in plasma, providing real-time data for early relapse identification and therapeutic decision-making. '31. Leukemia pathophysiology often involves recurrent cytogenetic abnormalities, such as translocations or inversions, which lead to the creation of fusion genes. These genetic markers are pivotal in subclassifying leukemias and tailoring targeted treatments. '32. Research in leukemia explores the implications of clonal hematopoiesis of indeterminate potential, where certain mutations might predispose individuals to malignant transformation, spotlighting the need for heightened surveillance and preemptive therapeutic considerations. '33. In the context of leukemia, investigating the efficacy of kinase inhibitors inhibiting dysregulated signal transduction pathways holds promise, as exemplified by drugs targeting the JAK-STAT and PI3K, AKT pathways present in multiple leukemias. '34. The microbiome's influence on leukemia progression and treatment response is an emerging front in oncological research, with symbiotic bacterial communities impacting drug metabolism and immune modulation, necessitating further exploration to enhance therapeutic regimens. '35. Incorporating patient-reported outcomes into leukemia clinical trials provides rich insights into the impact of therapies on symptom burden and quality of life, fostering a more holistic understanding of patient-centered care and informed decision-making. '36. The role of the bone marrow niche microenvironment in leukemia has prompted research into therapies disrupting interactions between leukemic cells and supportive stromal components, aiming to increase the efficacy of conventional chemotherapeutic regimens. '37. Understanding pharmacokinetics and pharmacodynamics in leukemia therapy guides dosing regimens and toxicity management, ensuring that therapeutic concentrations are achieved without incurring unacceptable side effects, hence enhancing treatment outcomes. '38. Recent strides in immunophenotyping have advanced the identification of leukemia subtypes, with specific antigen expression profiles guiding targeted treatment options such as monoclonal antibody therapies, elevating precision medicine in hematology. '39. Hematologic support in leukemia consists of transfusion strategies for managing cytopenias, wherein red blood cells and platelets are administered to prevent bleeding complications and alleviate anemia-related symptoms, contributing significantly to patient management. Exploring the genetic landscape of leukemia uncovers actionable mutations, with collaborative databases pooling genomic information to identify mutation-driven treatment options, thereby advancing the goal of precision oncology for leukemic patients. 41. The paradigm shift in understanding leukemia has brought focus to the relevance of patient psychosocial dynamics, with psychological support interventions playing a vital role in mitigating the emotional impact of diagnosis and treatment, aiding overall healing. Investigations into lifestyle modifications as adjunctive measures in leukemia management propose strategies to bolster general health, mitigate comorbid conditions, and possibly modulate cancer progression through diet, exercise, and stress management routines. Molecular targeted radiotherapy in leukemia utilizes radio-labeled molecules binding selectively to leukemic antigens, enabling precise delivery of radiation to cancerous cells while minimizing damage to healthy tissue, heralding a new era of radiotherapy precision. Understanding cytokine release syndrome, a notable adverse effect associated with leukemia immunotherapies like CAR T-cells, is crucial. Careful monitoring and management, often with corticosteroids or cytokine inhibitors, ensure this potent treatment remains viable. Leukemia treatment resistance is an ongoing challenge, with research into mechanisms such as efflux pump overexpression and altered drug metabolism informing development of novel agents capable of overcoming these defenses to enhance patient responses. The advent of transcriptomics in leukemia research reveals the comprehensive gene expression profiles characteristic of each leukemia subtype, offering insights into disease biology and opportunities for discovering new molecular targets for therapeutic exploitation. The identification of leukemia stem cell markers such as CD123 has prompted a wave of immunotherapeutic strategies, with agents aimed at these markers showing promise in eradicating the putative roots of leukemia, thereby reducing recurrence rates. Understanding the prevalence and impact of acute leukemia in aging populations has underscored the need for geriatric-focused treatment protocols that maximize therapeutic benefit while accommodating the physiological vulnerabilities inherent in older adults. Advancements in cryopreservation and expansion of hematopoietic stem cells offer new possibilities for leukemic patients lacking suitable donors, enhancing the accessibility and success rates of stem cell transplants, particularly for minority populations. The exploration of leukemia in rare genetic disorders like Fanconi anemia emphasizes the complexity of carcinogenesis within a context of genetic instability, guiding innovation in genetic therapies and personalized treatment strategies that address the multifaceted nature of these cases. Parkinson's disease is a progressive neurodegenerative disorder characterized by the loss of dopaminergic neurons in the substantia nigra, leading to motor symptoms such as bradykinesia, rigidity, resting tremor, and postural instability, but also encompassing a wide range of non-motor symptoms that can significantly impair quality of life. The hallmark pathological feature of Parkinson's disease is the presence of Lewy bodies, which are abnormal aggregates of the protein alpha-synuclein that accumulate within the remaining dopaminergic neurons, causing cellular dysfunction and death over time. 3. Although the exact etiology of Parkinson's disease is not fully understood, it is believed to result from a combination of genetic and environmental factors, with certain genetic mutations, such as those in the SNCA, LRRK2, and Parkin genes, increasing the risk of developing the disorder. 4. Diagnosing Parkinson's disease primarily involves clinical evaluation, with neurologists relying on a comprehensive assessment of the patient's medical history and a neurological examination, since no definitive laboratory tests or biomarkers currently exist to confirm the diagnosis. 5. The cardinal motor symptoms of Parkinson's disease, such as tremor, occur due to dopamine deficiency in the striatum, which disturbs the balance between direct and indirect pathways in the basal ganglia, thereby impeding the regulation of movement and motor control. 6. Levodopa is considered the gold standard treatment for managing Parkinson's disease symptoms. It effectively replenishes dopamine levels in the brain but may lead to complications such as motor fluctuations and dyskinesias after prolonged use. 7. Dopamine agonists, like pramipexole and ropinirole, are commonly used in the management of Parkinson's disease, particularly in younger patients, as they stimulate dopamine receptors directly and can delay the need for levodopa, albeit with the risk of side effects such as impulsive behaviors. 8. Monoamine oxidase B inhibitors, such as rasagiline and selegiline, are used in Parkinson's disease to extend the action of dopamine by preventing its breakdown, thus providing modest symptomatic relief and potentially exerting neuroprotective effects. 9. Deep brain stimulation is a surgical intervention used in advanced Parkinson's disease where electrodes are implanted in specific brain areas, such as the subthalamic nucleus, to modulate electrical signaling, thereby alleviating motor symptoms and reducing medication requirements. 10. Non-motor symptoms of Parkinson's disease are diverse and can include sleep disturbances, autonomic dysfunction, neuropsychiatric issues like depression and anxiety, and cognitive impairment, all of which require comprehensive management tailored to the individual's needs. 11. The progression rate of Parkinson's disease can vary widely among individuals, influenced by factors such as age at onset, presence of additional comorbidities, and the subtype of Parkinsonism, with some patients experiencing rapid deterioration and others maintaining function over many years. 12. Differential diagnosis is crucial as several conditions might mimic Parkinson's disease, including essential tremor, multiple system atrophy, progressive supranuclear palsy, and drug-induced Parkinsonism, each requiring distinct treatment approaches. 13. Exercise and physical therapy play a vital role in the management of Parkinson's disease, as regular physical activity can improve mobility, flexibility, balance, and overall quality of life while potentially slowing the progression of motor symptoms. 14. Diet and nutrition may impact Parkinson's disease, with recommendations often including a balanced intake of nutrients, adequate hydration, and, sometimes, specific dietary adjustments to optimize medication absorption and alleviate gastrointestinal symptoms. 15. Constipation is a common non-motor symptom in Parkinson's disease due to autonomic nervous system dysfunction, and it can be effectively managed through dietary fiber, hydration, and sometimes the use of laxatives or prokinetic agents. 16. Anosmia, or loss of sense of smell, is frequently one of the earliest signs of Parkinson's disease, often preceding motor symptoms by several years, and may serve as a potential early biomarker for the disorder's prodromal phase. 17. Speech and swallowing problems, such as hypophonia and dysphagia, are common in Parkinson's disease and result from bradykinesia and rigidity affecting the muscles involved in speech production and the coordination of the swallowing reflex, necessitating speech and language therapy interventions. 18. Orthostatic hypotension is a significant autonomic issue in Parkinson's patients, characterized by a drop in blood pressure upon standing that can lead to dizziness or fainting, and may require treatment with mineralocorticoids, vasopressors, or non-pharmacological measures like compression stockings and increased salt intake. 19. Cognitive decline in Parkinson's disease, ranging from mild cognitive impairment to Parkinson's disease dementia, is associated with various factors such as age, disease duration, and the presence of Lewy body pathology, often affecting executive functions and visual spatial abilities. 20. REM sleep behavior disorder, characterized by the loss of normal muscle atonia during REM sleep, is a common premotor symptom of Parkinson's disease, leading to vivid dreams and enactment of behaviors that may be predictive of future neurodegeneration. 21. Fatigue is a prevalent and disabling non-motor symptom in Parkinson's patients, often unrelated to disease severity, requiring a multidisciplinary approach for management, including medication adjustments, sleep optimization, and psychosocial support. 22. Urinary dysfunction, including frequent urination, urgency, and incontinence, occurs due to both central and peripheral nervous system involvement, often requiring urotherapy, medications, or incontinence aids to improve the patient's quality of life. 23. Impulse control disorders, such as compulsive gambling, shopping, or eating, may arise in Parkinson's disease as side effects of dopaminergic treatments, particularly dopamine agonists, necessitating careful monitoring and possible adjustments to therapy. 24. Depression and anxiety are frequently comorbid with Parkinson's disease due to the neurochemical disruptions caused by dopamine deficiency and changes in serotonergic and noradrenergic pathways, often managed with a combination of pharmacotherapy and psychotherapy. 25. The Braak hypothesis suggests Parkinson's disease progression follows a predictable pattern, starting in the lower brainstem and olfactory bulbs before advancing to the substantia nigra and eventually the neocortex, correlating with the emergence and progression of clinical symptoms. 26. Neuroimaging techniques such as MRI and PET scans can aid in differentiating Parkinson's disease from other atypical Parkinsonian disorders, with PET scans particularly useful through visualization of presynaptic dopaminergic neuron function. 27. Apathy, or a lack of motivation, is a common yet often overlooked non-motor symptom of Parkinson's, distinct from depression, which can significantly impair daily functioning and may respond to dopaminergic treatment or psychostimulants. 28. Genetic testing can be informative in familial Parkinson's cases, especially when mutations in genes like LRRK2, PARK7, and PINK1 are suspected, although most cases remain sporadic with multifactorial inheritance patterns. 29. Pain is an underappreciated symptom in Parkinson's disease, with patients experiencing musculoskeletal, dystonic, or central pain syndromes, often requiring a multifaceted approach to management, including optimization of dopaminergic medications and analgesics. 30. Neuroprotective strategies in Parkinson's disease research aim to slow or halt disease progression, with ongoing exploration of agents such as antioxidants, anti-inflammatory drugs, and neurotrophic factors, although no definitive neuroprotective treatment has yet been established. 31. Safety and fall prevention are critical considerations in Parkinson's disease care, given the increased risk of falls due to balance dysfunction and orthostatic hypotension, necessitating regular evaluations and interventions such as home modifications and assistive devices. Parkinson's disease can impact vision, with issues such as blurred vision, difficulty with contrast sensitivity, and abnormal eye movements arising from functional changes in the basal ganglia and dopaminergic pathways involved in ocular motor control. Gait difficulties in Parkinson's, characterized by shuffling steps and stooped posture, are primarily a result of impaired automaticity of movement, often addressed through cueing strategies, physiotherapy, and medication adjustments to improve locomotion. Despite being a movement disorder, Parkinson's disease also disrupts other neurotransmitter systems, including serotonin, norepinephrine, and acetylcholine, contributing to the diverse array of motor and non-motor symptoms experienced by patients. The Unified Parkinson's Disease Rating Scale, UPDRS, is a widely used clinical tool that evaluates motor and non-motor experiences of daily living, as well as medication complications, providing a comprehensive overview of the disease's impact on an individual. Freezing of gait, a sudden, temporary inability to move the feet, is a common and challenging motor symptom in Parkinson's disease, often triggered by environmental factors or stress, and managed through physical therapy techniques and cueing devices. Sensory symptoms in Parkinson's disease, including paresthesia and pain, may result from central and peripheral nervous system changes, necessitating careful differentiation to tailor appropriate treatment strategies, often involving medications and complementary therapies. Swallowing difficulties due to Parkinson's are rooted in impaired coordination and weakening of the oropharyngeal muscles, posing a risk for aspiration and necessitating dietary modifications, swallow therapy, and sometimes medical interventions like feeding tubes. Parkinson's disease is traditionally categorized into different clinical subtypes such as tremor dominant and akinetic rigid, each associated with distinct progression patterns, response to treatment, and prognosis, emphasizing the need for personalized management approaches. Olfactory testing is sometimes employed in Parkinson's disease assessment, given that olfactory dysfunction often precedes motor symptoms, with tests such as the University of Pennsylvania Smell Identification Test, UPSIT, potentially aiding in early diagnosis. Bradykinesia, or slowness of movement, is a core symptom of Parkinson's disease resulting from dopaminergic depletion in the motor circuit and is typically assessed through observation of tasks such as finger tapping and hand movements during a neurological exam. The role of inflammation in Parkinson's disease pathogenesis is gaining attention, with evidence suggesting neuroinflammatory processes may contribute to neurodegeneration, prompting research into anti-inflammatory treatments as potential therapeutic avenues. The concept of levodopa-sparing strategies involves using non-levodopa treatments such as MAO-B inhibitors or dopamine agonists in the early stages of Parkinson's to potentially delay the onset of levodopa-induced motor complications and maintain therapeutic efficacy. Dopamine transporter imaging, using single-photon emission computed tomography, SPECT, can serve as an adjunct diagnostic tool by providing visual evidence of presynaptic dopaminergic neuron integrity and aiding differentiation among Parkinsonian syndromes. Gastrointestinal motility issues, including delayed gastric emptying, gastroparesis, complicate medication management in Parkinson's, as they can affect the absorption and effectiveness of oral medications like levodopa, necessitating specific dietary and pharmacological strategies. (46) The role of coenzyme Q10 and other dietary supplements as potential disease-modifying therapies in Parkinson's disease remains an area of active investigation, with mixed evidence regarding their efficacy in slowing disease progression or improving symptoms. 47. Advanced Parkinson's disease treatments may involve the use of continuous drug delivery systems, such as levodopa-carbidopa intestinal gel or apomorphine infusion, to provide steady drug levels and reduce motor fluctuation severity in patients with complex disease. (48) Parkinson's disease research is exploring gene therapy approaches, such as the delivery of genes encoding neurotrophic factors or enzymes that synthesize dopamine, with the aim to restore dopaminergic function and provide long-term disease modulation. (49) Impaired facial expression, or hypomimia, in Parkinson's disease results from bradykinesia affecting facial muscles, leading to a reduced ability to convey emotions and impacting social interactions, often ameliorated by ensuring optimized dopaminergic therapy. (50) The psychosocial impact of Parkinson's disease is profound, affecting not only the patients but also their caregivers, with challenges that include coping with loss of autonomy, financial strain, and social isolation, requiring comprehensive support networks and resources. (1) Chronic obstructive pulmonary disease, COPD, is primarily caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. It is characterized by restricted airflow and inflammation in the airways, leading to symptoms such as shortness of breath, chronic cough, and sputum production, and is diagnosed using spirometry, which measures the volume of air the patient can exhale in 1 second. (2) Asthma is a chronic respiratory condition marked by recurrent episodes of wheezing, breathlessness, chest tightness, and coughing, typically triggered by allergens, cold air, exercise, or stress. It involves airway inflammation, hyperreactivity, and reversible airflow obstruction, and is diagnosed with lung function tests that show variable airflow limitation. (3) Pulmonary embolism is a blockage in one of the pulmonary arteries in the lungs, typically caused by blood clots that travel to the lungs from the legs or other parts of the body. Deep vein thrombosis. Symptoms include sudden shortness of breath, chest pain, and a rapid heartbeat, and diagnosis often involves a CT pulmonary angiogram. (4) Pneumonia is an infection that inflames the air sacs in one or both lungs, which may fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. It can be caused by a variety of organisms, including bacteria, viruses, and fungi, and is often diagnosed with chest X-rays and sputum tests. (5) Tuberculosis (TB) is a potentially serious infectious disease that mainly affects the lungs, spread through inhalation of airborne particles released from an infected individual, and is characterized by cough, chest pain, weight loss, night sweats, and fever. Diagnosis usually requires a skin test, blood tests, or culturing bacteria from clinical specimens. (6) Interstitial lung disease, ILD, encompasses a large group of disorders characterized by progressive scarring of lung tissue, leading to irreversible lung damage, reduced oxygen exchange, and symptoms such as a dry cough and shortness of breath. Diagnosis often involves a high-resolution CT scan and lung biopsy to assess the pattern of fibrosis. (7) Bronchiectasis is a chronic condition where the walls of the bronchi are thickened from inflammation and infection, leading to persistent cough, large amounts of sputum, and recurrent chest infections. Diagnosis typically involves a high-resolution CT scan to visualize dilated airways and assess the extent of lung damage. 8. Cystic fibrosis is a genetic disorder that affects mostly the lungs, leading to thick, sticky mucus production that can clog the airways, resulting in persistent lung infections and declining respiratory function. Diagnosis is confirmed with a sweat chloride test and genetic testing for mutations in the CFTR gene. 9. Idiopathic pulmonary fibrosis, IPF, is a type of chronic, progressive interstitial lung disease characterized by a gradual scarring of lung tissue, which leads to a persistent cough and worsening shortness of breath. Lung biopsy or high-resolution computed tomography, HRCT, are often used to diagnose this condition and differentiate it from other interstitial lung diseases. Acute respiratory distress syndrome, ARDS, is a severe lung condition occurring when fluid fills up the alveoli in the lungs, leading to severe shortness of breath and respiratory failure. It can be caused by a variety of factors, including trauma, sepsis, and pneumonia, and is diagnosed by clinical symptoms and imaging studies showing bilateral lung infiltrates. Pleural effusion is the accumulation of excess fluid between the layers of the pleura outside the lungs, which can cause respiratory distress, chest pain, and cough. Potential causes include congestive heart failure, pneumonia, and malignancies, and it is diagnosed with imaging such as chest X-ray or ultrasound and confirmed by thoracentesis to analyze the pleural fluid. Lung cancer is a malignant tumor characterized by uncontrolled cell growth in tissues of the lung, often asymptomatic in the early stages but can eventually lead to a persistent cough, hemoptysis, chest pain, and weight loss. It is commonly diagnosed through imaging such as CT scans and confirmed by a biopsy to determine histological type. Obstructive sleep apnea, OSA, is a common disorder characterized by repetitive episodes of complete or partial upper airway obstruction during sleep, causing breathing disturbances, snoring, and excessive daytime sleepiness. It is diagnosed using polysomnography, which evaluates breathing patterns, oxygen levels, and heart rate during sleep. Legionnaire's disease is a type of pneumonia caused by Legionella bacteria, typically contracted through inhalation of aerosolized water containing the bacteria. Symptoms may include high fever, chills, cough, and muscle aches, and diagnosis is confirmed through urine antigen tests and cultures of respiratory secretions. Sarcoidosis is an inflammatory disease that affects multiple organs in the body, especially the lungs, characterized by the formation of granulomas, which can lead to cough, respiratory dysfunction, and fatigue. Diagnosis often involves a combination of clinical evaluation, imaging studies such as chest X-rays or CT scans, and biopsy of affected tissue. Pneumothorax occurs when air leaks into the space between the lung and chest wall, causing the lung to collapse, which results in sudden chest pain and shortness of breath. It can result from trauma, lung disease, or spontaneous causes and is diagnosed with a chest X-ray or CT scan that shows the presence of air in the pleural space. Respiratory tract infection is a group of infections of either the upper or lower respiratory tract, commonly caused by viruses such as rhinoviruses and influenza, leading to symptoms like sore throat, cough, fever, or difficulty breathing, and diagnosis is primarily based on clinical symptoms supported by laboratory tests when needed. Pulmonary hypertension is high blood pressure in the arteries of the lungs that can lead to right-sided heart failure. It presents with shortness of breath, fatigue, and chest pain, often requiring right heart catheterization for definitive diagnosis and echocardiography for initial assessment of pulmonary arterial pressure. Silicosis is an occupational lung disease caused by inhalation of silica dust, leading to inflammation and scarring of lung tissue, resulting in breathing difficulties and increased risk of tuberculosis. Diagnosis typically includes a history of occupational exposure, characteristic chest X-ray or CT findings, and pulmonary function tests. 20. Bronchiolitis, most commonly affecting infants and young children, is a viral infection primarily caused by the respiratory syncytial virus, RSV, resulting in inflammation and congestion in the bronchioles, with symptoms such as wheezing, cough, and difficulty breathing. Diagnosis is usually clinical but may include nasopharyngeal swabs to identify the virus. #21. Coal workers' pneumoconiosis, also known as black lung disease, is caused by long-term exposure to coal dust, leading to lung inflammation, fibrosis, and structural damage. Symptoms include chronic cough and shortness of breath, and diagnosis is typically made through occupational history, chest X-ray, and pulmonary function tests. #22. Pulmonary edema is a condition characterized by excess fluid in the lungs, causing difficulty breathing, coughing, and wheezing. It can result from left-sided heart failure, kidney failure, or acute respiratory distress, and is diagnosed based on physical examination, chest X-ray showing fluid accumulation in the lungs, and relevant laboratory tests. #23. Asbestosis is a chronic lung disease caused by inhaling asbestos fibers, leading to pulmonary fibrosis and increased risk of lung cancer and mesothelioma. Symptoms include shortness of breath and a persistent cough, and diagnosis relies on a thorough history of asbestos exposure, imaging such as chest X-ray or high-resolution CT, and lung function tests. #24. Pleurisy involves inflammation of the pleura, the membrane around the lungs, causing sharp chest pain that worsens with breathing, coughing, or sneezing. Potential causes include infections, autoimmune conditions, or pulmonary embolism, and diagnostic procedures include chest imaging to assess pleural thickening and laboratory tests to identify the underlying cause. #25. Croup is a viral infection of the upper airway, notably in children, resulting in swelling around the larynx, trachea, and bronchi, characterized by a distinctive barking cough, stridor, and hoarseness. Diagnosis is often clinical, based on the classic symptoms and presentation, with supportive care as the mainstay of treatment. #26. Chemical pneumonitis is inflammation of the lung tissue due to inhalation of irritants such as smoke, fumes, or vapors, which can lead to cough, difficulty breathing, and chest pain. Diagnosis relies on clinical history, imaging studies to assess lung inflammation, and exclusion of other causes of pneumonia. #27. Alpha-1 antitrypsin deficiency is a genetic disorder affecting the lungs and liver, due to lack of a protein that protects the lungs from damage, leading to emphysema and chronic obstructive pulmonary disease. Symptoms develop in adulthood and include progressive shortness of breath, and it is diagnosed by measuring serum alpha-1 antitrypsin levels. #28. Respiratory failure is a condition in which the respiratory system fails in oxygenation and/or carbon dioxide elimination, leading to hypoxemia and/or hypercapnia. It can be classified into type 1, hypoxemic, and type 2, hypercapnic, with diagnosis involving arterial blood gas analysis. #29. Aspiration. When a person in liquid or lungs, leading to inflammation, cough, fever, discomfort, and breathing, and diagnosis, clinical presentation factors, and images such as a chest X-ray infiltrates in the lung. #30. Thromboembolism involves action of the pulmonary artery, its branches by blood travel from the legs, and shortness of breath, pain, and potential complications. Tomography. Pulmonary is the most common confirming diagnosis. #31. Meniere's disease, a form of pneumonia caused by bacteria. Symptoms such as high fever and muscle aches, contracted by inhaling water droplets from cooling towers, and involves urine antigen culture of the bacteria secretions. (32) Often seen in is characterized by the of carbon-laden in the lung tissues to chronic coughing and irritation. Usually made through examination of lung characteristic black due to carbon deposit. Mycoplasma pneumonia. Walking pneumonia. Mycoplasma pneumonia, which causes mild symptoms such as headache and low. Diagnosis is supported by tests or PCR specific antibody of the bacteria. (34) Ecchymosis is a fungal caused by inhaling the Histoplasma capsulatum, rarely affecting the lung. Symptoms similar to including cough and fever. Diagnosis is confirmed serology or testing of respiratory to detect the presence of Klebsiella pneumoniae, a bacterial pathogen, form of atypical pneumonia. Clinical signs such as production of thick sputum and lung infection. It frequently individuals with weakened immunity diagnosed by organism from respiratory or blood sample. (36) The hantavirus pulmonale, HPS, rare respiratory disease. The hantavirus humans through contact, droppings, or infected rodents. Symptoms resemble flu, quickly progressing respiratory failure via serological identifying hantavirus. Alpha-1 antitrypsin deficiency is a genetic that leads to the development of chronic obstructive pulmonary COPD disease due to the lack of antitrypsin protein. Protects tissues from breakdown, diagnosing serum levels of and identifying genetic mutations. Allergic rhinitis, commonly known as HAPE, is an allergic response to airborne allergens. In symptoms like nasal, sneezing, and diagnosis is a combination of clinical evaluation, skin, and specific IgE to identify triggering. Tracheobronchitis, caused by viral infections, influenza or bacteria like Bordetella, is characterized by of the trachea and bronchi, leading to symptoms of persistent cough, sore, wheezing. Usually clinical. Throat swabs are cultured. Respiratory syncytial (RSV) is a common cause of tract infections in children. Bronchiolitis or pneumonia, characterized by cough, wheezing, and difficulty. Diagnosis is detecting the virus in nasal through rapid antigen or PCR. Lung can develop as a progressive process in the lungs, resulting from chronic to certain toxic infections or diseases, leading to restrictive lung disease. Diagnosis involves high-res computed tomography. Function tests reveal lung volumes. Gangliomyomatosis is a rare lung predominantly affects childbearing age by abnormal growth of cells in the lungs, cystic lung changes, and spontaneous cracks. The diagnosis is established through clinical imaging and tissue to observe characteristics. Chronic bronchitis, part of the chronic obstructive pulmonary disease spectrum, involves long-term inflammation of bronchi, leading to symptoms such as a persistent cough and shortness of breath, usually diagnosed Evaluating the chronicity of pulmonary function test, airflow obstruction. Pulmonary proteinaceous accumulates in the alveoli, showing characterization of lung tissue sample. 5. Pertussis, known as whooping cough, contagious bacteria by Bordetella pertussis, characterized by severe fits followed by a whoop sound. Involves nasopharyngeal samples for culture or testing to detect the bacteria, with vaccination as a strategy. (46) Alveolar hemorrhage syndrome, of diseases leading into the alveoli, like cough, hemoptysis, respiratory distress disorders. Diagnosis bronchoalveolar imaging studies to establish an extent of alveoli. The common cold infection of the upper respiratory tract caused by numerous adenoviruses, symptoms such as nasal, sore throat, and diagnosis is general without the need for tests unless conditions such as inflammation. Wegener's granulomatous, now known as granulomatous is a disorder that causes inflammation of blood vessels, respiratory tract, and other organs, producing symptoms like cough, sinusitis, and hemoptysis. Diagnosis is neurological. Tests for plasmic ANCA, set of fever with potential. Diagnosis is often during 50. Emphysema, a type of COPD, involving the alveoli and some of lung elasticity. The symptoms like shortness, limited exercise tolerance, caused by smoking, typically involves pulmonary, showing reduced airflow, alongside imaging CT scan. One. Chronic obstructive is a group of progressive emphysema and primarily associated characterized respiratory symptoms in airway and or alveoli, usually caused by significant particles or gases. To advise early lifestyle modification. Spirometry is a test for COPD, measurement of forced expansion, 1 second, FEV capacity, FEV1, F less than 0.7 dilator, confirming rotation indicative of thus differentiating it from respiratory conditions. A form of destruction of the alveoli, reducing the surface area exchange, which leads to shortness of breath and barrel-shaped examination, high lung volume reduction, cessation in pulmonary. Chronic bronchitis, COPD, is of cough lasting 2 consecutive years, and hyperplasia of in the airways leading to production, obstruction, and a higher susceptibility to infections, thereby vaccination adherence, treatment of infection. The pathophysiology involves chronic airways, parenchyma, lung tissue, driven and other environmental pollutants, reinforcing the importance of environmental control measures, particularly in occupational settings. Six, Project management of COPD primarily involve dilators such as beta-agonists and anticholinergics, which work by relaxing smooth muscles and improving respiratory flow, in combination with steroids in patients with exacerbations, inflammation in the frequent episodes, aiming at symptom control and quality. Inhaled long-acting muscarinic antagonists are effective components of COPD therapy. Long bronchodilation relief by blocking muscle receptors in the airways, which reduces the exacerbations and flow, thereby becoming a cornerstone in the treatment of severe COPD. Eight, corticosteroids are common in acute exacerbation of COPD to reduce inflammation and hasten recovery, though their use should be limited to courses due to potential effects like osteoporosis or glycemia. The importance of monitoring these risks in long-term COPD care. The use of oxygen therapy COPD patient hypoxemia meeting below or low, underscoring regular arterial blood balance. Pulmonary rehabilitation, integral part of COPD management, combining training, education, behavioral changes to physical and psychological people with COPD, enhancing their overall life and reducing the and severity of exacerbation through personalized care. Alpha-1 antitrypsin is a genetic risk of COPD, as younger patients are non-presenting with early onset asthma, marking the familial screening and benefit of augmentation plasma purified 1 antitrypsin to progression. Nutritional vital in COPD, as malnutrition are common concern, increased metabolic demand, appetite from so maintaining a balanced, adequate caloric and protein intake is emphasized to optimize pulmonary function and smoking cessation, effective intervention in the progression of COPD and can lead to significant in lung function over making support programs, counseling, and pharmacotherapy such as nicotine replacement, clean critical component management. COPD exacerbations are episodes of worsening respiratory with increased frequency, severity, or production, often triggered systemic corticosteroids if indicated, hospital admissions and outcomes. The BOX, which evaluates airflow of dyspnea and capacity, is a multiple scoring system used in predicting the prognosis of patients by clinical parameters to guide decisions and discuss disease progression and chronic inflammation. COPD contributes to effects such as skeletal dysfunction, cardiac disease, and osteoporosis, requiring a multi approach for management, including regular monitoring, pharmacotherapy, style interventions, of comorbid conditions. Regular vaccine against influenza and new pathogens is recommended in COPD patients to risk of respiratory infection can lead to exacerbation, hospitalization, mortality, reinforcing healthcare providers to prioritize immunizations of comprehensive COPD. Eight, psychological distress among COPD with depression and anxiety significantly affecting their life and disease outcomes, the necessity of routine health evaluations and of appropriate support or pharmacotherapy needed to address these issues. Inhaler technique is COPD management. Proper use can lead to drug delivery and poor control, emphasizing regular assessment and patient on correct inhaler to ensure maximum benefit from prescribed medicines. Nebulized drugs offer an alternative to patients struggling with inhalation, provided through a fine mist. Inhale, particularly individuals with severe disease exacerbations, adequate drug deposition relief. Dyspnea of breath is a hallmark of COPD, perceived as a constant or air hunger by patients. Warrants timely assessment differentiate from other potential, ensuring target like pulmonary rehabilitation and optimized pharmacotherapy implemented to enhance comfort and function. Lung decline in COPD gradually with annual in FEV1 exceeding those seen with normal, thus highlighting the early detection, monitoring, and strategies to slow progression and preserve lung. The Global Initiative for Obstructive Lung Disease guidelines provide a classification system for COPD severity based on the degree of limitation of exacerbations and reported symptom burden, providing the tailored non-pharmacological approaches for individual. Airway clearance technique. Physiotherapy in the cases like the flutter valve are beneficial for patients with chronic reduction, facilitating clearance and improving, hence preventing infections and improving function. Endoscopic volume reduction procedure. Endobronchial valve offer an innovative option for patients with edema, aiming to inflated lung compartment, respiratory mechanics, enhancing exercise, pulmonary function of life. Genetics alongside environmental factors contribute to COPD development, with specific genetic influencing susceptibility to disease, which have potential for identifying individuals and developing prophylactic or therapeutic strategies through personalized. Breathlessness, physical inactivity, COPD patients, a deconditioning cycle, symptoms and disease out, thus highlighting the importance of individualized exercise within pulmonary rehabilitation to break this cycle, better health and functionality. Comorbid cardiovascular disease, diabetes and with complicating comprehensive current conditions. 29. Exacerbations in COPD, characterized by a of symptoms, are memorial, with a large attributed to respiratory and environmental pollution, necessitating rapid preventive strategies, medications and life actions to reduce their occurrence. 30. COPD's economic significant impact systems due to hospital medication cost productivity, the importance of effective management and patient education alleviate the financial associated with chronic disease. Function tests like diffusion for carbon monoxide CO, providing gas exchange efficiency COPD, which can differentiate emphysema pathologies and tailor strategies to the specific physiological impairments present in the patient. Air pollution and environmental risk. COPD exposure to pollutants like matter and ozone systems underscore strategies to minimize exposure and mitigate the effects of poor air quality in populations. Exists between COPD exhibiting characteristics working synergistic quality of life and severity.